very good evening to all of you. So today we have come together again to continue with the class of the organ. So there was one question, and some of the one of the doctors they also notified that we have left the footnote of aphorism 46 because I think at that time due to some mistake in the language we were not able to complete it. So first we will do the footnote to aphorism 46, and then there is a question regarding the thing about the similar this phenomena that the like cured similia similibus curantur, that the similars are cured by the similar. So from there is a question that about using disease to treat disease. Can we make nosodes of various diseases such as itch, measles, the same way we make tuberculinum, bacillinum? With this way, we can manage the potency. So first, I will start with the answer to this question because it is a natural thing, when you are thinking about the examples which Dr. Henneman has given, that when the itch, a person suffered from the itch disease, the many of his symptoms they got cured. Now, there are two things to understand here. One thing is that Dr. Henneman is giving examples of naturally occurring cures of some symptoms, not of the patient. Nowhere he has mentioned that the patient got cured, but some of his symptoms they got cured. Even in the footnote to aphorism 46, which we will discuss, he's mentioning about the same thing, which regarding this question, that it is not that after coming of itch all the disease was gone, the whole of the disease was gone. No, it was only that few symptoms were gone. And regarding this thought, regarding this query of making the nosode of various disease such as itch, measles, that will we be able to cure this thing? Let me tell you that the carcinosin and the carcinosin, a nosode which is made from the breast cancer, from the this discharge of the breast cancer, has a very bad record of curing breast cancers. I had three cured cases of breast cancers. I'm not telling these remedies so that you start thinking that these are the remedies for breast cancer. I'm just telling you that none of the cured cases which I have seen in my clinic, in my father's clinic, even in Dr. Vijayakar's clinic, or all the people who I know where the breast cancer was cured, there is not even a single case of carcinosin curing a breast cancer. You might have seen cases where the carcinosin decreases the speed of cancer. It might give it a halt. It might slow down the process, but curing, I'm talking about curing. I'm not talking about the palliation part. So I have three cases which are cured of breast cancer, completely cured. One was cured by pulsatilla, one with CP, and one with sulfur. So if we go with the thinking, why this thing fails? You will find very few cases which will be cured of tuberculosis by tuberculinum. Very few cases. Why this thing is? Because it's a simple thing. When we are thinking that, okay, let's take some part of the disease and make a remedy and then give it. Similarly, you are just taking a part of the disease. The disease is Sora, which is in itself of dynamic origin. But if we are thinking that taking some matter from that diseased part, just a part of the disease, very small part of the disease. When someone is suffering from tuberculinum, he is not, the problem is not tuberculinum. We do not go with the approach of curing tuberculosis. Sorry, problem is not tuberculosis. We don't go with the approach of curing tuberculosis. We go with the approach of curing the patient. Until and unless we differentiate between these two things, the patient and the disease, okay, you can make a nosode of a disease, a very small part of disease, but you cannot make a nosode for the patient. Patient is sick. Patient is sick. This is the matter which we are talking about, making a medicine out of matter. A very, very impractical process. And the matter which we are taking is a very small part of his whole disease. Very small part of his whole disease. That is why the vaccinations fail. A few days back, I had a patient. He was an aged, somewhat old in his age, and he had polio. So just out of the curiosity, I inquired that whether he had the vaccination, he had taken the vaccination of polio or not. He said, I got polio mellitus after polio vaccination. So these things, this kind of approach, okay, in theory, it might seem a good approach. But when you go more deep into it, the matter is not the causation of the disease. In homeopathy, we are going after the causation. What is the cause of the disease? Actual cause, the dynamic cause. So until and unless we go away from that thinking of matter, we will not be able to understand these therapeutic law of nature, or we will be confused. We will only understand the half part of it. Right? So regarding all this thing that again, and another thing, Dr. Hanneman, we have also done this in the footnote to aphorism 22. You can refer it back if you want. That all these kind of things, Dr. Hanneman is saying that vital force is basically reacting. It is reacting to some stimulant. Okay, all the symptoms are the reaction of the vital force. Their reactions, and it is a very imperfect way of reacting. He has clearly written that the vital force way of reacting is a very imperfect way. And if you want to copy that imperfect way to cure a patient, then that will be a very illogical thing to do. That will be a very illogical thing to do. So, homeopathy, even if you go to the therapy, let's go to the therapy. There is a very clear, that is why I say that when Dr. Hahnemann Wright has written these things, he was so much clear. He knew that we homeopaths, his students, these kind of questions are going to come in our minds. So he has given in his aphorisms all the answers to these things. We'll go back to aphorism 26, the therapeutic law of nature, and we'll talk about one thing. Hmm. So this is the from where the similia similibus current or that thinking came, that a weaker dynamic affection is permanently extinguished in the living organism by a stronger one. So the new thing or the similar disease has to be a stronger one. If the latter means the stronger one, while differing in kind, it has to differ in kind. Differ in kind means it cannot come from the same source. The source has to be different. Although coming from a different source, it produces a same kind of affection. Is very similar to the former in its manifestations. Okay. So if we are talking about the same source, even if you start, although when you start, when you go by this logic, or when you go by this explanation that we are just taking a small part of the disease and trying to put it back in the patient, this will not cure the whole disease. It might cure few symptoms which are associated with disease, but not the whole patient, because the affection is basically dynamic. But again, if you add this part also, then the stronger dynamic affection has to come from a different source. It has to be of a different kind. It cannot be of the same kind. If something dynamically has affected our GIT and caused some vomiting or diarrhea, and then there is desire for small sips of cold water, then it will not be a logical thing to take some vomiters and potentize it and give it back, because vomitus is basically a very small part of the whole disease. The whole man is affected. So I have to, out of all the medicines, I have to find a remedy which can affect the whole man, so that the whole man can be cured. Because his symptoms are telling us about the man, that this man in his state of vomiting or diarrhea, although I might give it a name of cholera, but there's a specificity that he wants cold water in very small sips and very frequently. But if I think about taking the vomitus and then dynamizing it and then giving the dose out of it, it might cure the vomiting part, but it will not cure the whole man. It might stop it for some time, because disease is not coming from only GIT. It is coming from everywhere. When a man is sick, the whole man is sick. It is not only one part that he's sick about. The whole man is suffering. So that is the reason that we cannot go with these kind of things. Even the midorhinum or tuberculinum or all the nasod, the sorinum, give sorinum to a patient with itch. You will never get any result. You will never get any result. It might subside it for some time. Many times it will not even work. Even sulfur works much better than sorinum in skin diseases. Yeah, sorinum has its own kind of personality, its own kind of constitution. When all those things are there, sorinum will work, but otherwise it will not work. Okay. So next was that we have left this footnote to aphorism 46. So the footnote is about the similar examples where the disease, the nature has cured homeopathically in the nature, not by some medicine, but in the nature, the cures were seen by a homeopathic way. So there is a footnote to that thing. The examples adduced in this place means the examples which he has given in this particular aphorism in the former editions of the organon, except the last, and in the former editions of the organon, in first, second, and third, except the fourth one, of chronic maladies cured by the itch, can, according to the discoveries and explanations I had given in the first part of my book in chronic diseases, be looked upon as only in a certain degree homeopathic cure. This is what was talking about. The Dr. Haniman knew that these kind of questions will come into our mind, so he has already given this explanation that even in my book of chronic diseases or in this part or in the previous editions, I have given few examples where the nature has cured homeopathically, or these are the discoveries or explanations which he has given, but they should be looked as only in a certain degree homeopathy. They are not complete homeopathic cures, but in certain degree. Few symptoms were cured by these kind of diseases because these diseases were commonly seen producing such kind of symptoms. So he was just giving us an explanation, an example of what is occurring in nature also. And if we can understand that part of the nature, if we can understand that law of the nature, then we can develop a science based on that thing, which can actually give cures to the patients. The great maladies which thereby disappeared. So he's saying in that those natural cures, the cures which occurred in the nature, by the natural nature, suffocating asthma of many years standing and pulmonary thysis were themselves originally of psoric origin. So all these great things, even he has given the cases where asthma of many years, or a case of pulmonary thysis, they were cured. So their symptoms of this thing were cured by these things, but they were actually of psoric origin. But Sora was never cured. The symptoms were cured. Widely spread life-threatening symptoms of an ancient Sora that had been fully developed in the interior of the system. So we were getting the life-threatening symptoms of Sora, which were cured by these kind of diseases when patients suffered from these diseases, which was again transformed into the simple form of primitive itch disease. So they got transformed into a simple form of the disease, but it was never cured. This is what we need to understand, that it basically brought it back to some simpler form. These things happening, but they were never cured. Form of primitive itch disease by the cutaneous eruption resulting from the new infection. So, from a new infection, a cutaneous eruption or some itch disease developed, which basically decrease the symptoms of the asthma and pulmonary pulmonary or many such kind of diseases in many patients. And it is very commonly seen if people they start having skin diseases of some kind. For example, if you look at the patients who are suffering from eczema or psoriasis or some chronic itch diseases, you will find very few patients who have some other diseases or symptoms. Although many kind of, like for example diabetes or hypothyroidism may develop later on because of the steroidal applications, but for many years you will find that they didn't had any kind of internal disease, no gastric problems, no urinary complaints. All those complaints will only develop after they start using something, and when they stop, the skin disease comes back, those symptoms will reside, they will subside. So from here also, this part, that when the disease is completely shifted to that cutaneous eruptions, the skin diseases, you will see that the whole disease from the internal side of the body, it is like kindly gone. But then again, saying that the patient got cured is not the right word here. The disease basically shifted to a more primitive form, as always happens in such cases, whereby the old malady and the dangerous symptoms were made to disappear. So the dangerous symptom that disappeared and it was basically converted back to the some kind of skin eruptions. Such a transformation into the primitive form is therefore only to be considered as a homeopathic healer of these extensive symptoms of highly developed ancient sora, in so far as the new infection puts the patient in much more favorable condition to be cured of the whole sora by antisoric medicines. Okay, so still you will need an antisoric medicine. Even if this thing happens naturally, still you will need an antisoric medicine. So to conclude the whole thing, even when these kind of things happens, although they're very rare, first of all thing, but rarely also when these kind of things happen, they basically can decrease or transfer the disease to a more simpler form. But curing the patient, the aphorism first and second, that cannot happen without an antisoric medicine, because sura is still there. It is still there. If it is not treated in a proper manner, then it will start taking some other forms. So again, coming back to the question, that making some nasod will not give us the answer, because it is not going to cure the patient. It might decrease some symptoms of the whole disease, but if you are decreasing some symptoms, then some symptoms in the other parts of the body, they will increase. That is the problem. If you cut one branch of the tree, some other branch or the leaves on some other branch will come keep coming up, because the root is still there. The root is still there. So I think I was clear enough for the question. If still there is some doubt, you can message me right now also, or you can message me afterwards also. So we'll start with our we have done till aphorism 53. We will start with aphorism 54. This, the homeopathic way, must moreover, as observed above, from aphorism 43 to 49, be the only proper one, because of the three possible modes of employing medicines in diseases. It is the only direct way to a mild, sure, permanent cure without doing injury in another direction. So, earlier he has talked about the three ways of employing the medicine, the contrary, the opposite way, the similar way, and the heterogeneous way. We have discussed about it. So he says that out of all these three methods, the possible methods, only the homeopathic mode, from, which we can see from all the examples given in the aphorisms, it seems that only the homeopathic way of employing the medicine is a mild, sure, permanent cure. It is the only way which can ensure that the patient gets permanently cured in a very mild and very sure manner without doing injury in any other direction, without getting any suppression, without getting any injury, without any new symptoms coming up, and without weakening the patient. And it is the only way where the patient does not get weakened because no new symptoms are coming. The disease is not progressing, it is decreasing. The pure homeopathic mode of cure is the only proper way, the only direct way, the only way possible to human skill, as certainly as only one straight line can be drawn betwixt two given points. So he's saying that from all the examples, from all the experience, from all the things we have talked about, the logic and the experience tells us about this thing, that the homeopathic way of prescribing medicine, it is the only way to cure. It is as certain as that a straight line can be drawn between two points. We cannot draw a different kind of line. So homeopathic way, like, so what are the three things which he has basically told us which are different from the other two methods is that one, it is a mild, sure, and permanent way. Many examples of the patients who say this thing, that once upon a time we took this medicine for this, we were suffering from this and we took a homeopathic medicine and we never suffered from it again. So many patients they tell about this thing. Then no injury or suppression of the disease. If you are giving the medicine in a proper way as it is described in a very small dose, there are no chances that it will cause any kind of injury to the patient or any kind of suppression. Okay, there are only chances of getting bad aggravation is when the dose is too large, when it is repeated too often. Otherwise, the medicine, it is so mild, so minute, so small that it cannot produce any kind of new symptoms. Then the most important part is that the weakening of patient does not happen. It is not that after your medicine, the patient will get more weak or the disease will start progressing. Most of the thing which can happen is that your medicine will not work. Even if it partially works, the homeopath, then even the patient will feel some amelioration. If it works completely simillimum, it is completely simillimum to the case, the patient will be very beautifully recover. He will or she will very beautifully recover from the disease. The last thing is that your medicine will not work. Even if it does not work, if it is completely dissimillimum to the case in front of you, then the disease will progress with whatever the speed it was progressing with. So on the other side, if you see that there is no harmful effect of this way of giving the medicine, because we are not palliating the disease, we are not, but it has to be with a homeopathic approach. Okay. See, I always say that the medicines are not homeopathic. Dr. Hahnemann has very beautifully said it is, there are different modes of employing medicines in diseases. Homeopathy is a mode of employing. So don't, many times the people, even the patients and the doctors, they get confused that we have given a homeopathic medicine. The homeopathic medicine is not homeopathic until and unless it is given in a homeopathic way. Homeopathy is a mode of giving the medicine. This, the homeopathic way. So homeopathic medicines are different thing. They can be given in an allopathic way also. They can be given to suppress also. They can be given to just for one symptom or two symptoms in a heterogeneous way, which we were talking about. They will only work when we are giving it in a homeopathy. If you are giving arnica for injury, many times you will find that you will not get any cure with that thing. Hypericum, arnica, you will not get Bellisp, symphytum. There was a case which mm, of Dr. Jonkol few, I think last year she discussed with me of such a case who had bursitis after the injury of a patient. And all these medicines were given because of the injury. And I think he was, maybe Dr. Jonkol can tell it in a more better way, because whatever I can recollect from my memory, from 6 or 7 months, he was not doing well. He had this formation of bursitis, which was not getting cured, and it was a very painful situation. And I think after taking, the other parts of the case, I think if I can remember correctly, we prescribed him Calcarea Phos, and he got much better after that. So, okay, arnica or symphytum or these things are homeopathic medicines, but they will only act or they will only cure when they are similar to the case. If we will give just with the this thing that okay, injury, give this first remedy. If it does not work, give the second remedy. If that does not work, then give the third remedy. No, then we are just kind of we are not doing it in a proper way. It is not out of 10, one may respond to the case or two may respond in this way, but that I will not say that homeopathy is made to cure two cases out of 10. Homeopathy is made to cure 10 out of 10 cases. And until unless we have that kind of vision, because to work on a path, you have to have a vision that I want to do this thing, that this should be my this destiny. I have to reach at that point. So whenever I talk, my goal is very clear that the we have to reach at that point where we are 100% accurate. If 100 patients come to me, I want 100 of them to get cured. I'm not happy with 90. I'm not happy with 95. I'm not even happy with 99. The 100 means 100 because we have a way. If with this way we can cure 6 patients, 7 patients, then why not 10? Why not? So it is very important to understand that homeopathy is a way of giving the medicine. So we should not get confused between the medicine being homeopathic, that it means that we are giving a it is giving we are giving in a homeopathic way. No, even only potentization of a medicine is not important. Even a potentized medicine will only work when we are giving it in a right way. That is the important thing to understand. Okay, those things are important. The small dose is important, but the primary principle is very important. The similia similibus currenter. It should match the whole. That is very important. Even if it is an injury, even if it is an eruption, it should match the whole patient. The aim is the patient, not his injury, not his eruption, not his cancer, not his tuberculosis, not his eczema. The aim is the patient. So moving forward to the aphorism 55, the second mode of employing medicines in diseases, the allopathic or heteropathic way, which without any pathological relation to what is actually diseased in the body, attacks the part most exempt from the disease. So he's saying that allopathic way, the heteropathic way, it is a very a, a different kind of way to treat the diseases because it does not do anything. It does not have any pathological relation. The medicine, they don't have any pathological relation to what is actually diseased, and attacks those parts which are exempt from the disease. Those parts where the disease was not even present, there were no symptoms. It attacks those parts in trying to cure the disease in order to draw away the disease through them and thus act to expel it. As is imagined, has hitherto been the most general method. I have treated of it above in the introduction and shall not dwell longer on it. He said that I have talked so much about this method in the introduction of the organon, and I will no longer talk on it. But I will give you an example. Many of the doctors present, they must have experienced this thing in their practices uh, because many medicines, when I see the medicines, I always look whenever there are patients, they are coming with a long list of medications, the allopathic medications which are they are taking. I always take the note of that how this medicine is basically working. So I'll just take an example of a medicine which is usually given for diabetes mellitus, teneligliptin. And it might be in some other form in Thailand or Brazil, but in India it is in the form of teneligliptin. So how it acts, the teneligliptin? Now, let's see. First, the problem, diabetes mellitus is the problem of beta cells of pancreas. So if we say that the disease basically belongs to the pancreas, and even in that, in the beta cells. But how this medicine acts is, this medicine does not act on pancreas or on the beta cells. This medicine basically acts as an inhibitor to DPP4 enzyme in the gut, in our intestines, even in the other parts, in kidney or in the liver also, we have DPP4 enzyme. And similarly, in the gut also, we have DPP4 enzyme. So what this medicine do is, it inhibits the DPP4 enzyme. It does not let it work. Now, what is the work of this enzyme is that this enzyme is a proteolytic enzyme. It basically helps in the lysis of the protein, breaking down of the proteins, and helps in protein digestion and metabolism. And after having meals, helps in increasing glucagon. Glucagon is a reverse uh, this what you can say hormone from the insulin. Okay, glucagon is basically released by our alpha cells of the pancreas for the glucogenesis. So basically, it inhibits the production of glucagon so that the glucose metabolism goes down. When we are eating food, the food has to be broken down into simpler forms. The proteins have to be broken down into simpler form. The carbohydrates have to be broken down into the glucose. The fats have to be broken down into the more simpler lipids. So what this medicine do is that it basically inhibits the DPP4 enzyme, which basically helps in the protein metabolism and carbohydrate metabolism. Because this enzyme is present in the body, that whenever the carbohydrates and proteins come, its job is to send a signal to the pancreas to increase the glucagon so that glucogenesis can happen. The production of glucose can happen. So it basically suppresses that natural process of basically this increasing glucagon or sending a signal to the this pancreas to increase the glucagon production. So what happens is that glucagon basically gets suppressed. So the gluconeogenesis does not happen. And the food, it remains in the stomach for a much longer time because the metabolism is not happening. It is not being broken down into the simpler forms. So it has to remain there. And it is also acts as a suppressor of some tumors. So that is why very common side effects of teneligliptin are bloating, because then body has to react. The food is still stored here. It has to react in a way that this thing gets empty. So the bloating happens or the diarrhea happens. And most of the patient, they basically complain about this thing, that they have this uh, undigested food particles coming in the stools, and lowers the blood sugar because it is suppressing the glucagon. Gluconeogenesis is not happening. New glucose is not being formed. And because the glucagon is going down, so reversely, the insulin goes up as much as it can. So the whole thing basically decreases the blood sugar. Many times the patient, they go into very low sugars, very low levels of the blood sugar. So the problem of is the pancreas, but the medicine is acting on the intestines. This is what Dr. Hanuman is talking about. These employing medicines without any pathological relation to what is actually diseased in the body. There is no relation with the part which is diseased, but attacks the parts most exempt from the disease. There was no problem with the gut. That is why mostly with the tenligliptin, the doctor they prescribe some kind of antacids, they prescribe some kind of probiotics, because they know that diarrhea might happen or something bloating or this thing might happen. So give some bacteria which can break down the food into more simpler forms. So, and you will find so many medicine. There is also one medicine of diabetes. I don't know if nowadays it is in the market. It what it used to do was it used to basically it acted on the kidney. It will increase the size, the filter of the nephrons, so that the blood sugar can pass through the filters and basically be released in the urine, so that the blood sugar levels in the blood they come down. Now the kidney is not having any kind of disease, but when you act on when a medicine is acting on the kidney and it is basically affecting the structure of that thing. So that is why after long time, then we say that it is a complication of diabetes mellitus. It is not a complication of diabetes mellitus. It is a complication of the medicine given for the diabetes mellitus. But in our pathological books, it is written that it is the kidney, diabetes, or the high blood sugar, they affect kidney, they affect liver. No, they affect the kidney or liver because they are affecting on the DPP4 enzymes, they are affecting on the structures of these organs to decrease the blood sugar. The medicines are affecting on them. The diabetes is not affecting on them. So when we understand this thing, that how the medicines are working, you can go on the internet and search all about these medicines. You just have to put any medicine and see how it works. Just put it that how this medicine works. You will get the whole process that how they are working. And from there you can understand that these medicines they're acting on completely different part of the body from where the disease, even if we see anatomically or physiologically, the disease is not basically being coming from that part. So aphorism 56, the third and only remaining method of employing medicines in diseases, which besides the other just alluded to, is the only other possible one, is the antipathic or enantiopathic or palliative method. Then the third method is the antipathic or palliative method, where we give the completely opposite of the symptoms. For example, there is a fever coming up, we give a medicine which is antipyretic to decrease the fever. So that is more a contrary one, wherewith the physician could hitherto appear to be most useful, hoped. So he's saying that after, if he is not doing homeopathy, out of allopathy and antipathy, physician could be most useful with this method, because at least he is giving momentarily amelioration to the symptoms. Wherewith the physician could hitherto appear to be most useful. Dr. Hahnemann in his organon has put the appear word, I can remember, in italics, because the word is that although we cannot say that a physician is useful, but can appear. It appears that he is useful, because useful a physician can only be when he cures the patient. Right? So he says that okay, the second best thing is to appear to be most useful, and that is by the antipathic, and hoped most certainly to gain his patient's confidence by deluding him with momentary amelioration. So he's giving the medicine to momentarily ameliorate the patient, and Dr. Hahnemann is using the word deluding, that he is deluding him, he's kind of conning him or gaining the patient's confidence by just ameliorating the symptom but not curing the disease. But I shall now proceed to show how inefficacious and how injurious this third and sole remaining way was. So he said that now I will proceed, I will give some examples to show that how this third method is also injurious and completely inefficacious in curing the disease, or in basically how it is injurious in increasing the disease. How injurious this third and sole remaining way was in diseases of not very rapid course. It is certainly the only one of the modes of treatment adopted by the allopaths that had any manifest relation to a portion of the sufferings caused by the natural diseases. He's saying that this is the only way which is used by the allopaths to basically decrease the suffering or some portion of the suffering, to give some medicines which basically act in an enantiopathic way or in an opposite way. But what kind of relation is that? Of a truth, the very one exact contrary of the right one. That ought most to be avoided if we would not delude and make a mockery of the patient affected with a chronic disease. He's saying that it is a completely opposite thing. You know, one thing is that the disease is happening, you give a homeopathic medicine, okay, it gets cured. One way is you let the disease go on its course. If you cannot give it a proper relief, then let it be. You know, if something is going to happen after 1 year, it is going to happen after 1 year. But then he say that why this thing is injurious is because if something is going to happen in 1 year, this kind of method will basically make it happen in 6 months. This kind of amelioration. He will come to that part in the next this thing. Sorry. So there is a small footnote. We will just, because it is in with the aphorism 56, or I will come back to it. I will come because otherwise we will lose the momentum of that part. In order to carry into practice this antipathic method, the ordinary physician gives for a single troublesome symptom from among the many other symptoms of the disease, which he passes by unheeded, a medicine concerning which it is known that it produces the exact opposite of the morbid symptoms sought to be subdued. So he's saying that in this antipathic method, the physician, he gives out of all the symptoms, he ignores all the symptoms, but only one troublesome symptom he takes. For example, there is a symptom of pain, but there are many other symptoms. But that is a troublesome symptom. The pain is a troublesome symptom. So he takes that symptom and he gives a medicine which produces the completely opposite effect of that. Means it subdues the pain. From which, agreeably to the 15th century's old traditional rule of the antiquated medical school, contraria contraris, he can expect the speediest palliative relief. Because this thing is going from 15 centuries. He said that this part of the or of this medical school or the medical treatment is a very old traditional rule. This contraria contraris. Okay, if pain comes, you give something which relieves the pain. It also seems logical. It also seems logical. Okay, you have pain, take some painkiller. But how does it affect? He's talking about that thing. He gives large doses of opium for pains of all sorts. So at that time, opium was very much used. Now also, many opiates are used in different kind of forms for the killing and this decreasing pain. Because this drug soon benumbs the sensibility. Because the physicians knew that when you give opium, it benumbs. It decreases the sensibility of the patient. It is not taking away the cause of the pain. Please understand this thing. Any painkiller does not take away the cause of the pain. It just benumbs, it just cuts. You don't feel pain. The cause is there, but you have stopped feeling that pain. And administer the same remedy for diarrheas. Even for the diarrhea, he will give opium because it speedily puts a stop to the peristaltic motion of the intestinal canal and makes it insensible because it basically stops the peristaltic movement of the canal. That is why prolonged opium takers they start getting this tendency for constipation, and it also makes it insensible. And also for sleeplessness, because opium rapidly produces a stupefied comatose sleep. And even for sleeplessness, opium was given because opium produces a contrary effect. He gives purgatives when the patient has suffered long from constipation and constiveness. So if a patient is suffering from constipation, they would give purgative, they would give laxatives. He causes the burnt hand to be plunged into cold water. If the hand is burnt, they would put into a cold water, which from its low degree of temperature seems instantaneously to remove the burning pain as if by magic. Because of its low temperature, because it is cold, it benumbs the hand, and magically we feel that the all pain is gone. He puts the patient who complains of chilliness and deficiency of vital heat into warm baths, which warm him immediately. The patient who is feeling very cold or there is deficiency of vital heat, they will tell him to take warm baths. He makes him who is suffering from prolonged debility drink wine. If a patient is suffering from prolonged weakness, he is very much suffering from debility, feeling weak, feeling, you know, mentally also he's feeling depressed or this, they will tell them to drink wine, whereby he is instantly enlivened and refreshed. After taking wine, the patient feels a kind of, that he's not suffering from anything. And in like manner, he employs other opposite antipathic remedial means, but he has very few besides those just mentioned. And he's saying that besides these kind of antipathic or the means, there are no other means for other kind of symptoms or diseases. Okay? As it is only of a very few substances that some peculiar primary action is known to the ordinary medical school. Now that is the problem. That here the whole improvement or whatever we are saying, that amelioration of symptom are happening by the primary action. It is being done by the medicine. What will happen when the secondary action will come of the vital force? Because secondary action is completely opposite to the primary action. The opium in its primary action, it can decrease the loose motion or diarrhea. But when the secondary action of the vital force will come, you will see problem with the that the patient will develop constipation, or if the patient is sleepy, is being the sleepiness is being produced by the opium in the patient, in the secondary reaction you will see a more aggravated state of sleeplessness. That is why the medicines has to be increased, because now the same amount of medicine will not work, the same amount of opium will not work, because the disease has become more stronger now. If in estimating the value of this mode of employing medicines, we should even pass over the circumstance that it is an extremely faulty symptomatic treatment wherein the practitioner devotes his attention in a merely one-sided manner to a single symptom, consequently to only a small part of the whole, whereby relief for the totality of the disease, which is what the patient desires, cannot evidently be expected. So the first thing is that in this kind of treatment, in the symptomatic treatment, we are just looking at a very small part of the whole disease. Like I was telling you, the disease is a very bigger thing, and we are just looking at the pain. We are just looking at the sleeplessness. We are just looking at the chill or the heat of the patient. We are ignoring the whole disease. But the patient will get only cured when the whole disease will get cured. So he's saying that we cannot expect that thing from this kind of treatment. We must, on the other hand, demand of the experience. If in one single case where such antipathic employment of medicine was made use of in a chronic or persisting affection after the transient amelioration, there did not ensue an increased aggravation of the symptom, which was subdued at first in a palliative manner, an aggravation indeed of the whole disease. Now he says that I want the experience, that he because he's talking to the physicians. He's talking to the physicians who have been long doing uh, the practice, the medical practice. So he's asking them that what does your experience tell? That when we give this kind of treatment, this symptomatic treatment, when we give some painkiller, when we give some medicine for this thing, when the amelioration gets over, does not the disease come in a more increased aggravated state? Although it was palliated for some time, but when it comes back, it is more aggravated than when it was before that palliative treatment. If the patient was given wine for getting out of the debility, when this the effect of the wine will decrease, the patient will feel more weak, more lethargic, and more depressed. And every attentive observer will agree that after such short antipathic emulation, aggravation follows in every case without exception. And the aggravation will follow because the secondary reaction, the vital force will make it more, the effort to produce the opposite symptoms. Although the ordinary physician is in the habit of giving his patient another explanation of this subsequent aggravation and ascribes it to malignancy of the original disease. So that, but the physician, they will give some kind of different, they have this habit of giving a different kind of explanation that it is the disease is like this, or the malignancy of the disease is like this, the extent of the disease is like this. Now, for the first time showing itself, or to the occurrence of quite a new disease. Or the physician might say that it is a new kind of disease or new kind of symptoms which are coming. If in estimating the value of this mode of employing medicine, we should even pass over the circumstance that is an extremely faulty symptomatic treatment wherein the practitioner devote, I think it is repeating itself. Yeah, it is written two times. I'm sorry. Okay, so basically it is about the treatment, the antibiotic treatment that when we are giving treatment for one single troublesome symptom and the symptom is being palliated, the primary action, the secondary action, when the vital force will act and bring out the natural symptom again, it will be in a more aggravated state. The disease will progress, it will go towards the new symptoms, or the old symptom they might get violent in a way that the same amount of medicine will not be able to palliate it again. So that is why he is saying that it is a more dangerous way of giving the medicine, because it basically tries to subdue the disease, but in the response, the disease keeps on increasing. So there is a footnote to aphorism 58. Little as physicians have hitherto been in the habit of observing accurately, the aggravation was so certainly follows. Such palliative treatment could not altogether escape their notice. He said that the problem is that we as physicians are not observing accurately. We don't have that habit of observing. But then there were few physicians who basically in their writings, when they were writing something, some notes, or they were compiling this thing, these things they basically noted down and they have written about it, but could not altogether escape their notice. A striking example of this is to be found in G.H. Schulze's dis. So there was some physician of his time, G.H. Schulze, who in 1741 he basically wrote some essay of, so he's referring his work, aphorism 28, Willis bears testimony to something similar. And then there was Willis, some other physician who basically saw the same thing. So he has written it in Latin. I have translated, loosely translated from the Google. What does it mean? So opiates usually calm the most excruciating pains. So whenever a opiate is given, opium is given, the most excruciating pains, they get calm, they get better, and procure indolence and continue it for some time and for a certain period of time. But it produces indolence in the patient, which basically remains from time for some time and from certain period of time. It can be for some time and for a longer period of time. Okay? So the pains are decreased, but it basically gives indolence of the brain. It gives dullness to the brain. Okay, it gives dullness to the patient, takes away that, you know, um a state where the patient can work in a more better way. And also on page 295, Expelled by the power of opium, the torments immediately return. And as soon as the power of the opium it is basically reduced, the effect is basically nullified, or the effect is gone. The torment immediately return. The pains they come back and do not cease their cruelty until they are once again enchanted by the same drug. And they do not go away until and unless the same drug, the opium, is again given. In like manner, J. Hunter on the venereal diseases, page 13, says that wine and cordials given to the weak increase the action without giving real strength. Very important. That wine and cordials, or the basically we are talking about the process, that they might give increase the action of the patient, but the real strength does not come. The real strength which should come from inside, it does not come, and the powers of body are afterwards sunk proportionally as they have been raised. So the more the action of the medicine is given, okay, the more the medicine acts, the more strongly the medicine acts, the more strongly will be the opposite action also, proportionally as they have been raised, by which nothing can be gained, but a great deal may be lost. We don't gain anything from it. But even if the patient had 30% of strength, it will also decrease down to 25 after such kind of treatment. I'll go back to the footnote of the isopathy. So this is about the fourth mode. Sorry. The fourth mode of employing medicines in diseases has been attempted to be created by the means of isopathy. Similarly, what we were talking about with the swords. So at that time also, from this method, some person he got this idea and he created the method of isopathy, as it is called. That is to say, a method of curing a given disease by the same contagious principle that produces it. Okay, so method of curing a given disease by introducing the same contagious principle that produces it. But even granting this could be done, he said that this could not be done. But even if we suppose that this can be done, which would certainly be a most valuable discovery, yet after all, seeing that the virus is given to the patient highly potentized, and thereby consequently to a certain degree in an altered condition, the cure is affected only by opposing a similimum to a similimum. He says that even if you give it in this way, even if this can become possible, granting this could be done, because from that time till today, it is not done yet. It could not be done till now. Okay. So, but he's saying that, okay, granting that this could be done, but still you are giving a similimum to the similimum. You are following the same method. So he basically telling that isopathy is not a different kind of thought process. It is a manipulated thought process of homeopathy. We can say it that way. Right? So taking just one part of the disease and taking it as this is a contagion, or this is a contagious principle, and giving them saying that you are also thinking in the same way, but you are just not taking the whole thing into the mind. You're not, again, you are not trying to cure the whole. You're just trying to cure something which is produced from the virus. Again, that material thinking is there. I think we will stop at aphorism 58 today, because 59 is a very long aphorism. So we'll take it up next time. So in these aphorisms, Dr. Hahnemann was basically telling us more about the enantiopathy, mean the method of curing with the opposites, that how it can be basically dangerous for the patient, how it can be dangerous for the health of the patient. So we have to understand this thing. That is why we basically tell the patient not to take much painkillers, or not to take some kind of medicines which can completely act in a reversal process of what we are trying to do, because that will give a temporary relief to the patient, but it will not take away the causation. None of these methods can take away the causation. None of these methods basically act on the causative factor, on the sora of the patient. So until and unless we basically don't try to cure the sora, or we don't have in the mind that we are going to cure the sora with our method, it will be very difficult to practice homeopathy or practice in a right way. I'm Because till now he's just trying to tell that out of all the ways which, according to the logic, according to the nature, according to the examples which have been given to us, which is the best way, which is the way which can basically help in realizing the aphorism 1 and 2, the ideal cure and the cure of the sick. So till this point, he has basically differentiated on all the methods which are going on at that time, and even now the same thing is there going on. So out of this, he's basically trying to tell us that how homeopathy is the only possible way of curing the patient in a rapid manner and in a permanent manner. And the experience also tells us the same thing. So with that, I will take your leave. Thank you very much for being in this, because I always say that this is a big task. Organon is a big task because you are talking about something which is very big, which is basically the philosophy of homeopathy or medical science. And so, whatever the experiences I can bring from my side, I just try to put those experiences in front of you. Like I have put this experience of tenligliptin. So I just try to, my vision is that with my experience, with the examples which I have seen, I can tell you the things which I have experienced and which are already written in the organon. Even when the questions are asked, I prefer to go back to the aphorisms that these are already answered. I always want all the homeopaths who are doing homeopathy or who want to come to homeopathy, go to organon, read organon, stick to it, because all the answers are already given. The questions which we have, the answers to them are already given. Okay? So with that, I will take your leave. Thank you. Thank you so much. So as we were discussing in the last lecture also that from now onwards, the practical part will start. A brief is given in the aphorism 71. What are the points we are going to discuss in the coming aphorisms? So we'll start with aphorism 71. Today's part will be more concerned about the acutes. Right now, it will be a general feature, general description of acutes and how they are to be handled. As we move forward deep into the more parts of the organon, Dr. Hanneman will also tell about how to take the case and how to prescribe in particular acute states. So right now it will be just a general view. It is not a detailed view of how to deal with every kind of this thing, disease. But today we will just see the general view. What are the chronic diseases? What are the acute diseases? And what are the kinds of acutes and or the kind of chronic disease also. We'll start with those things. So in aphorism 71, as it is now no longer a matter of doubt that the diseases of mankind consist merely of a group of certain symptoms. So Dr. Newman saying that now there is no doubt to this thing that disease, whatever we call a disease, it is just a group of certain symptoms and may be annihilated and transformed into health by medicinal substances, but only by such as are capable of artificially producing similar morbid symptoms. And all these diseases, all these certain group of symptoms which are present in a patient, they can be annihilated and transformed into health by the medicinal substances. Now, many times, even till now, we are at aphorism 71, as we have gone through the organon. Dr. Hahnemann has many times said this thing that diseases are just a certain group of symptoms. It consists only a small group of certain symptoms. Why he's basically saying this again and again? It is a very uh, important to understand this thing, that why he's stressing on this specific words. He's choosing these specific words to express something, because he's just from a physician's mind, from our minds, he's taking away the names of diseases. He wants us to forget the names of diseases, just treat diseases as if they are just a group of symptoms which are to be removed. There are certain symptoms of an ulcer which is bleeding, or an ulcer which is having a growth, or an ulcer which is phagedenic, it is increasing in size, it is going deep. Those are the characteristics of the symptom. We take that symptom, we prescribe the medicine, other characteristics of the disease, and you will see that the disease will start getting better. But if you think of that thing as a cancer, the name, that this is cancer, this is an epithelial cancer, squamous epithelial cancer. So when that name strikes you, you know, that name strikes the patient, the name have the similar effect on both the individual, the physician and the patient. The first thing comes into mind whether we can cure this or not. But if you just keep it as that this is just a symptom, it is just there are some group of symptoms. You know, the name does not matter much. But I only concentrate on this certain group of symptoms, the characteristics of the symptoms. Then the things they start becoming more easy. Then we can go beyond our fear, go beyond our limitation, and see the disease in the truest sense. So to take away that name and the impact of the name on our minds, he is stressing again and again and again in different kinds, that just understand this thing, that disease is nothing, it is just merely, the word he uses, it is just merely. Merely means not to be worried about, not a very big thing, very small thing. Disease is a very small thing, any kind of disease. It is just a small thing. That it is just a group of certain symptoms. It is nothing more than that. And such is the process in all genuine cures. And they can only be cured, but only by such as are capable of artificially producing similar morbid symptoms. Only those medicines which can act homeopathically on the body, only those medicines, or by that way only, these symptoms can be permanently annihilated and the health can be transformed. So we have understood this thing till now, till aphorism 70. We have taken many examples of this thing. We have seen many compared homeopathy with the other systems of the medicines, how they are working, how the nature is working. We have seen the examples of cure by the nature itself, that whenever a cure happens in the nature, it always happens homeopathically. He says that all these things are established and they are beyond doubt. So henceforward, next is, hence the operation of curing is comprised in the three following points. So now we are going to talk about the cures, how the cure should be done. What are the things which a physician should know so that he can cure the patient? So the first point is, he's giving just an overview of what we are going to discuss. How is the physician to ascertain what is necessary to be known in order to cure the disease? Now, if you remember aphorism 3, he gave small hint about this thing. This is knowledge of the disease. Again, how is the physician to ascertain what is necessary to be known? So, what should the physician know? What should be the knowledge of the physician so that he can know why, how or what is to be ascertained, what is to be understood in order to cure the disease. Okay? So that is the knowledge of the disease. What I should know about the disease, the symptoms, the characteristics, what are the characteristics, how I am going to take those things, the case taking part, everything. So that all comes under the knowledge of the disease. Second is how is it to gain a knowledge of the instruments adapted for the cure of the natural diseases, the pathogenetic powers of the medicines, the knowledge of the medicines, what my medicine can cure because it produces the same things in the healthy individual beings. So the materia medica part of the medicines, that is the second thing. Third is what is the most suitable method of employing these artificial morphic agents, medicines, for the cure of natural disease. So what is the most suitable method? The knowledge of that dose, what kind of potency, in what manner it has to be administered. So all these things he's going to talk about, he's going to tell us about in the coming aphorisms. So aphorism 72. With respect to the first point about the knowledge of the disease, the following will serve as a general preliminary view. Because whenever the patient comes to us, first we have to assess whether we are, what kind of approach we are going to take towards the case. So this is the first step which we basically think about when the case is in front of us. The diseases to which man is liable are either rapid morbid processes of the abnormally deranged vital forces. Okay. So whatever the diseases which come to the body, some of them are rapid morbid processes. They are very rapid. The speed of the disease is very rapid, which have a tendency to finish their course more or less quickly, but always in a moderate time. These are termed acute diseases. So this is the definition of acute diseases. What are the acute diseases? Acute diseases are those disease processes which have rapid, which come rapidly. The onset is rapid, and they have this tendency to finish their course. Once they have started, they will end in something. They have to end either quickly or it may take some time, but they will end. They will not be continuously going on process for many years. In a moderate given time, they will end. Or they are diseases of such a character that with small, often imperceptible beginnings. Or the other character of the diseases is, the other type of the diseases is that they start with a small, imperceptible beginnings, unknown beginning. Imperceptible, we cannot perceive it. It is so slight, it is so small, the beginning, that it cannot be understood, it cannot be felt. Dynamically dearrange the living organism, and they keep on dearranging the living organism dynamically, each in its own peculiar manner, and they all are basically affecting in a peculiar manner and cause it gradually to deviate from the healthy condition in such a way that the automatic life energy, called vital force, whose office is to preserve the health, only opposed to them at the commencement, and during their progress, imperfect, unsuitable, useless resistance, but is unable of itself to extinguish them. They keep on gradually, they keep on increasing and increasing these diseases. That when they start, when they commence, the vital force who is there to maintain the health when the health is there in the healthy condition. But once it starts getting disease, then it just shows some imperfect, unsuitable, and useless resistance towards these increasing diseases, towards this increasing dynamic effect of the disease on the body and vital force itself. But it is unable of itself to extinguish them. It cannot extinguish them on its own. It can extinguish the acute diseases on its own in some cases, but these diseases, they cannot, the vital force cannot extinguish on its own, but must helplessly suffer them to spread and itself to be ever more and more abnormally deranged until at length the organism is destroyed. These are termed chronic diseases. So it just keeps on giving an imperfect resistance to the disease, and the disease is increasing and increasing and pushing it until the organism is destroyed, and these kind of diseases are known as chronic diseases. They are caused by dynamic infection with a chronic miasm. So basically there are two type of diseases, one are acute diseases and one are chronic diseases. The acute diseases which the onset is rapid, finish their course in more or less quickly, but always in a moderate time, and they are not of long durations. An acute disease you will not find going on for 2 months, 2 years, 3 years, 4 years. No, those are then they are the symptoms of the chronic disease. But chronic disease, they have an imperceptible beginnings, very small beginnings, dynamically derange. The derangement is dynamic. In acute diseases, even sometimes we will go to that part when we will talk about the indispositions. Those are also part of acute diseases. That many times physical things also they can dearrange. But in chronic diseases, the derangement is basically the dynamic one. In it, each in its own peculiar way, and each disease, each chronic disease is basically, or everyone is getting affected dynamically in a peculiar way, in an individual way. It is not that they are all getting affected in the same way. Continuation is gradual, it keeps on continuing, and is caused by the dynamic infection with the chronic miasm. There is some chronic miasm which is going on, which is producing a dynamic infection in the body. We'll talk about all these points. What is dynamic infection regarding the miasm? As the aphorisms will go on, we'll talk about all these things. As regard to acute diseases, now Dr. Hanneman is basically will give 4 examples of the acute diseases. That what kind of no sorry that will be, I think, in the next aphorism. But few examples of the acute diseases. As regards acute diseases, they are either of such a kind as attack human being individually, the exciting cause being injurious influences to which they are particularly exposed. So there are some acute diseases which are individually attacking a person individually. It is not attacking many people, or it is not because of the some atmosphere. It is just an individual attack. Suddenly a person is getting fever. He woke up, or she woke up in the morning, and the head was heavy. She was feeling weak, and after some time she started having fever. So these are the individual kind of acute diseases. Excess in food or an insufficient supply of it. There was a party, ate too much, drink too much, or an insufficient supply. Someone was involved in a work, someone was going in a journey, so he was not able to eat it, or because of some socio-economic conditions, the person cannot get good supply of food. Severe physical impressions, some kind of injury, physical impressions, some kind of injury, some chills, some overheatings, dissipations and strains, some sprain because of too much exertion, etc. Or physical irritations, some kind of thing which was physically irritating. For example, someone was wearing a tight shoe, or the jean was too tight, some kind of physical irritation was going on. Some mental emotions, some anger, some anxiety, some fright, and the like are exciting causes of such acute febrile affections. Okay? So these individual affections, they are usually come from these kind of affections, these kind of exciting causes. Some excess in food, some mental emotions, some physical irritations, some kind of injuries. In reality, however, they are generally only a transient explosion of latent sora. But we have to understand that these kind of individual diseases, they are coming from the explosion of the latent sora. So that is not some kind of different acute disease, but it is a just a sudden acute attack of the miasmatic disease, or the miasm which was already in a latent state and it just erupted out, which spontaneously return to its dormant state if the acute diseases were not of too violent a character and were soon quelled. So now Dr. Hanneman here is saying that these kind of individual diseases, they are basically the expression of the sura, the miasm, the chronic miasm itself. So they are just an acute expression of the bigger chronic disease which is already going on. So my question to you is, why this kind of because we have talked about the exciting causes here, we have talked about what can cause this kind of individual acute disease. So my question to you is that why this is basically of miasmatic origin. Why it is not an acute disease? For example, I have ate something and I got loose motions, I got diarrhea. Why it is the explosion of the sora? Why it is not some acute disease which is caused by the food? Sora means that my body was already ready for it, just something precipitated and my body reacted to it. So this is not caused by something which has happened, but it was already in there and it exploded out. So why it is a psoric disease or an expression of the sora? Why not an independent acute disease? This is my question to you. You have to think about it, and next time we will discuss about it, because uh, I'm seeing that only I am answering everything. No, this is just food for the thought, we can think about something, because this thing is already answered in the previous aphorisms. So we have to just think about that, what we can correlate with, just an exercise so that we can correlate with the things which we have already studied, which we have already talked about. So you just sit for some time, and in I think in all of you the answer will come. If you just think about it, the answer will come. So the second type of acute disease, or they are of such a kind as attacks several persons at the same time here and there. They are called sporadic acute diseases. Sporadically, by means of meteoric or telluric influences and injurious agents, the susceptibility of for being morbidly affected by which is possessed by only a few persons at one time. Okay, so then there are sporadic diseases. Sporadic diseases are which affect a group of people at certain part, and then at certain part, and then at a different part, at a distant part, because of the telluric influences, meteoric influences, right? The influences which are happening in our atmosphere, that some weather changes, some kind of pressure changes, climate changes. Because of those changes, some of the injurious other agents which are happening with those group of people. So those are sporadically which are happening, and they will only affect a few persons at one given time. Allied to these are those diseases in which many persons are attacked with very similar sufferings. Now, in sporadic diseases, it is not usually a kind, not it does not usually happen that they all will have similar kind of sufferings. No, the very example is recently the COVID. So many people were diseased, but all were having different kind of symptoms. The sufferings were different. The symptoms were different. Although categorically we called it an epidemic, but it is more of a sporadic disease. There were groups of people who were getting affected. It was not that the whole community was getting affected. But allied to those are those diseases in which many persons are attacked with very similar sufferings from the same cause. Those are called epidemic diseases. The diseases where the suffering is similar. Why? Because the causation is similar. Because the similar kind of phenomena can only run if the cause is similar. If we think about COVID, that we said that COVID was because of this virus. So if the cause was same, then why the sufferings were different? The same cause has to produce same kind of suffering in everyone who is going through the same cause. So that is a typical epidemic where the cause is the same and the sufferings are the similar. You will see that the 50 or 100 patients who are coming, they have 90 to 95% resemblance of their symptoms. Only very few minor symptoms maybe which are somewhat different, but all the characteristics, all the major symptoms, how the fever is coming, how it is going, what are the very characteristic symptoms in the fever, or any kind of thing which is happening at that time, some kind of eruption. If the eruption is coming at third day, most of the cases it is coming on the third day, maybe fourth day, third day, that kind of variability is there, but usually it is like this. So then we say that this is an epidemic. So these diseases generally become infectious, contagious when they prevail among thickly congregated masses of human beings. And these become infectious. Infectious, the bracket is contagious, like it is going from one person to another, to another, to another, to another. Now, when we go through the organon, the word infection is usually written. Many times it will be written in coming aphorisms, you will see it many times. Even in the chronic diseases, the infection is used. But the infection does not mean some kind of bacterial infection, viral infection. It just means that there is a contagion. Okay, many times Dr. Hahnemann will say this thing, the dynamic contagion. Contagion means from me it is going towards you, from you it is going towards the other person, then from them the same thing is going to the other person. This is contagion. There is a family of people very much attached. Thickly congregated means there's a word, thickly congregated masses. Congregated, what is congregated? Where the people are continuously in contact with each other, they are talking with each other, they are sharing their views with each other, they are sharing it so much with each other, the views, the emotions, everything, that somewhere they're thinking it is almost alike. They are thinking alike. That is what we call as congregation. The word is coming from congregation. Okay, a group of people which believe in something which is similar. In churches, in religious this thing, we have congregations. Then there is a group of people who are believing in something which is similar, so they have a similar kind of belief system or a similar kind of thinking system. So in those thickly congregated masses, the contagion is more likely to get from them to the other person, because they are thinking alike. They have a belief, they have a trust on each other, that the source of the information is right, the source of what. So they are so much congregated, they are so much in connection with each other, that the contagion becomes very it becomes easy for the contagion, even dynamically, if that it can flow. If there is a fear, the fear can flow. If there is an anxiety, the anxiety can flow. If there is love, the love can flow. So these things are easy to flow. Many people, they are very much attached to their congregations. Why? Because whenever they go there, they feel good, they feel positive, they feel loved, they feel accepted, because that is the thing which is flowing there. Everyone is in that state, everyone is at that frequency. So they feel they like going there. Many times you will see some people, they like going to their religious places, some church, some temple, they like going there because they feel accepted there, they feel that everyone is like me. So those kind of masses, if in a family, there is they are very congregated, a disease can basically become a contagion very easily, very easily. Usually when people, some family members, they come to me that we all are having this disease. First he got, then she got, then they got, then I, you know so I usually say that that means you are very close to each other, because more this closeness is there, the more chances are that these kind of diseases, they will be become a contagion. So generally become infectious, contagious when they prevail among thickly congregated masses of human beings. Thence arise fevers, in each instance of a peculiar nature. And because the cases of disease have an identical origin, they set up in all those, they affect an identical morbid process. So because the case, every case, it has an identical origin. the origin, the causation is identical. So you will see the identical morbid process. It is not same, it is not almost similar, it is identical. Identical means replica. Whatever the symptom this person is having, the same symptom will this person have, which when left to itself terminates in a moderate period of time in death or recovery. So if these diseases they are just left on their own, so they will either end. Left on their own means that no medication is given. So either they have the tendency to come back to recovery or they will end up in the death. The calamities of war, bad effects of the war, inundations when there is flooding, and famine, or there is complete loss of water, there is no rain for so many years, that kind, there is no food to eat and everything, are not infrequently. Not infrequently means they are frequently their exciting causes and producers. Because if you think, in a war, in a state of flood, or in a state of famine, everyone is going through the same causation, identical origin. The effect of these things is similar, completely similar on everyone. If the people are not getting something to eat, they are going suffering from the same emotions, same kind of feeling, same kind of threats. It is all same. So sometimes they are peculiar acute miasms which reoccur in the same manner when known by some traditional name. So it might be given some traditional name in some area, but these are the acute miasms, the miasms which are of acute origin. They are not of chronic origin. They are not something which is going at a very slow pace and affecting the people. No, war erupted suddenly, flood came suddenly, famine came acutely, and they produced a set of symptoms in all the people who were in that area, which either attack persons but once in a lifetime, as the smallpox, measles, whooping cough, the ancient smooth, bright red scarlet fever of Sydenham, the mumps, etc., or such as recur frequently in pretty much the same manner, the plague of Levant, the yellow fever of the sea coast, the Asiatic cholera. So among these epidemics, there are two types of this thing, which may occur once in a lifetime or which may occur frequently, but they have been given lots of different names according to the area, according to where they erupted, according to the characteristic of the disease. So the Asiatic cholera because it happened in Asia, the fever of Sydenham because it happened in Sydenham. So they have been given many names, but the name is not important. Importance is the origin, how and how it affected the individuals. So because when there was this war in Syria, so I was uh, following the reports of the Red Cross at that time. So in all those reports, they called it the Syrian refugee syndrome at that time, because there were typical symptoms of tuberculosis, hepatitis with fatty liver or with cirrhosis, renal failure, and leishmaniasis or measles. Okay? These kind of symptoms are happening to everyone who was there in the camps, in the refugee camps. Why similar kind of this symptom was going on? Because the similar kind of feeling was there, the dynamic affection was there. Death fright. You are in a state of war, there are bombs going on, there are bullets, guns going on. Everyone is in a state of death fright. They are afraid to die. There is an invasion in the country, there is a war going on, civil war going on. When the war is going on, nobody thinks about food. The food is always second or third in priority. The first is to save oneself. So the starvation becomes the next part, which is commonly seen. People are leaving their homes. There is an existence conflict, there is a refugee conflict, They have to go, they have to abandon their places, go to some distant parts, go to some unknown parts. Many of the Syrians, they had to, even you have seen those videos or those news at that time. People were going on raft boats, you know, going across towards the Europe, and because there is so much that where you are going to go, you have to leave your home, and because of this we feel this separation conflict. The condition of the camps is like that. If the some people they reach camp, so all that conflict, all that state of mind, all that feeling is same. That is why the process, the morbid phenomena, the disease phenomena which is seen, it is almost identical in everyone at that time. So that was an epidemic, the result of a war. Because these kind of things usually affect when these kind of conditions are there. Some war is there, some famine is there, some flooding is there, inundation is there. So at that time, whatever the conflict is coming, that will result into the symptoms and the diseases. So there is a footnote to aphorism 73. The first footnote: the homeopathic physician who does not entertain the foregoing conclusions devised by the ordinary school, who have fixed upon a few names of such fevers besides, which mighty nature dare not produce any others, so as to admit of their treating these individuals according to some fixed methods, does not acknowledge the names God. So he, Dr. Hahnemann is trying to say that because whenever some epidemic used to come at that time there used to be many epidemics. Now the epidemics have decreased very much, but at that time there used to be epidemics because of famines, because of the inundations, because of the wars. War was a very common thing at that time. Some kingdom is putting a war on someone, then they are going for the war on the other kingdom. So that was a way of life at that time or even before his time. So these kind of things were common. So they were given some names: the gall fever, bilious fever, typhus fever, some kind of mucus fever, these kind of names. So Dr. Hahnemann is saying in this footnote that the homeopathic physician, he should not entertain those conclusions of the ordinary school, because the ordinary school means the allopathic school. In many parts he calls them the ordinary school in the organon. Why he's saying this particular, the meaning of this particular footnote is that just by you know name of some kind of epidemic, if you hear that okay, dengue is going on, some chikungunya is going on, don't keep those kind of names in your mind. Why? Because there is so much variability in the fevers. And he's saying that the ordinary school, they have put a limitation in their mind by naming the few fevers. They have just named few fevers, but there is so much more of symptoms which are coming. There are so many things which are seen in every new fever that we cannot put a single name to all those fevers. We cannot. So better than putting the name, a homeopathic physician, he just keeps himself away from the names of these things. That is why I was telling you in the starting of the aphorism 71, because now this thing will come many times as we go more in the practical part, where we have to understand that the name does not mean anything. As a homeopathic physician, the most important thing is to see the symptoms and find out the characteristic symptoms. That is only what is required of me. That is only what is required. Second footnote to aphorism 73. Subsequently to the year 1801, a kind of purpura miliaris, Rudwong, which came from the west, was by physicians confounded with the scarlet fever. So around that year, there was some purpura, some kind of fever which was, thank you, which was going on, but The characteristic was from some part of the West. And the physicians at that time, they basically confused it with the scarlet fever, notwithstanding that they exhibited totally different symptoms. So he's just giving an example that if you go by the name of the fever, that okay, the eruptions are of same kind, it is a scarlet fever. Just by looking at the purpura, many physicians they confused it with the scarlet fever. But he's saying that the purpura was there, but there were so many other symptoms with that thing, exhibited totally different symptoms, that the later found its prophylactic and curative remedy in belladonna. The former in echo, right? So many physicians, because they confused it from the purpura, they thought that it was aconite, so they kept on giving aconite. They did not understand the other symptoms. But Dr. Hahnemann cured the same thing with the belladonna, and that the former was generally merely sporadic, while the later was invariably epidemic. Now he's saying that earlier, the purpura, it was basically a sporadic disease, and this was a completely epidemic. Of late years, it seems as if the two occasionally join to form an eruptive fever of a kind for which neither the one nor yet the other remedy alone will be homeopathic to be exactly. And he's saying that now, at the time he was writing this thing, that now the time has come that both the diseases they have conjoined, the symptoms have conjoined each other, and neither the belladonna nor the aconite will be homeopathic to this thing. We have to find some other remedy for it. So it's just giving an understanding that just by the name of some fever or by some epidemic, under that this is the plague, this is the smallpox, chicken pox, just by the name, do not go for the medicine directly. Look for whether it is exactly the same thing or not. What are the symptoms, the variation in the symptom, the characteristics of the symptom. So overall, for a homeopath, the symptoms matter the most, because only by symptoms we can see the individuality in each case, the newness in the each case, or if there is some similarity, then also we have to see on the basis of the symptoms. So the symptoms are the most important thing to understand along with everything else. So among chronic diseases, so now we are going to the part of chronic diseases. We must still, alas, reckon those so commonly met with artificially produced in allopathic treatment. So he's saying among all the chronic diseases which are going on, we must still reckon those so commonly met with the artificially produced in allopathic treatment. So he's saying that among chronic diseases, there is a group of chronic diseases which are artificially produced in the allopathic treatment. There are chronic diseases of natural origin, and then there are chronic diseases of artificial origin, artificially produced, not commonly produced by the human being or the vital force, but it is artificially produced. Those symptoms are artificially produced by the use of prolonged use of violent heroic medicines in large and increasing doses. Some kind of narcotics are used, or at that time was used in large and increasing doses, by abuse of calomel, corrosive sublimate, mercurial ointment. Even nowadays many ointments they contain mercury in a different kind, but it contains mercury. Even the nitrates of silver, they are already present in many ointments nowadays. Iodine and its ointments, opium, valerian, cinchona bark, quinine. Even nowadays it is used in the form of hydroxyquinine and quinine, foxglove, prussic acid, sulfur, and sulfuric acid, perennial purgatives, venesections, leeches, issues, cetons, etc. So saying that these are many methods which are used, for prolonged time, and they start producing their own artificial diseases in the patients, whereby which the vital force is sometimes weakened to an unmerciful extent. Sometimes, if it do not succumb gradually, abnormally deranged by each substance in a peculiar manner, in such a way that in order to maintain life against these inimical and destructive attacks, it must produce a revolution in the organism. That when these things are used, they basically weaken vital force to an unmerciful extent. They are weakening the vital force because vital force is already fighting with the natural disease, and now it has to fight with the medicinal disease also. The medicinal disease which is opposite to it, the medicinal disease which is basically um, used in an antipathic way, palliative way, to decrease the symptom, to suppress the symptom, and it has to produce a revolution in the body so that it can preserve itself in such a way in order to maintain life. It has to maintain life, it has to keep the organism living against these inimical and destructive attacks. So how it can do is it must produce a revolution in the organism. And what is that revolution? And either deprive some parts of its irritability and sensibility, or exalt these to an excessive degree. So either how the vital force produces revolution is either by decreasing some irritability, some sensibility of the patient, or by increasing it. The patient will become more sensitized. He will start becoming more affected by paracetamol. That in many patients we see that they become sensitive to allopathic medicines, sensitive to painkillers, sensitive to some antipyretics, because the sensibility is increased so much that the patient he himself should repel those kind of things, that oh, I don't want to take these medicines because when I take it I suffer from loose motions, I feel more worse after taking these things. So the sensibility towards these products, it is increased, cause dilatations, or some parts they have to suffer dilatation or contraction or relaxation or induration, or even total destruction of certain parts, and develop faulty organic alterations here and there in the interior or the exterior, cripple the body internally or externally in order to preserve the organism from complete destruction of life. So many times it has to produce, the vital force has to produce some kind of distortions in the body, some dilatation, some contractions, cripple the body also, so that it can preserve the organism, because that is the work of the vital force: preserve the organism as long as it can from complete destruction of life by the ever renewed hostile assaults of such destructive forces. Here, the such destructive forces is the artificial disease formed from the allopathic medicines. This is the aphorism about that kind of chronic disease. These inroads on human health, affected by the allopathic non healing art, more particularly in recent times, are of all chronic diseases the most deplorable, the most incurable. So, the next he adds is that these inroads on human health, these kind of effects which are produced on the human health by these medicines, more particularly in recent times, they are of all chronic diseases. If you see at the picture of all the chronic diseases which are present, so these chronic diseases, this group of chronic diseases which is produced by the medicines, these are the most deplorable. Deplorable means most destructible and the most incurable. It is very difficult to cure these. And I regret to add that it is apparently impossible to discover or to hit upon any remedies for their cure when they have reached any considerable height. And he says that I regret, I feel sorry, but I have to add this thing that it is impossible to find a remedy, or very difficult to find a remedy which can cure these effects on the human health, the effects of the medicines which they have produced on the human health when they have reached any considerable height. If they have caused some kind of destruction to the patient, so their cure, their this thing is very much impossible to find, some kind of remedy on this thing. We will take the examples of these things next time. Aphorism 76 and the footnote to aphorism 76. There we will talk more about this thing 76, 77, 78 with more examples that why he has said this thing. Because it is very important to know when, because many patients are coming to us, they are taking some kind of medicines, they have gone through some kind of procedure, some kind of operations. So in those kind of cases, what to expect after we have given the medicine, that we have to understand. So we will talk about, I will take few examples, because I will take some time on these aphorisms. I don't want to rush into these aphorisms, because once the practical part has started, we will not rush into anything. We'll go slowly, we will understand it, understand each and every aphorism, understand each and every word which Dr. Henneman has written in the organ, so that we can know what we have to learn in order to cure these diseases. And when some kind of scenarios they come, like here we have a scenario where there is a natural disease and an artificial disease, so what to expect in the follow-ups, what kind of follow-ups I can expect, that I have to understand. Okay? So next time I will talk about few cases. I will take few examples of few medicines, some medicines which are commonly taken in diabetes, in the treatment of thyroid, in the treatment of blood pressure. I will take the examples of those, and we will try to understand that what kind of a conjoined disease picture we have, and how to see through that picture also, because we cannot prescribe our medicine on the symptoms which are produced by the medicines. We cannot prescribe on that thing. Okay, so we will go through that thing and we will discuss in detail in next time. So any questions, you can just send the questions in the group, or to Dr. Jonkol, or to Dr. Isha, and we can talk about them, we can discuss them in the next uh, class or lecture. And the question which I asked you, please think about it, because just by thinking you will get the answer. I'm very sure of it, because we have gone through those first 70 aphorisms and the answer is there only to this thing. Okay. So with that, thank you very much, and I have a very, very good night. Very good evening to all of you. So today we are again here to continue with our English lectures on the organon of medicine. So till last lecture we have already covered till aphorism 75. Like we were talking the last time that from aphorism 70 onwards, it will be more of a practical part. So in the practical part, we are now going through the understanding of what are acute diseases and what are the chronic diseases. This understanding is very important. When a patient comes to us in the clinic, many times we are, there is some little bit of this thing, that whether to treat this case acutely or chronically. Like few days back there was this message from one of my students that his father-in-law, he had some kind of pain in the abdomen, and there was some this gallstone, the cholelithiasis, it was diagnosed. And his question was, the first thing was that how should we approach, like should I give an acute for the state, or should I give the constitutional medicine? Okay, so it is very important for us to understand whether which diseases are to be considered as the acute diseases and which are to be considered as the chronic diseases, because our approach on what we have to prescribe or how we have to go through the case, it basically depends upon first our understanding of this thing, that whether the disease in front of us, whether it is an acute disease or a chronic disease. Okay, in acute disease, what kind of acute disease? In chronic disease, what kind of chronic disease? So that further differentiations will go as we move further with the organ. So in the aphorism 7, we have done till 75. So in aphorism 73, 74, 75, more 74 and 75, we have gone through the class of chronic diseases, which is happening due to the medications, the allopathic medications which are being given. So we will be continuing with the same thing in the next few aphorisms, where Dr. Hahnemann will give us more insight into why and how he's treating this class as not the natural chronic diseases, the class of natural chronic diseases, why he is describing this class as artificial chronic diseases, and how we have to approach these things. So, but those devastations and maimings of human organism, exteriorly and interiorly, affected by years frequently of the unsparing exercise of a false art with its hurtful drugs and treatment, must be remedied by the vital force itself. So Dr. Hahnemann is trying to tell us here that all the diseases which are occurring naturally, okay, we can treat those diseases, we can give relief to all those diseases by the means of medication. But all those destructions, all those symptoms, all those hurtful things which are done in the exterior or in the interior of the patient, and it is being done from many years, which is done frequently by the hurtful drugs and the treatment, they must be remedied by the vital force itself. Only vital force can remedy itself to these maimings. There is no we'll go further and see appropriate aid being given for the eradication of any chronic miasm that may happen to be lurking in the background. Although we have to give the medicine in those cases also, we know that even if some other medicines are given, some allopathic medicines, some antipathic medicines are given, that means there had been some natural symptoms, there has been some symptoms of the natural disease, but we have to give the medicine so that we can eradicate that chronic miasm which is lurking behind, lurking in the background, which is producing the natural disease. But once it is done with the homeopathic medicine, the rest of the symptoms, the rest of the things which are produced by the hurtful drugs, by these medicines, they have to be remedied by the vital force itself, if it has not already been too much weakened by such mischievous acts, and can devote several years to this huge operation undisturbed. So many times when we are asked that how long it is going to take, the homeopathic remedy when it is given, because I have seen such cases also where not much of bungling of the medicines was done, and when a right remedy was given, the effect of the medicine or the result of the medicine was too quick, very easily it restored the health in the patients. But then there are these kind of diseases, there are some patients who come to us who have been taking such kind of medicines or very strong medications for some diseases from a long time. So the symptoms which these diseases these medicines have produced on the body, they can only be remedied by the vital force itself, and it can take several years to this huge operation undisturbed. Without getting disturbed, if we don't disturb it, it can take many years to reverse all the processes which have been done on it. A human healing art for the restoration to the normal state of those innumerable abnormal conditions so often produced by the allopathic non-healing art, there is not and cannot be. So all those conditions, all those abnormal conditions, all those diseases or disease symptoms which are produced by the medication, such medications, Dr. Hahnemann is saying that there is no art, no human healing art which is there, which can restore these conditions to the normalcy. There is not and cannot be. So in such cases, with our homeopathic medicines, we can remove whatever was naturally there. What are the symptoms which are produced by, for example, if someone is taking some medication from 10 years, 15 years, and there are some symptoms which has come up because of those medications. Those have to be remedied by the vital force once we have removed the natural disease from the body. And it can take many, many, many years for this huge operation. Footnote to aphorism 76. If the patient at length comes, the practitioner of such a treatment is in the habit of pointing out to sorrowing relatives at the post-mortem examination these internal organic disfigurements which are due to his suit, but which he artfully maintains to be the original incurable disease. So there's this one article, one essay of Dr. Hahnemann, which he wrote about this particular thing which he observed, and it is translated in his lesser writings. If you want to study, you can go. There is this: be aware of the allopathy sick man, like this. This is the name of the beware of the allopathy, the sick man. Like he's telling the sick man to be aware of what kind of medications he or she is taking. Dr. Hahnemann is saying that when after such a treatment, the treatment is going on and the patient at length comes, the patient dies after such kind of treatment. So the practitioner, the physician who was giving this medicine or this kind of treatment, he basically does a post-mortem and shows all those things which are disfigured inside, which are deteriorated inside, the lung which is disfigured, the liver which is disfigured, there is some degeneration of the kidneys, there is some ulcers in the intestines. So Dr. Hahnemann is saying, and I think he is being very, very daring. This is a very courageous or daring statement which he has given, that all these organic disfigurements which are produced are due to his pseudo art. Because means that all these disfigurements, they are basically due to the medications which are being given. But he artfully maintains this to be the original incurable disease. He says very artfully, he tries to convince the relatives that this was the disease. So those deceitful records, again a very big word, that those records of the pathological which are given in the pathology, Dr. Hahnemann saying that those deceitful records, the illustrated works on pathological anatomy, exhibit the products of such lamentable bungling. Diseased people from country, those from the poor of cities who have died without such bungling, with hurtful measures, are not opened up through pathological anatomy as a rule. He's saying that all those people from the country, from the villages, or who are from a poor background, who could not afford such kind of treatment, he says that these kind of bunglings are not seen in their this thing. Such corruption and deformities would not be found in their corpses. From this fact can be judged the value of the evidence drawn from these beautiful illustrations, as well as of the honesty of these authors and bookmakers. So this footnote to aphorism 76. If you go through the history of Dr. Hahnemann, like when we read about these things, when we read in the lesser writings, many times Dr. Hahnemann used very harshful words, very harshful. When we read it, we say that okay, he has gone over the board, and in speaking or saying some things. But if you go through the history of Dr. Hahnemann, the way In the first, he tried to approach the physicians, telling them about homeopathy and what it can basically, the beautiful results which it can give or the cures which it can form. He was basically displaced from so many cities so many times because of his this approach. From many cities he was told to, kind of get out, like you are not needed here. As many people, he called him a scoundrel, he called him that he's a corrupt person, or that he's coming up with this kind of theory. He's telling that these things are being done wrong with the medical system. So all these years of things which were going on with him, although he was telling truth, because when we see it logically, when we see in our experience, we see all these things happening. We all see these things happening with our patients when they are coming to us. But then he was a man who was suffering from this kind of thing from so many years. He was taking, he was the only person who was kind of, standing against whatever was against the society, the things which were going against the society, the treatments which were hurtful. He was the only person who was openly saying that you are doing more hurt than any benefit. But still he was questioned all the time. He was, the whole organon was questioned, and the whole method of the treatment was questioned, everything was questioned. So many times in the aphorisms, many times in the his letters, his articles, we see this kind of a defiance coming up. Very bold statements, although they are true, but the way he tells them in an open defiance. From there, we can understand that, because when we started with the organon, I and the first thing which I told you, that it is very important to, if we want to understand the organ in a whole manner, that we need to understand the emotions of Dr. Henneman. He was trying to do something good. He did something good. With all his efforts, with all his careful experiments, when we will go to the miasms, he will tell that I have devoted 13 years to these experiments before I came up with you, with these things in front of you, because he knew that how accurately, how carefully he's doing even small of the things, even while preparing some kind of medicine. If we go through the materia medica pura, the methods which he has, how to prepare the medicines, very minute details he has given. He was only able to give so minute details because he have done so many experiments. Then out of all those experiments, he found which is the best one. So his life was completely a devoted life to save the humanity, or to give something to the suffering humanity, some kind of system which can heal them, which can cure them. So when he saw these things happening, when he saw all these things going on around him, sometimes he goes into that state of defiance. Very bold statements where he's challenging the pathological books in a way that all these beautiful illustrations, all these things which are shown that this is cirrhosis of liver, this is this is that, that they are basically the bunglings which are done inside the human being. Now we'll take an example. How this thing is basically presented to us and how it actually is. Because we all are coming from the medical background. We have all read all these things. We have read pathologies, we have read histopathologies, we have gone all those things. But if we just sit back and think about it, just think about it. For example, there is some kind of unrelenting stress going on in the life of some person. So because of this unrelenting stress, the blood glucose is going to increase. The more the stress, the more the blood glucose will increase. And we call it the diabetes mellitus. And some kind of medicine is given to control that blood glucose. some metformin, some glimepiride, or some insulin. So now when this medicine is given, so the body also has to react. The secondary action has to come to the primary action. So the body reacts usually to these kind of medicines with peripheral resistance of glucose. For example, if the hands were taking around 200 moles of glucose, they basically develop, because the with glimepiride, with metformin or insulin, the blood glucose is decreased, but the body needs a sufficient amount of that thing. It needs, because of stress. Now stress is not gone. We were under stress, the body produced more glucose so that we can work more, we can think more, we can come out of that stress. But we considered it diabetes mellitus, we considered it something very dangerous, and we started taking metformin or glimepiride. So the body goes into the secondary defense mechanism, where it has to collect the glucose from the periphery so that it can give it to the brain, it can give it to the most important parts. So from there the body reacts in a peripheral resistance of the glucose. The peripheries, our hands, our legs, our feet, they basically uptake less of glucose. So from there some kind of symptom they start. For example, the first symptoms usually which start after these kind of medicines are the neuropathies, numbness, some loss of sensation. These kind of symptoms they start coming up. Then they can go to the retinopathy, nephropathy, gangrene, because the peripheral resistance to the glucose is, but it is being created by the body so that the glucose can be given to the brain so that it can fight against that stress. It can go fight against that survival thing which it is going through. But all these neuropathies, all these retinopathies, all these nephropathies or the gangrene, they are basically ascribed to the diabetes. We say that it is because of the diabetes, like because the blood glucose was high, so the neuropathy, gangrene, retinopathy, nephropathy, they happened. So this is how the complications to some kind of diseases which are given in our books, they are usually due to the you will see so many people who didn't even know that they had diabetes. They were going through their life very well. They never checked it, they never did any this thing, and they never had these kind of symptoms. I know so many patients, I know so many people in my life who didn't take these kind of medicines for the glucose or diabetes. They exercise, they kind of did something to control or maintain at whatever level it was, and they never suffered from these kind of symptoms. My own grandfather, he had very high diabetes, but he was also a homeopath, so he never took any of these medications for anything, and he never had any symptoms. So from when we see these things and when we compare that what have come in my experience, many times the patients come to us, they found diabetes accidentally, like someday they just went and the blood sugar fasting was around 200 to 30 to 20. I have some patients who came because they were already taking medicine, so they came to me that suddenly it has come like this, or they knew some of the relatives taking, so they didn't prefer to take any other medicine, so they came to me, but they didn't had any kind of these symptoms. Even many patients I know who are having this diabetes from 8, 8, 9 years, who are not taking any of these medications, this metformin or insulin or this thing, no symptoms, nothing at all. On the contrary, I have seen many patients who are taking the medications, and then they start going through these kind of, very prominently we will see one symptom, weakness of memory. Very common. We don't talk about it because we don't relate it with diabetes, but it is a very common symptom in the patient who are taking metformin or who are taking insulin. They start forgetting things. because glucose is needed to for our day-to-day functions. The real cure will be that the body should stop feeling that stress, or the bad effects of the stress on the body, they should stop. That will be the good line of cure, the good line of treatment which we can do. And this is not with this thing, this is with the, and usually you will see that after you have given the medicine, the diabetes, it starts coming down, 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 and at a certain point it comes and stops. Like for example, fasting 180, 190, 200, and it stops. It does not go down, it does not decrease from there, although they are taking metformin or anything, but it will become because now the body is not able to decrease it further. When we are giving metformin, when we are giving insulin, we are trying to basically alter the this gluconeogenesis with that thing. So the whole biomechanism of gluconeogenesis is disturbed with these medicines. And once it is disturbed, once it is compromised, it can be brought near to normal. The aphorism 76 tells us. But the rest of the healing has to be done by the vital force, and it can take many, many years, or it can just remain at that without giving any kind of trouble. So whenever we are giving the medications, when we are giving the taking a case, we have to take care of these things also. That okay, these kind of medicines are going from this long time. So I should expect that there will be some symptoms. There may be some symptoms. If the vitality is not too low, that some symptoms which are produced by these kind of medicines, they will remain even though the rest of the disease is basically cured by the homeopathic medicine. And we need to guide the patients also that see these symptoms or this part of the disease, it will go very, very slowly. So you have to be very, very patient. So aphorism 77, those diseases are inappropriately named chronic, which persons incur who expose themselves continually to avoidable noxious influences, who are in habit of indulging in injurious liquors or ailments. Sorry, here the ailments will come. So then the next part of the chronic diseases, which are inappropriately named chronic. What is this? Which are inappropriately named chronic, which persons incur who expose themselves continually to avoidable noxious influences. Some kind of noxious influences, some kind of things which we are doing, we are taking in our diet, in our regimen. There are some kind of habits which basically produce some kind of diseases or some kind of symptoms which are inappropriately named chronic. Why they are inappropriately named chronic? Because they are basically coming out of our habits. Who are in the habit of indulging in injurious liquors. Some people who are having liquors or injurious things to eat or to drink, there are some symptoms which can come after that. So those things are not true chronic diseases. They are again those chronic diseases which are basically occurring because of these habits or these kind of the things which are being taken, are addicted to dissipations of many kind which undermine the health, which who undergo prolonged abstinence from the things that are necessary for the support of life, who reside in unhealthy localities, especially marshy districts. So all those symptoms, for example, if someone is not taking something in the diet, many times nowadays, some teenagers, they diet a lot. They have this, tendency to keep themselves hungry. So if some weakness is coming, if some vertigo is coming, if some part of the body is not working, there is some trembling, Okay, if the body is going into a state of anemia because of these kind of habits, so they are not the chronic diseases. They can be altered. These symptoms can be altered if we take proper diet, or if we exclude some things from our diet. For example, some injurious liquors, some injurious substances which are being taken. If they are removed from the diet, the body will start coming back to the health. Who reside in unhealthy localities, some people who are residing, living in such kind of localities which are unhealthy, like there is a lot of water accumulation there, mosquitoes are there, some flies are there, some marshy districts are there is a lot of humidity there, who are housed in cellars or other confined dwellings which are deprived of exercise or of open air, who ruin their health by overexertion of body or mind, or we are into a job or in a habit or in a profession where we are overexerting ourselves. We are in some kind of anxiety about future, like we have had a case in Thailand of a man who was overworked. He started getting confused, the mind started getting confused and confounding, and the loss of memory and the weakness in the body because of overworking. He was in a state of overworked state. So when we are overworking, overexerting ourselves, because rest is a very needful part of our life, for our mind also, for our body also. If we are not giving it rest, it cannot function to its proper um, standards. So rest is very much important. But if we are not giving rest to the body, if we are not giving rest to the mind, and we are continuously doing something, and that can also produce a state in the body which can appear to be diseased, but it is not a chronic diseased state. These states of ill health which persons bring upon themselves disappear spontaneously provided no chronic miasm lurks in the body under an improved mode of living, and they cannot be called chronic diseases. So whenever these states are removed, the state of health, ill health, they also disappear, and the health starts coming, until and unless there is some chronic miasm behind it, because many times this can happen due to a chronic miasm also. Plus these kind of conditions, they aggravate the situation. But when there is no chronic miasm, where there is no natural disease, but all the disease state or all the symptoms are due to these kind of habits or this kind of routine, some indolent routine, some kind of overworked routine, then when you remove that kind of routine, when you guide the patient that do these things in the life or don't do these things in the life, the healthy state, it will start coming back. So these are also not, cannot be called as the chronic diseases. So all these diseases are not natural true chronic diseases. So now we are coming to the true natural chronic diseases. What are those? The true natural chronic diseases are those that arise from a chronic miasm, which when left to themselves and unchecked by the employment of those remedies that are specific for them, always go on increasing and growing worse, notwithstanding the best mental and corporeal regimen. So the true chronic diseases basically arise from chronic miasms. What is a chronic miasm? We have to understand that all the procedures, all the processes which are going on, they have a start, they have a middle, and then they have an end. That is what we call as a process. There is something preceding that event, then there is something which is succeeding that event. So it is going on in a flow. So the chronic miasm is that process which basically produces disease in the patient, which makes the organism diseased. When we are saying that make the organism diseased, we are not going for any particular name. It can be any disease, any disease. But the whole process, how it is going on, that is what is called as the chronic miasm. Either it is sora, either it is psychosis, either it is syphilis. There was a starting point, Then it started going on, and with succeeding events, it keep on going on and on, which when left to themselves, if you don't do anything to them, if you don't take care of this chronic miasm or the chronic diseases, you don't give any kind of medication, and unchecked by employment of those remedies that are specific for them, if means if some homeopathic remedy is not given to them, they will always keep on growing and increasing and growing worse. This is a very true image of what we see in reality. Whenever the patient comes to us, we start asking the question when the disease started, how it progressed, how it is going now. We always see that from the beginning to this point of time when the patient is with us, the disease has always increased. It has always increased. It may have gone to some kind of latent stages in between, but whenever it came back more intensely. It came back with more new symptoms. It came back with more violent symptoms. And this is in every disease. This is with every patient. I give a very this example, which most of the people can correlate with, is that from the time you have started becoming sick, whether your medication has increased or decreased. If it has increased either in the number of medication, in the strength of the salts, or the strength of the dose, like from 25 it went to 50, then to 100, any kind. For example, you were taking one salt for BP, and then two salts were given, and now three salts are given. Anyway, if you see it, if the medication is increasing, that means the disease has increased. It has not decreased. Because if the disease would have decreased, then there would be no need to give more medicines. There would be no need to increase the medicines if the disease has decreased. So that is a natural character of a chronic disease, that it will keep on increasing. It will keep on growing worse. Notwithstanding the best mental and corporeal regimen, even if we take best of the diet, even if we take best of the exercise, we keep best of the routine, best of the discipline, even then it will keep on increasing and torment the patient to the end of his life with ever aggravated sufferings. And until the end of the life of the patient, it will keep, the sufferings will aggravate, it will keep tormenting the patient, it will keep making him sick in different ways. These are the most numerous and greatest scourges of the human race. So these chronic diseases, they are the biggest problem, they are the biggest upset, and they are so numerous. For the most robust constitution, the best regulated mode of living, and the vigorous energy, most vigorous energy of the vital force are insufficient for their eradication. Even if we have the robust constitution, very strong constitution, physically, mentally, we have a best regulated mode of living. We are eating properly, exercising properly, taking care of everything, and the vital force is also very vigorous in energy. Even then, they are insufficient for their cure, for their eradication. It cannot be done. It cannot be done without a proper medicine, without an intelligent physician. It cannot be done. Because that is the character of true chronic diseases. That once that chronic process starts from the chronic miasm, it keeps on increasing and increasing and increasing. It is as if something is constantly being poured into something. There is a constant influx of a bad energy, of something which is, disease producing energy. There is a constant influx. It is coming. It's not stopping at all, until and unless some right medicine is given, until and unless some homeopathic medicine is given to the patient. Only then this influx stops, and the rest of the disease can be eradicated. Otherwise, we just take care of few symptoms, and this influx is going on. It is producing some new symptoms here and there in the body. This is what is happening. Aphorism 79. Hitherto, syphilis alone has been to some extent known as such a chronic miasmatic disease. So first he is telling about syphilis, that syphilis is basically such a chronic miasmatic disease which when uncured ceases only with the termination of life. If this syphilis is not cured properly, it will end in the termination of the life of the patient. Psychosis, the condylomatous disease, the disease which originates from the gonorrhea, equally ineradicable by the vital force without proper medicinal treatment, was not recognized as a chronic miasmatic disease of a peculiar character, which it nevertheless undoubtedly is. So he's saying that psychosis was never recognized, or even the syphilis was never recognized as the miasmatic diseases. But they are undoubtedly, because once psychosis starts, I will talk more detail about the three miasms in the next starting of the next lecture. I will make some slides, I will make some charts to we will discuss about it. I'm just going through these two aphorisms, what Dr. Henneman has given to us, and in the next class I will tell you what we understand from it. Okay, so we will do it into these parts. Maybe the next class will be completely on miasms, because it is very important to understand the miasm before we move forward in the organism. That what is basically miasm, because the homeopath, as homeopaths we talk, okay, that there is a sora, there is a psychosis, and there is a syphilis. But what are they? And why there are three of them? Why not four? Why not two? Why not one? Why not six? Because there are many people who have given 7 miasms, who have given 12 miasms. It, it is not like that. It is not like that. We have to understand why there are only 3 miasms, the sora, psychosis, and syphilis, and why only these are there. Only these are to be called as the miasms. We will go through those things in the next this thing. We'll complete the aphorism 79 and aphorism 80, understand what is written, and then we will go forward from there. And physicians imagined they had, because at that time the treatment of syphilis and psychosis, it was a more local treatment. For the gonorrheal warts or the gonorrhea, some local treatment was given. For syphilis, local mercury was used. So when it was gone from there, the physician thought that the syphilis or psychosis is cured. When they had destroyed the growths upon the skin, okay? So they imagined they had cured it when they had destroyed the growths upon the skin. But the persisting dyscrasia occasioned by it escaped their observations. But the other symptoms which started after these things disappeared, the physician could not see that, because he thought that the gonorrhea is a local disease. He thought that this syphilis is a local disease. But these diseases have their own kind of uh, processes, disease processes, which are different from others. So we will be discussing about those disease processes. Aphorism 80. Incalculably greater and more important than the two chronic miasms just named, means syphilis and psychosis, however, is the chronic miasm of sora, which whilst those two reveal their specific internal dyscrasia, the one by the venereal chancre and the other by the cauliflower-like growths, does also, after the completion of the internal infection of the whole organism, announced by a peculiar cutaneous eruption, sometime consisting only of a few vesicles, accompanied by intolerable voluptuous tickling, itching, and a peculiar odor, the monstrous internal chronic miasm, the sora, the only real fundamental cause and producer of all the other numerous, I may say innumerable forms of diseases. Sorry. So incalculably greater and more important. He's saying that, okay, I have told you about the syphilis and psychosis, that they have these kind of eruptions on the genitals, and they have some kind of internal discretion, internal disease processes, internal symptoms which start after these eruptions or these things come up on the skin. But even much, much, much greater than these two miasms is the chronic miasm of Sura. He's saying that basically, uh, like the syphilis shows itself by a venereal chancre, a kind of ulcer, which is shown on the genitals, or the psychosis shows it's by the cauliflower-like warts or growths on the genitals. This Sora, it also announces itself when it has completed the internal infection. That is a very important thing to know, understand. After the completion of the internal infection, so even the first symptom of the sura, the eruption, the vesicles or the itch, it comes after it has infected the organism internally. So the infection comes first. And like I told you, that whenever we are talking about the infection in organon or homeopathy, it is not that kind of infection. It is not the bacteria getting transferred or the virus getting transferred. It is a dynamic infection. Dynamic infection from already infected source. And there is a hint in the coming footnote that how this dynamic infection basically involves this dissipation of the sura or the this thing. Announced by a peculiar cutaneous eruption, it announces itself that I have come and I am here. I have infected this organism by some few vesicles accompanied by intolerable voluptuous tickling, itching, and a peculiar odor. So when it starts, it shows these kind of symptoms. Now it can show many other varied symptoms. We'll go to that part later on. The monstrous internal chronic miasm, the SORA, the only real fundamental cause. It is the only real fundamental cause. Even the rest of the two miasms, the syphilis and the psychosis, they are basically dependent upon this, the SORA. It is the only real fundamental cause and producer of all the other numerous, and I may say innumerable, uncountable forms of the diseases, which under the names, although we have given all those diseases names, we have given the name of nervous debility, some hysteria, hypochondrosis, mania, melancholia, imbecility, madness, epilepsy and convulsions of all sorts, softening of the bones, rachitis, scoliosis, and syphilis, caries, cancer, fungus. Even the cancer comes under the SORA. Fungus, hematodes, neoplasms, gout, hemorrhoids, jaundice, cyanosis, dropsy, amenorrhea, hemorrhage from the stomach, nose, lungs, bladder, and womb, of asthma and ulceration of the lungs, of impotence and barrenness, of megrim, deafness, cataract, amaurosis, urinary calculus, paralysis, defects of the senses, and pains of thousands of kinds, etc. Figure in systematic works as pathology as peculiar independent diseases. So it is the only time when Dr. Hahnemann gives so many names of the different diseases which are given under the books of pathology in the systemic works of pathology as independent diseases. It is the only time. Before this and after this, he will not take so many names of the diseases. He never takes. But here it was important. Why? Because he wanted to us to know that these diseases are given as independent diseases, okay, in the pathological works, but it is basically only a single disease which is showing innumerable forms. It is only Sora which is showing innumerable forms, even in the form of coryza and even in the form of cancer, even in the form of convulsions, even in the form of asthma. In the simpler forms, in the complex forms, it is the same disease which is showing different kinds of symptoms, innumerable forms. We, if we understand this thing, that okay, I am just curing one disease because there is only one disease process, it becomes too simple because our whole focus goes away from the disease. The whole focus goes away. If we just understand this, that it is a single disease, single process, disease process, which is going and taking numerous forms, we will stop thinking about remedy based on diseases, because the disease or the concept of disease or so many disease, it basically vanishes from our mind. It becomes more simple. But Dr. Hanuman has not done this to make it simple. There is a logical reasoning behind it. We'll discuss it in detail. But let's go through the footnote to aphorism 80. I spent 12 years in investigating the source of this incredibly large number of chronic affections, in ascertaining and collecting certain proofs of this great truth, which had remained unknown to all former or contemporary observers, and in discovering at the same time the principal antisoric remedies, which collectively are nearly a match for this thousand-headed monster of disease in all its different developments and forms. I have published my observations on this subject in the book entitled The Chronic Diseases. Before I had obtained this knowledge, so Dr. Hanuman is saying that I have spent 12 years in investigation. Like I was telling you that before coming, nowadays, if someone knows something new, the next day they announce that I know this thing without taking the responsibility whether it is truth, whether it is not, whether it has some corroborative evidence to it, what the experience tells, does the different kind of experiments or this thing show the same thing. So he took 12 years in investigating numerous thousands of patients, thousands of this thing. If we go through this chronic diseases, he has given so many examples of this thing. So he has collected certain proofs. He has observed the things. He has got a large number of data before he came to this thing, before announcing this thing, that it is the only one single which starts in a manner and it basically becomes a thousand-headed monster as he describes it. And he said that I have also found the remedies, the principal antisoric remedies, which he has published in his chronic diseases, the book of chronic diseases. And he has published his observation in the chronic disease. Before I had obtained this knowledge, I could only teach how to treat the whole number of chronic diseases as isolated individual maladies. Very beautifully, that earlier I was thinking of chronic disease as isolated maladies, like we think about it. Okay, this is diabetes, this is hypertension, this is amenorrhea, this is cancer. So you see that I was also doing the same thing with those medicinal substances whose pure effects had been tested on healthy persons up to that period, so that every case of chronic disease was treated by my disciples according to the group of symptoms it presented, just like an idiopathic disease, and it was often so far cured that the sick mankind rejoiced at the extensive remedial treasures already amassed by the new healing art. He's saying that although I was treating it like, taking the symptoms of disease and giving the medicine or whatever the symptoms are being presented at that particular time, by the similia similibus currenter, I was giving the medicine. And even in that way of giving, they were giving good this result, like that disease will go, but some other disease will come in its place. But the patients were happy. You, they were happy that this new healing art is basically curing their symptoms at least. How much greater cause is there now for rejoicing that the desired goal has been so much more nearly attained? Which goal? Aphorism 1. to cure the sick, as it is termed, to health, inasmuch as the remedy discovered and far more specific homeopathic remedies from chronic infections arising from sura, properly termed antisoric remedies, and the special instructions for their preparation and employment have been published. So you're saying that now it is a more case of rejoice that we are more near to our desired goal of curing the chronic diseases. And from among them, the true physician can now select for his curative agents those whose medicinal symptoms correspond in the most similar manner to the chronic disease he has to cure, and thus, by the employment of antisoric medicines more suitable for this miasm, he is enabled to render more essential service and almost invariably to effect a perfect cure. So he's saying that from all these antisoric medicines, he can now choose a medicine which is more close to the case in front of him and which is invariably there, and it will be more essential for him so that he can cure the patient in the true sense and the true means, and thus the chronic diseases. He named the book the chronic diseases because it is specific for that thing, to understand what the chronic disease is. And to cure a chronic disease without the understanding of miasms, we cannot cure it. A very common thing which we see is whenever the patient comes to us, we give some medicine, the symptoms are relieved and they are relieved for some time. But the patient comes again with the same symptoms after some time or some more aggravated symptoms. We give the same medicine, it sometimes works, it sometimes does not work. So why it worked in the first place and why it does not work in the second time or the third time, then we have to change the remedy. It gives relief for some time, then the symptoms come again. This kind of thing which Dr. Hahnemann was seeing in his practice. From there he came to this point that there has to be something which I'm missing, because he knew that homeopathic principle is right. So he said that there is something other thing which is missing, which is which if I can understand, I can be able to cure the chronic diseases in a more permanent way, in a more healthy way. So from there this miasms came into existence. From there this understanding of miasms came. So we'll talk about it in more detail in the next class. We will start with the aphorism 81 in the next class, and then afterwards we will talk about the miasms, because without the understanding of aphorism 81, we cannot go more deeply into the understanding of the miasms. So aphorism 81, the fact. So we are going from that sura part, okay, the miasm part. We are going ahead. The fact that this extremely ancient infecting agent, I will just put some. I will just give some words little importance. They are not bold or they are not given in the organon like this, but I am just giving from my side so that we can uh, consider these things, these certain words as important, and try to understand what Dr. Hahnemann is trying to tell us. So the fact that this extremely ancient infecting agent, so this infecting agent, this infecting agent of miasm, it is very, very ancient. It is not something which has come up suddenly in the times of Dr. Hahnemann or in our times. It has been going on from long time, in some hundreds of generations, going back as hundreds of generations, many generations back. This ancient infecting agent, it has started affecting the human beings through many millions of human organisms, and it has come to this development through millions of human organisms. and has thus attained an incredible development. And it is developing. From Dr. Hahnemann's time, it has developed more. We will discuss about that thing. But even to his time, he could see when he was going through the history of the medicine and everything which he was observing, he could see that this thing has basically attained an incredible development, renders it in some measure conceivable how it can now display such innumerable morbid forms in the great family of mankind. And when we look at this infecting agent, this miasm, this sora, that it has gone from so hundreds of generations through millions of human organisms, it also gives us this understanding that that is how it has basically shown innumerable morbid forms in the great family of mankind. It is the same family, the mankind, the human being, it is the same family. In the whole species, it has shown innumerable morbid forms of the diseases. Particularly when we consider what a number of circumstances just contribute to the production of these great varieties. I have just added this, actually, I have added the first footnote because it is given at this circumstances part. I will come back to it. So particularly when we consider what a number of circumstances contribute to the production of these great varieties. So Dr. Hahnemann is explaining it that it is an infecting agent. Like I have told you earlier also, that many times this infection, this you know transferring of the infection or the infectious, this will be used many times in the organon. In the chronic diseases, the book of chronic diseases, it is also used many times. But here the infecting agent does not mean some kind of bacteria or virus. Infecting agent means it is going from one person to the another. It is transferring the disease from one person to the another in a dynamic way. So this has been going on from past so millions, through millions of human organisms, from hundreds of generations. It is going on. And there are certain circumstances. What are those circumstances doing? They are contributing to the production of these great varieties of chronic disease. So basically, SORA, the miasm, and the circumstances, when they combine, they basically give rise to these diseases. So first, now we will go through this footnote because this gives us an understanding into what kind of circumstances, first of all, and then we will go back to the aphorism 81. Some of these causes that exercise a modifying influence. So these causes which are external, the circumstances which are external, they basically cause, they basically amount the modifying influence. They modify. They can have a modification on the symptoms, but they are not the, again we have to keep the aphorism 31 also, the understanding of aphorism 31, where Dr. Hahnemann was saying that all these influences, all these things which are external, they cannot make a human being or an organism unhealthy unconditionally. So these are the condition. The miasm is the condition. The person has to be infected with the miasm, and then these conditions, these kind of things, they start modifying an influence on these the health of the organism. So some of these causes that exercise a modifying influence on the transformation of sora. So these causes, they basically modify the sora. Different kind of modifications are given to the sora by these kind of conditions. But the sora is going on into chronic diseases manifestly depends sometimes on the climate and peculiar physical character of the place of the abode. For example, what kind of climate is there? An external factor. What kind of place I am living in? How is my place where I abode? The house, the conditions of the house, the working place. What is the physical character of that place? Sometimes on the very great varieties in the physical and mental training of youth. very great varieties. This is again very important. All over the world, we have different kind of civilizations. We have different kind of people. We have different kind of traditions. We have different kind of educations. We have different. Everywhere it is different. Like for example, if I talk about eye contact, in the Western countries, in America, eye contact is a very important part, of the culture of the society. If you want the child to look confident, you want to develop confidence in a child or in someone, you tell them that whenever you have to talk, look in the eye of the opposite person. That shows confidence. But if you come to the eastern part, in Japan, in India also, in Thailand, I think it will be the same because we have very common links to the culture. Eye contact is basically thought to be something which should not be done. If you are making an eye contact with someone, you are kind of insulting that person. Even especially if it is someone elders, if it is a teacher, if like the father in the family, the eye contact is not very much appreciated. So different varieties of mental training. There the eye contact is a very good thing. Here the eye contact is not a good thing. So most of the people, when you are talking to them, even in India, they don't give eye contact. People give proper eye contact. Even in Thailand, I have seen this thing. Very few people they give eye contact, because the things which this is our mental training, the things which we have learned, the things which we will. So they basically modify what kind of diseases we will have. On the very great varieties in the physical training also, what kind of physical training is being given? The posture we sit in. For example, in India, we sit with a cross leg, in most of the Eastern countries, or with the folded legs. But in West, they don't sit like this. They sit on a chair. They don't sit on the floor or in this position, and like it is called as the lotus position. So with our physical training also, the way we sit, the way we stand, the way we walk, it is also a training which have been given to us. So that also shows how our physical development, the development of our muscle, the development of our bones, how it is going to go. So these different kind of trainings, very great variety. There is a great variety of this thing, both of which may have been neglected, delayed, or carried to excess. These trainings, they might be neglected, or they might be delayed in some part, or they might be carried to an excess. A lot of training is done around their abuse in the business or conditions of life, or these things have been abused, overdone in the business or different conditions of life. In the matter of diet, what kind of diet we are taking and what kind of regimen we are having. The passions, what kind of passions, excitements, uh, these things we have inside. Manners, what kind of manners we are going through, what kind of habits we have cultivated, and what kind of customs we follow of various kind. So you can see that, all these modifying factors, the habits, the manners, the customs, the passions, the trainings which we have got, everything which we know. There is a different kinds of parts of our consciousness. There are things which we know. I know this thing. I know how to ride a cycle. I know how to talk. I know how to write something. All these things which we know, basically, they are basically a part of our mental training. If you are saying that I know this thing, anything, it can be about any manner. So this has been part of our basically mental training. For example, today there was this one of the colleagues who came. She said one thing. She said that uh, we do from our side we do so much good for the people, but the people they always bite back. They always do something to harm you. This is a training of the mind. Everyone does not feel in the same way. This is a training which we have given to our mind. And there are so many such things, so many things. We have learned so many things in our family, from our traditions, from our customs, from the religion itself. So many things that we consider everything in a part of good and bad. And this division of the thought, whenever the thought started dividing, it started giving more. What is the sensitivity? What are we sensitive about? If you look at a broader way, the susceptibility and the sensitivity, it is basically a division. Oh, I want this, but I got this. I want good, I'm getting bad. But we are sensitive to the things which are not going our way. In a broad way, we are basically sensitive to those things. We are sensitive to something which is not going according to our expectations, which is so. What are the expectations? They are basically our mental trainings, our habits, the manners in which we do the things, in which we think, the customs, the religious customs, the social customs, which we are bound to follow, even we don't want to. Deep inside, we don't want to. We want freedom from all these things, but still we have to do. So all these characters they basically modify, but sora, that congenital sensitivity of an organism. Because if you are sensitive, then these modifying factors they will keep doing something to you. If you are not sensitive to anything, if you are not sensitive to right or wrong, if for you everything is okay, I don't believe in right and wrong. For me everything is okay. I don't believe in good people or bad people. They're all equal. I don't believe in good habits or bad habits. They are okay. So when we are in the healthy state, we are more in okay state. We are there are many things which we are okay with. You know, uh, for example, if someone is saying like about the child, it is okay for me. Whatever you want to be in your life, I will accept it. If someone says and believes in also, that okay, whatever you want to be, just follow whatever you want to be, and I will support with you. I will support whatever you want to do. I am with you. So that person will never have a problem. That parent will never have a problem with what the child do in his life. All the parents who have the problem that my child is not doing right or he is doing wrong, or even if he is doing right, that is because we have this thing that these are the good things to do in the life and these are the not so good things to do in the life. So this mental training which we have done, why it is training? Because we train the mind every day. We cement our beliefs, we cement our thought processes, we cement our likings and dislikings also. Like this time in Thailand we talked about this, our how we make the decisions on our this player and pain mechanism. So we are basically with that thing, we are always reinforcing ourselves. This reinforcement again and again and again, this is what Dr. Kent, it calls as the influx. It's this reinforcement which we are doing every day. This is influxing the disease process. That is why the disease is not able to go on its own. The SORA is continuing. Recently, a follow-up of mine, she came from the USA, and she was talking about the old things, the things which has happened in the past. She came with her children, and when she started talking about it, my mother-in-law did this thing, my brother-in-law did this thing, and she started crying while talking about this thing. So I just asked her that, tell me that your mother-in-law or your brother-in-law, are they doing this thing to you right now? She said, no, the mother-in-law died. She died 10 years back. And I asked her that, what about the brother-in-law? She said that we are not on talking terms in 7 years. So I said, why are you crying today? Why are you crying today? Because she is also having this, anxiety neurosis, and she had depression. She's very much cured, but still some parts of it, you know. So I asked, why are you crying today? Whatever they have done, the mother-in-law has done. She has not done that thing to you from past 10 years because she died. She's already gone. But today also she has the power on you that she can make you cry. This feeling of powerlessness, we all feel powerless when, about these matters. What can I do? It's a common question. But we tell ourselves that, okay, what can I do in this thing? Someone is coming and making me angry. What can I do about it? But now, when she's sitting in my cabin, the mother-in-law is not there. Still, so what is basically making her weep at that time? This reinforcement of the thought. We are reinforcing it again and again. We are making ourselves more sensitized, oversensitized. That is why this oversensitivity, the more a patient is oversensitive, the more a remedy is oversensitive, the more variety of symptoms they will show to you. This oversensitization. So coming back to the aphorism. So these all things, these modifying factors, they contribute to the production of these great varieties of chronic diseases. But they are secondary symptoms of SORA. These secondary symptoms of SORA. Besides the indescribable diversity of men in respect of their congenital corporeal constitutions. So Dr. Neyman is saying that there is indescribable, we cannot describe it. There are so many different kind of physical constitutions. Someone is tall, someone is robust, someone is thin, someone is. There are so many different kind of congenital constitutions. Irrespective of that, even with that thing, this SORA, it shows so many symptoms when it goes through, when a person goes through these kind of different circumstances. So that is no wonder if such a variety of injurious agencies. So all these, again, injurious agencies. What are the injurious agencies? All these customs, traditions, men, thinkings, whatever he has said, this training, mental and physical training, everything, habits, they are all injurious. Sorry, they are all injurious agencies acting from within, from inside us, and from without, and sometimes continually on such a variety of organisms, and they are working continuously on such a variety of organisms permeated with the soric miasm. So all the organisms permeated with the soric miasm, there these agencies, these injurious agencies, they are always working from within and without, should produce an innumerable variety of defects injuries, derangements, and sufferings, which have hitherto been treated of in the old pathological works under a number of special names as diseases of an independent character. So this everything, this ancient infecting agent, which is getting support from the circumstances which are happening without and within, all these injurious agencies, they are basically giving developing all these defects, sufferings, derangements, symptoms in the patient, which have been told in our pathological works with some kind of special names. And they have been told that every disease is an independent disease. But it is all coming from the one point and spreading. It is just like a tree, you know. It is just like this, the tree, the soil. This is our predisposition. This is how we are. And the root which grows is like a miasm. This trunk consists of the primary symptoms of the miasm which come on the skin in psora, psychosis, syphilis. Now, it is also a very beautiful thing. I have talked about this thing earlier also, but again, I will mention it that all the primary symptoms, either of psora or psychosis or syphilis, they basically come on the skin. Even if it is itch, some scabies like itch in the psora, it comes on the skin. If it is a wart, a gonorrheal wart, genital wart, it is coming on the skin. Even if it is a chancre of the syphilis, some ulcer, it is also happening on the skin. So all these primary symptoms, they are first coming on the skin. So this is very important. Why the skin is the first part. From there, the secondary symptoms then start developing. Skin, as we have considered earlier also, if we go according to the Dr. Hammer's theory, and even also it is not only Dr. Hammer's theory, but there is an understanding of skin. We, from the time we have started compartmentalizing the body, for example, eye is a different thing, heart is a different thing, skin is a different thing. We have made specialisms about that thing. We There are some specialist doctors about these different organs. We have divided the whole body. We There's a even I'm very sometimes I feel that it is a very dangerous uh, thing which we are, a dangerous president which we are basically making for the people or for the generations who will come or follow. Yeah, we think of body as a machine, like some car, like some other machine. That we say that heart is a pump. Now, pump is basically a mechanical structure. The work of the pump is to, pump something from one place to the another. That is not the work of the heart. Heart has so many other things. We think of skin as a protective layer. Now, layer is something, very very materialistic thinking. So when we are not feeling the skin is a very innate part of a human being, of every organism, but in human being it is a very very innate part. Innate in the sense everything starts with the skin. The first touch, the first perception of anything when we come into the world, it starts with our skin. The first nutrition starts with the skin from the lips. When a child starts feeding on mother's milk, every sensation, everything, we are basically the communication with the world. This is all being done through the skin. It is a part of communication. It is part of how we feel in this world. So it all goes through the skin. Similarly, heart is a part of our feeling. We have three kinds of, I'll just go a brief to make it more understanding. It is more deep, but because, it will make a, we have basically three parts of understanding. There are three parts. The first is the intellectual, here, mind. It knows things from the known sources. Whatever I know, I analyze here. I make it more mechanical, more theoretical, more conceptual. So the thinking or the understanding is more conceptual here, from whatever is coming from here. Then we go down from our heart, mind to the heart. This is our innate intelligence, the heart intelligence. The things which we feel, although our mind is saying one thing, we usually say that there is always a fight between heart and mind. So this is basically a fight between the two intelligences, learned intelligence and our innate intelligence, the intelligence which we were born with. So that is more to the heart. Then we go more deep around our umbilicus. This is the very seat of, you can say, transcendental intelligence, the intelligence which basically bounds us with everything. You can also call it as the intelligence of our soul or the vital force, whatever word you want to give it. So it is more deep intelligence which we have. Many times we call it as the gut feeling. Many times we call it as the intuition. There are many names which we call it. But suddenly, out of any this thing, out of any uh, without any kind of input of the information, without any kind of this thing, sometimes you have gut feeling that this is the right thing. Your mind is going into the pros and cons of the thing, it is saying it is a bad thing. The heart is also afraid that we should not do, but the gut or this part, I'm saying, the part around the umbilicus, it says that it is okay, let's do it, go with this. That sound comes very infrequently. It is not a frequent sensation, but it comes sometimes. Everyone has experienced that thing. So that is the more deeper intelligence, more transcendental intelligence, the intelligence which connects us to the many things. So the body, it is not something which is mechanical. It works on very different levels. So similarly with the skin, coming back to the skin has its own intelligence. It has its own consciousness. Because of the skin's consciousness, because of this feeling, we are connected with the world. We are connected with our outside. The inside is connected with the outside. So whenever something from the outside is not satisfactory, it is not matching with the inside, whatever it is. So the first organ to get affected is the skin, which is taking in the information, which is bringing in the information. Dr. Hammer has called it the separation conflict, but there is a very wide nature to this conflict. Whatever the information is coming, I'm not liking it. The first information. So there are rashes, there are some itchings on the skin. So any kind of miasm, any kind of this thing which is developing inside, a root is developing inside, the primary symptoms are always shown on skin because of this reason. And then there are these branches, the leaves and everything, which are the secondary symptoms of the miasm. If we are just looking at this branch, we will see diabetes. If we are looking at this branch, we will see cataract. If we are looking at this branch, we will see hypertension. If we are looking at this branch, we will see some heart disease. If we are looking at this branch or this branch, we will see some kind of lung disease or some disease of the intestines. If we are looking at this branch, we can see some kind of mental disease or this thing. But these are different branches which the pathology has described as different kind of diseases. They are not the part of the whole. But Dr. Hahnemann is giving us the same understanding. See, all these branches, if you want to kill them, If you want to, treat the whole thing, attack here, cut it from the root. This whole thing will fall. This whole thing will fall. So that is why Dr. Hahnemann has given this understanding of the miasm so that we can go from that part of the pathology, or from the part of we are part of, so that we can take our mind from that disease and start focusing more on the whole. See, both the systems, the homeopathy and allopathy, in allopathy, diagnosis is very important, because the medicines can only be given according to the diagnosis. So it is a very important part of allopathic medical system. Now, if you see diagnosis, what is the diagnosis basically made of? What symptoms? For example, a person, the thirst is increased, the tendency for urine is increased, he is feeling weak, he is having this bursts, this intense desire to eat again and again. So the doctor will tell, okay, go and check your blood sugar. I think you are a diabetic patient. He goes, he checks, and the blood sugar is high. It is 240, 250, 300. So the doctor prescribes the medicine. So the medicine is being prescribed on the common symptoms of the disease. Completely opposite approach. Diagnosis is always made on the common symptoms of the disease. Okay, you are having this wheezing is there, dyspnea is there, you are coughing a lot. Okay, you might be suffering from allergic bronchitis. Let me write your remedy. Again, a common disease of allergic bronchitis. So the medicine is being prescribed on the common symptom. Homeopathy is completely opposite. Here the medicine is basically being prescribed on the uncommon symptoms, on the symptoms which are of the individual, not of the disease. So to give this understanding of the individuality, because next 2 or 3, I think 82 or 83, the case taking will start. The this aphorisms on case taking will start. So before taking us to that approach of individuality, he wanted to remove diseases from our mind. That don't think of disease as an independent character. They are all coming from the miasm. They are coming from this basic intrinsic sensitivity. And all these things, all these outer conditions, they are basically diversifying it. So if you go out, want to cure the sick, cure the patient, you have to cure this miasm itself. Go for that thing. Understand that thing in the patient. That what are the things which are acting from within? It is coming from within, not from eating sugar, not from eating salt, not from breathing bad air. No, it is coming from inside. See that thing and try to fix that thing. So that is the beauty of these aphorisms of the organon, that they help us to look at the patient as a whole, not in compartments. So that is we have to develop in us. In homeopathy, being a homeopath, we have to develop this thinking in us that no, I'm not curing the autism, I'm not curing cerebral palsy, I'm not curing Down syndrome, I'm not curing cancer. I have to cure the miasm. I have to understand the miasm in this patient, how this process is going on, how the soric process is going on, and I have to cure that. Once it is cured, that root is gone, the whole tree will fall, the whole tree of disease will fall. So second note, footnote to aphorism 81. How many improper, ambiguous names do not these works contain? So now he's talking about the pathological works, the names which are given of the diseases in the pathology. He's saying how many improper, ambiguous names. Improper names. Ambiguous means false. Do not these works contain, under each of which are excluded excessively different morbid conditions? which often resemble each other in one single symptom only as ache, jaundice, dropsy, consumption, leukorrhea, hemorrhoids, rheumatism, apoplexy, convulsions, hysteria, hypochondriasis, melancholia, mania, quinsy, palsy, etc. So he's saying that all these names are given to these kind of diseases, ache, jaundice, consumption, leuko, all these things, but they basically resemble, you know, each other only in one symptom. Like if there are 5 or 6 patients who are suffering from jaundice, only 1 or 2 symptoms are there which are resembling. Because the diagnosis is basically made on 2 or 3 symptoms, more than not more than that. Or even simple ones, 2 symptoms are there, and we make a diagnosis that so patient is suffering from jaundice or hepatitis. Now many different names are given. The more variety of names is there as compared to before, but that again does not solve the purpose, which are represented as diseases of a fixed and unvarying character. And we call that these are fixed diseases, like only this symptom will come. No. And they don't have any varying character to them. If we call that this is typhoid, you're suffering from typhoid. So does typhoid produces same kind of symptom in everyone? No. It has thousands of variations and are treated on account of their name. But the treatment is done, like I was telling you, the treatment is done on the diagnosis. If you have told that the patient is suffering from typhoid, the medicine will be given which is anti-typhoid. It will not matter what kind of symptoms are there in the typhoid. If in the blood, the Vidal test, it comes positive, that means you are suffering from typhoid, and these medical medicines are for the typhoid. According to a determinate plan. So the plan has already been determined. It is already written in the practice of medicine. A patient comes to you with typhoid, these are the medications. If they don't work, then give this medicine. If this does not work, then give this. How can the bestowal of such a name justify an identical medical treatment? So he's saying that so many variations are there. So how are we justifying the same identical medical treatment for all those patients who showed different kind of symptoms? Only 1 or 2 symptoms are basically same. For example, if there are 10 typhoid patients, the that's evening aggravation might be there, or just one that they all have fever. The thirst is different, the thermal is different, they are behaving differently, sleep is different, all these things. He's saying that we don't look. And if the treatment is not always to be the same, why make use of an identical name which postulates an identity of the treatment? He's saying that if you don't want to give the same treatment to all the patients, then why you have to name it? Why you have to give an identity to it? Why? It's a very famous of Dr. Kent, and his this thing that a patient comes to him and he asks that he has taken the case and he has determined some medicine. So he is asking that Dr. Kent, he is asking Dr. Kent that doctor, what is the disease which I am suffering from? He says that you are suffering from nux vomica, because all those group of symptoms basically told that nux vomica is required. So giving a name is not important. It is not important to give a name. Dr. Hahnemann, he is saying that we should not give these names. So there is something written in Latin says Huxham, a man, and the English translation of this is nothing, of course, has ever crept into the medical art rather than a pestilential evil than to impose certain general name on diseases. So there's this writer, doctor who is Huxham. He says that the most evil thing which has crept into the medical art, come into the medical art, the most evil thing is to give the name to the diseases, general names to the diseases. Now we see in the camps also in Thailand, in India, in our clinics also, there's a general name given autism to so many children who are behaving in different ways. There are so many different things about them. but because of some 5 or 6 symptoms which are similar, they are given the name of autism, and same kind of therapy, same kind of medicine, some pacifiers, they are given to these children. So that is what Dr. Hahnemann is talking about. Says Huxham, a man as clear sighted as he was estimable on the account of his consciousness. So this is the name of his book. And in like manner, Fritz laments. There was another, that essentially different diseases are designated by the same name. Okay, that there are different diseases. The diseases are different, but they are designated by the same name. Even those epidemic diseases, which undoubtedly may be propagated in every separate epidemic by a peculiar contagious principle. Dr. Hahnemann has not written the contagious bacteria or virus or contagious matter or material or particle. He is always describing it as a principle or dynamic contagion or dynamic infection. So we, through the whole organon, you will see the same pattern. So we have to go beyond that material part of the disease, the material causation of the disease. So he's saying that even in epidemic diseases, every epidemic is a separate epidemic. It is showing different kinds of symptoms, which are very peculiar to the contagion, the infection which was going on at that time, the dynamic infection which was going on at that time, which remains unknown to us, are designated in the old school of medicine by particular names. So all these epidemics also, they were given the, like we have seen in the recent times at this COVID, so many variation of symptoms. Some is having the symptoms of the heart, some of the lungs, some of the intestines, so many symptoms, varied symptoms. But it was given one name and one kind of medication was being given to all the people. Just as if they were well-known fixed diseases. So we have made a character in our mind that the diseases are basically fixed and they require fixed remedies. They require fixed remedies. So that is why, nowadays, like today, a patient, the same patient, they came that we went to some doctor, and the doctor just, like, okay, he just saw the reports, okay, your typhoid is this and this and fever is there, okay. He just took 3 minutes and he wrote the medication and he sent the patient, because we have this made a fixity in our mind. Fixed name means fixed disease, means fixed treatment. So the patient, they don't put more than 5 minutes or 10 10 minutes is a very big thing, not more than 5 minutes on one patient. That invariably reoccurred under the same form as hospital fever, gall fever, camp fever, putrid fever. So these are the names given to the different kind of epidemics at that time. Bilious fever, nervous fever, mucus fever. Although each epidemic of each roving fevers exhibits itself at every occurrence as another, a new disease, such as it has never appeared before appeared in exactly the same form. So every time that epidemic came, it showed so many new symptoms. You know, just few symptoms, 2 or 3 symptoms might be which are matching with the old thing, but they were given the same name and they were being treated in the same way, differing very much in every instance in its course as well as in many of its most striking symptoms and its whole appearance. Even the most striking symptoms, even the whole appearance of the disease, it was different, but still the same name was being given to it again and again. Each is so far dissimilar to all previous epidemics, whatever names they may bear, that it would be a dereliction of all logical accuracy. Dereliction is basically an insult in our ideas of things were we to give to these melodies. He's saying that they were so much dissimilar to the previous epidemics, and whatever the previous epidemics were named, they were given the same name to the recent epidemics, that in our logical accuracy, it is an insult to the logical person. That how we can see that these are the same maladies and the same medicine should be given to this thing, to this patient suffering from these diseases that differ so much among themselves. One of those names we meet within pathological writings and treat them all medicinally in conformity with this misused name. You see that this is an insult to the logical brain. That how we can say that this is the same disease, although it is showing so many symptoms which are different, but still we are giving the same name, and that misused name, because he's basically in the organ, and what Dr. Hahnemann is trying to tell, he is going to direct to the root of the problems. That what are the root of the problems and they need to be eradicated. That this naming of the disease, like that other gentleman, the Hux Sam, he has also said the same thing, that it is the biggest evil which we have done. With this, even in homeopathy, it is tried. They have tried in homeopathy. They are doing it. Therapeutics. In homeopathy, we call it therapeutics. Renal stone, Berberis vulgaris. Congestive headache, belladonna. Some problem of the weakness of the bones, calcarea calm. Teething, calcarea for. Homeopathy, in homeopathy also, the people, they started doing this thing. Giving the medicines on certain symptoms. But every dentition of every child is different. Even when a child is bringing first teeth, the symptoms are different. In the next, when the teeth are erupting in him or her, the symptoms will be different. Even the two teeth which are coming in the child, they are not of same, they are not showing the same symptom. Fever may be a common thing, but what about the other symptoms? What about the other symptoms? So now I will not say that this is only being done in allopathy. Yeah. No, this is also being done in homeopathy. But the problem, the root of the problem is the names. If you take all the name of the diseases, just forget all the names, then you will only see the symptoms. Because naming a disease and giving medicine to it is a very, very easy task. People, they would like to do easy things. They don't want to hard work. They don't want to go into the labor of who will ask so many questions, who will go and analyze about so many symptoms. But that is why, right from the beginning, in the preface, Dr. Hahnemann has said that this is a very laborious task. There are no shortcuts to it. Therapeutic practice is a shortcut. Because if in homeopathy there was a place for therapeutic, these aphorisms would become nonsensical. Either these aphorisms will be nonsense or the practice is nonsense. So there are no medicines, even in homeopathy, there are no medicines for tonsils. There are no medicines for headaches. There are no, we homeopaths, a right homeopath, a true homeopath, he does not understand the names of the diseases. He does not believe in the names of the diseases. Whenever a patient comes that my child is suffering from the autism, I always tell them, keep that thing aside. Tell me the symptoms. Tell me how he behaves. If someone is coming, okay, doctor, I'm having headache, I'm saying, keep the headache away. Tell me the symptoms. Tell me the feeling what you are having here. Tell me the aggravating factors. Tell me the ameliorating factors. Tell me how it starts, how it goes on. There is where our medicine is. The candid Sydenham alone perceived this when he insists upon the necessity of not considering any epidemic disease as having occurred before and treating it in the same way as another, since all that occurs successively. So the Sydenham, this man, he perceived, he understood this thing, that every epidemic, it should not be considered with the old one. He insists upon the necessity of not considering any epidemic disease as having occurred before. So that is why Dr. Hahnemann also says that whenever a patient comes to you, never think in a way that this kind of patient has come before. It takes you away from the prejudice. So coming back, so Sydenham said this thing that all the epidemics or all the diseases which are coming, they are completely different. One is coming after another, then the another, then the another. They are all different to the previous one. Be they ever so numerous, differ from one another. So again, something is given in the Latin language, which basically translates to this: nothing, in my opinion, astonishes the mind of the whole, by which it is evident as it scans the orchids of medicine, not so much the different seasons of the same year, as the discrepancies between the year constitution of each year and those which depend upon them. He's saying that, in my opinion, nothing astonishes the mind more than this thing, that even the seasons of the year, every year, the seasons, they are not same. There are discrepancies between it. There is always something different about them. And all the things which depend upon them, on the seasons, on the, this thing, how can they be same? Because he's, at that time, even now, many things we say that, the kind of seasons which are coming, we mostly say that this kind of viral is going on nowadays, or that, because we say that these kind of symptoms are there. So he's saying that, we go more further, the open diversity of the aforesaid diseases, both proper and peculiar to themselves, as well as by reason of their proper mode of treatment, which they claim to be altogether unequal to them, shines on them. From these, it is evident that these diseases, so as to be of some extent external in appearance, and some symptoms coming on at the same time to both, may seem to agree a little more careless, but in fact, if you observe the mind correctly, they are of a very strange disposition and as distant as the air of wolves. So this is basically a loose translation of Latin. It might be more prominently some things in that Latin part, but I have translated. So what is the crux of the whole thing? So the Sydenham, he is trying to say that the year is different, the weathers are always different. Even if the summer is coming every year, it is not the same kind of summer. Even if the winters are coming every year, the same kind of winter is not coming every year. So whatever is dependent upon these things, either it is the flowers, either it is the vegetation, either it is the flow of the rivers, whatever it is, how can it be same every time? And even if the diseases, if it related to the seasons, that every year something different is there in the atmosphere, there in the telluric part or in our environment, everything is different, the vegetation is different and every, so how can the diseases be the same? How can we say that it will be more careless to agree on this thing, that every time the epidemic is coming, although it is showing some symptoms of the old epidemic, but there are so many new symptoms, some symptoms coming at the same time to both. Okay, there are some, but there are so many more symptoms. So when you observe it correctly, you will see that every has a strange disposition. Means every epidemic has a kind of individual disposition of its own, kind of original symptoms of its own. From all this, it is clear that these useless and misused names of diseases ought to have no influence on the practice of the true physician. So this part is what we have to remember when we are going to see the patients. It's a very, very important part of homeopathic practice, because your prescription most of the times, it depends upon this thing, whether you are thinking about the disease or you are thinking about the patient. So it should have no influence on the practice of the true physician, who knows that he has to judge of and to cure diseases not according to the similarity of the name of a single one of their symptoms, but according to the totality of the signs of the individual state of each particular patient. What is the individual? This is what we have to decide in two things, that where we are going to put our attention: the individual state of each particular patient, or the name of the disease. Whose affection it is his duty carefully to investigate, that it is the duty of the physician to carefully investigate this affection which the patient is suffering from, but never to give a hypothetical guess at it. Names are hypothetical guesses. I think you're suffering from typhoid. It's a completely different disease than whatever the typhoid was, whenever it came first time. If, however, it is deemed necessary sometimes to make use of names of diseases in order when talking about a patient to ordinary persons. He says that, okay, you can make use of the name of the disease deemed necessary when it is very necessary. For example, I am talking about you. I'm talking with you about a patient. Okay, I had a patient who was suffering from autism. So it gives a rough idea to you that, okay, the patient will have these kind of symptoms. Then we move forward. When talking about a patient to ordinary persons to render ourselves intelligible in few words, we ought only to employ them as collective names and tell them the patient has a kind of Saint Vitus dance. Okay? So he's saying that, okay, the other person, for example, you are talking with a physician or some other person, if you, because everyone, again, that mental training, the perception of everyone is that a doctor knows the names of the diseases. Doctor should know, okay, that what is epilepsy, what is dropsy, what is renal failure, what is cardiac failure, what is a stroke. The doctor should know this thing. If you don't know, the people will say, okay, the doctor does not know anything. So he says that to render ourselves intelligible in few words. In few words, we should tell the person that we have this intelligence, we know the things, but we should not believe in that thing. That those are two different parts. Those are two different parts. So because we are living in a society which is basically based on these things, and I'm right now I'm talking about homeopathy or the medical science. There are so many things. There are things which we say, which we do, but we don't believe in them. And it is important not to believe in them, even if we have to say something. I'm not saying in a negative manner, that, okay, I'm saying to someone that you're a good person there, but I don't believe in that thing. I'm not saying like that. But yes, because uh, our profession or our society, there is something we always project. There's always something which we project to other people. But that projection should be in a way that it should not be deceiving to the other person also, but it should solve the purpose of communication also. If I'm projecting myself as a very virtuous man, but I am not, that is a deception. But if I'm projecting something which, for example, okay, if you need my help, you can ask for it. I mean it also, but I'm projecting it also in a way through my words. I'm telling the person. If I just feel it inside, okay, I should help him. I should help him, but I'm not talking about it. I'm not saying it in intelligible words. Then there is no meaning of just feeling it also. So we also, as homeopaths, Dr. Hanuman is telling in this, that if someone is asking, then we can say that the patient has a kind of autism, the patient has a kind of heart disease, the patient is suffering from a kind of ague, kind of typhus, kind of dropsy, in order to do away once for all with the mistaken notion these names give rise to. So this thing, both the things will be served. You have told about the disease also, or the sufferings of the patient, and in yourself also, you are away from that thinking, or you are basically away from the um, deception which the name of disease creates. We should never say he has the sandwiches dance, the typhus, the dropsy, the ague, as there are certainly no diseases of these similar names of fixed unvarying character. So there are kind of these diseases, but no fixed disease. Okay. So although by the discovery of that great source of chronic disease, as also by the discovery of the specific homeopathic remedies for the sora, medicine has advanced some steps nearer to a knowledge of the nature of the majority of diseases it has to cure. Yet, for settling the indication in each case of chronic psoriatic disease, he is called on to cure. The duty of a careful apprehension of its ascertainable symptoms and characteristics is as indispensable for the homeopathic physician as it was before that discovery. Okay. So he's saying that although that when we have discovered this source of the chronic diseases, the miasm as a source of the chronic disease, the sora as a source of all the chronic diseases, he says that, and also by understanding the medicines which can cure these sora, we have come more near to the cure of these diseases. Yet, for settling the indication in each case of chronic disease, he is called on to cure. Okay, so we have this understanding of Sura now with us, but what we have to do further is whenever we are called on, like whenever we have to see a case of chronic disease, of the disease originating from the Sura, the duty of a careful apprehension of its ascertainable symptoms. The physician has to do his duty, the same duty which he was doing before also, that apprehension, understanding of the ascertainable symptoms and the characteristics is as indispensable for the homeopathic physician as it was before that discovery. So even before the discovery, we were bringing the understanding the characteristics of the patient, understanding the symptoms of the patient. The same thing is to be done now also, as no real cure of this or the other diseases can take place without a strict particular treatment, individualization of each case of disease. So for individualization, we have to come up with the characteristics, we have to understand the patient, we have to understand the symptoms, and make an individual case of every patient. Only that in this investigation, some difference is to be made when the affection is an acute and rapidly developed disease and when it is a chronic one. This we have to see after taking the case whether this is an acute, rapidly moving disease or whether it is a chronic disease. Seeing that in acute disease, the chief symptoms strike us, become evident to the senses more quickly, and hence much less time is requisite for tracing the picture of the disease, and much fewer questions are required to be asked. In an acute disease, the chief symptom, whatever the symptoms are chiefly there, whatever are the prominent symptoms, they strike us. They are very prominent. Okay, which become evident to the senses more quickly. We can understand them, we can see them, we can hear them, we can smell them, whatever kind of symptom is it, and hence much less time is requisite for tracing the picture. So because the chief symptom is so evident, it is coming out so strongly, so the whole picture does not need to be traced because it is of recent origin, the acute disease, especially the epidemics I'm talking here Dr. Hanneman is talking about, because all the other diseases, the sporadic, the individual, they all come under the psoriatic development. Okay, so this is more about the epidemics. So all these acute diseases, they are basically evident to see at that time, need not to be traced long back because it is of recent origin, and much fewer questions are required to be asked. Very less questions are required, as almost everything is self-evident, because all the symptoms are self-evident, they are in full bloom, we can see that, we can see what is happening, and we can give the medicine accordingly. Then in a chronic disease has been gradually progressing from several years, but the chronic disease, it is gradually, slowly progressing from many years, in which the symptoms are much worse, sorry, in which the symptoms are much more difficult to be ascertained. So in chronic diseases, the symptoms are difficult to ascertain. We have to ask many questions for it. We have to take the history from how it started, what are the symptoms which were in the past, what are the symptoms which are now, what kind of characteristics they have. So it is a long case taking, we have to give it time. Footnote to aphorism 82. Hence, the following directions for the investigating the symptoms are only partially applicable for acute diseases. So now, whatever the directions Dr. Hanneman is going, the case taking will start from aphorism 83. So he's saying that they are partially applicable. You, in an acute disease, you don't have to ask all these things. Only some parts of it you can use in the case taking of acute diseases. We will come to that part when we will move towards the acute diseases. So for now, what we have to understand is that we have to understand this miasm, how it is working in the patients. From all these aphorisms, what Dr. Hahnemann is basically trying to teach us. He's basically trying to tell us that don't think of the diseases as some individual things. It is part of the whole. It is part of the sora. All these branches and leaves, they are very small parts of the whole big tree. So concentrate on the roots of the tree. Concentrate there. Because all the characteristics, all the individual characteristics, as we move forward with the case taking, we will talk about it. We will discuss certain cases which I will give you example of, that all these characteristics, they only come to your mind, or they are only reflected when you are thinking in a way that, I have to understand the sora of the patient. I have to understand from where the whole thing is coming. I have to understand the causation. I have to understand what kind of different things or different individual characteristics this disease has produced in this particular patient. Because all the sum of all these characteristics is basically which points to us to our remedy. It is the only thing. Okay? So from all these aphorisms, this 2 or 3 aphorisms, this understanding of sora, I always say that, look around ourselves, look about in the family. Like if you are 2 brothers, or some 2 sisters, 1 brother, 1 sister, or more than that also, try to understand what is commonly going on in the family. Like what were the things which our father and mother believed in, and what we are also believing in. Try to understand things in this way, because all this mental training, I'm just trying to tell you about the mental training which we have done, which the reinforcement again and again and again, which we are doing. Because whenever we are talking with our siblings, with our this thing, with our parents or something, there will be some common topics, common things which would come up, and we will talk about those things. We will talk about those things. We might argue about those things, we might fight about those things, we might agree on those things, but there are some things which which will come up. And that is why the people who basically are very much close to the family, who are very introvert, very reserved, timid, and they don't have many friends, they don't go out much, they always, you will not see much growth in their personal characters, you will not see much growth in their intellectual characters. Just, it is my observation about the society. The people who go out more, who have many friends, who have a lot of friends, they are more, they have more different kind of opinions. They can think about a problem in different ways, because they have accepted different views. They even not accepted, but they have gone through, they have understood different views of the world or the society. If you come to India, there will be some things which will be new for you. The people who are from Thailand or from Brazil or from US, when you're coming to India, there are many things which will be new for you. When we go out, I think see many things which are different. So when we go from one society to another society, when we go from one family to the another family, when we are mixing with new kind of people, we are exchanging so many views. They can be positive, they can be negative also. I'm not saying that thing. It can be also contagion, a new contagion, which we might bring back to the family. But that we have to consciously think that that's a different thing. But I'm just telling that, if we want to understand this thing more deeply, that how this thing is, we have to start with ourselves, the surroundings which we are in. then go move forward, then understand the patient in their surroundings. Because we cannot understand a patient until we don't know in what kind of surroundings they have grown, what kind of parents they had, what kind of it will come in the case taking part when we will go through it. Dr. Haneman stresses on this thing that we have to understand the patient, the development of the patient or this thing, how he is or she is, how they were developed, because it gives us an insight into what kind of things they basically think. So we'll start with the case taking uh, on next Wednesday. Till then, think about this thing, because this is a very great thing. Our brain, our mind, our intellect. The more we think about something, the more kind of clarity it gives to us. Sometimes questions, sometimes clarity. If the questions will come, they are welcomed all the time. If the clarity will come, it is then this particular lecture will be, you know, it has done its work. This particular class, this particular thing has done its work. Whatever it was meant for, that will be done if the clarity comes. So, but the more important thing is to think about this thing, this ancient thing which is being transferred to us through many sources, through traditions, through cultures, through religious, this thing, and how we are basically, I will use a word, entrapped, because we never feel free. You never feel free. We are always entrapped in this thing. So, okay, but that will be a talk for some other time. But yes, think about this thing and how it is basically affecting us. Thank you. Thank you very, very much. And a very good night to all of you. Very good evening to all of you. So today we are here again for our next part of the organon. Today we will start with the aphorism 83. So from here on, the case taking starts. Dr. Haneman, he gives different points on how to take a case. There are around 22 to 25 aphorisms of case taking. Today we will try to do at least 10 case taking aphorisms. So wherever there is something important, we will stop there, discuss it, because when we are doing a case, these are the points, it is kind of a recipe which is given to us, the pointers to the recipe for making something. So these are those pointers. This is a kind of formula, how to do the thing. But again, like I have told before also, that case taking is basically an art. From science to art we have to go. This is the science of case taking which we are going to study today, which we have to change into the art. You give this formula to everyone, you give the formula to recipe to everyone, to many chefs, but they will not, whenever they make something out of that recipe, the dish will not be same of all the people. That is the art. Application of science is basically art. So we will try to understand the science today, and then by practice, by knowing about it more, by doing it again and again and again and again, by refining it, we will transform it to a thing which we call as the art of case taking. So we'll go ahead, we'll start with it. So aphorism 83, this individualizing examination of a case of disease. Okay. Individualizing, we have to do an examination of the case which will individualize the whole case. That is the aim of the case taking. Yesterday I was talking with some students in my clinic, that like after 2 months, 3 months, 4 months, when you are doing case taking on a regular basis, if you are observing, because we have to observe ourselves from time to time, if you are observing that you are taking the case in the same way, you are asking the same questions again and again, you are getting the same kind of answers again and again in your case, then somewhere, we have stopped in our progression, we have stopped in our development. That means that we are not individualizing the case now. We have remembered or memorized some questions, and we are asking those questions again and again and again and again. And when you're asking the same question again and again, most of the time you will get the same answers, the similar answers. You will end up with in the similar remedies, similar group of remedies. So every 2-3 months, we as homeopaths have to somewhat, sit, meditate in the sense, try to understand about ourselves, that whether we are developing continuously or we have stopped somewhere. Because the purpose of taking a case is to individualize the patient as a whole. So that has to be done. That should be done every time we take a case, for which I shall only give in this place general directions. So there will be general directions by which will Dr. Honeyman has given from aphorism 83 onwards regarding the examination of the case, of which the practitioner will bear in mind only what is applicable for each individual case. Again, the same thing that the practitioner has to bear in the mind. He has to keep this thing, this thought, this idea alive in his mind, that every case is an individual case, and whatever is applicable of these directions, I will apply only those things in this particular case. Demands of the physician. What is demanded is to take a case. What is the requirement? Nothing but freedom from prejudice and sound senses. Only two things. You should be away from prejudice. Don't take a new case as you have taken some old case. Don't bear in the mind any kind of remedy, any kind of particular symptom when you are taking the case. Okay. We should be away from prejudice. And sound senses. The senses should be sound. Sound senses here means that it is not that your hearing should be very sharp, or smell should be, you should be attentive. When you are taking case, we have to be very attentive. The next line, attention in observing. Very attentive. We have to be there. We have to forget everything else, and we have to be there. We have to be present there. And fidelity. Fidelity means loyalty. Fidelity in tracing the picture of the disease. We have to be very truthful, that whatever the patient has told or whatever has been observed, it should be taken as it is. Many times I have seen the doctors who have this tendency, on working this the rubrics of delusions. If you have this thing, then this kind of delusion may be there, or this thing. That is completely against this part, the fidelity in tracing the picture of the disease. There is this doctor, uh, the lady, she had, he was taking a case. Someone told me, I have not heard personally, but someone told me this thing, that he was taking the case, and the lady, the mother of 3 children, she told that I have 3 children. So he took the rubric delusion ruined she is, that, oh, she has 3 children, she might be thinking. So this might be, this speculation is basically an infidelity. This is falseness. Whenever we start speculating, and that speculation comes in our analysis, and then it goes into our remedy, tracing the remedy, the whole thing goes away. So it took this rubric delusion ruined, and he gave some medicine to the patient. And for the observer, if there is some student, there will be a wow that how he got to the remedy. We have to understand that we are not here for that wow effect. When we go through the organon, there are very small things in the organon, which basically tells us that how we have to understand the patient, how we have to understand the materia medica, how we have to understand the homeopathy. Homeopathy is all about truthfulness. The more truthful we are in our approach, how we have to approach the case, how we have to approach the patient, how we have to um, the things which we know in our experience, the more good results come out of it. So there are four things which Dr. Hahnemann is asking to us. Well, we start with our case taking: freedom from prejudice, sound senses, attentive observation, you know, complete attention, and fidelity, truthfulness, while we are tracing the picture of the disease. So aphorism 84, the patient details the history of his sufferings. So the patient will tell about the history of the sufferings, all the details which are there. Those about him tell what they heard him complain of, how he has behaved, and what they have noticed in him. The attendants, the family members, the friends, the people around the patient, they will tell us about how the patient complains, how he has behaved during the disease, and the physician sees, hears, and remarks by his other senses what there is of an altered or unusual character about him. And the physician, he observes the patient, anything unusual about him, what he sees, what he hears, anything. So basically, there are three sources of our information. One is the patient himself. Second are the attendants around him. And third is the physician himself. What physician notes? Because what the physician notes, even the patient does not know that he has this thing. Even the attendants being with him from a long time, they might overlook that thing. But physician, because of his knowledge of materia medica, because of his practice, because he has been doing this from a long time, he can make out of the characteristics in the patient, in the details of the history. So these are the three sources, and they should be used properly whenever we are taking the case. He writes down accurately all that the patient and his friends have told him in the very expressions used by them. Whatever the expressions, I always encourage that, whatever the language the patient is using, write down in the same language so that you can remember next time what kind of expressions, what kind of words they used. While we are taking a case, on the side you make a small box of observation. Write down the observation, that how they expressed the things, how they were telling about the things, what were the expressions, how was the pitch of the voice. Because all these things, maybe next time you, maybe because if you have so many patients, maybe next time you will not be able to remember those things, or not very clearly. So write down as much as we can, it is best. Keeping silence himself, he allows them to say all they have to say. Now, this is very important for me. I have always, I personally always focus on this thing: keeping silence. Now, usually the keeping silence is more here, but it should be here also, in the mind. Try that whenever your concentration is on the patient, try to keep your mind as silent as it can. A silent mind is able to hear more, to analyze more, to absorb more. Here we have to keep silent. That is understood. Okay. But here also, a very silent mind. Let those words fall on the mind, because if the mind is constantly speaking, or mind is into some kind of conversation, the thought is somewhere, and we will not be able to get the whole information. So this silence part is very important. and refrain from interrupting them unless they went wrong. Don't interrupt them at all. Let them speak. Okay. Even they don't let the attendants interrupt the patient or the patient interrupt the attendant. That is also important, because many times patient is speaking and the attendants they interrupt. Not if this kind of thing is happening a lot, then tell the attendant to sit outside for some time and talk with the patient. Then tell the patient to sit outside the cabin and talk with the attendant. Okay. There was this couple who came, the female, she came for the case taking, husband and wife. So the female was a patient. So whenever the female was telling, the husband will, keep giving him the information and the patient will deny that information. It came to that point that they started fighting in the clinic. So we have to avoid that kind of thing to happen from happening. Okay. So tell them to be silent, or if they cannot, then just tell them to wait outside for some time. So, and refrains from interrupting them unless they went wrong. If they wander off to some other kind of subject, to other matters, they are talking something which is, then, very slowly we bring them to the topic with few words as we can. It is very important while taking the case that the physician uses as few words as he can until and unless it is necessary. The physician advises them at the beginning of the examination to speak slowly. Tell them to speak slowly, that I have to write it down, because there will be many important points which you have to write it down. So, it should not be like if you are writing the previous point and we miss on the next part. So tell them to speak slowly. Okay. Or if you can tell someone, if you can, someone with you, some assistant, tell them to write down whatever they are saying, and you also write down the important points so that you can have as much of information as you can. So in order that he may take down in writing the important parts of what the speakers say. Footnote to aphorism 84. Every interruption breaks the train of thought of the narrators. Why we have to refrain from speaking while the patient is narrating? Because whenever the patient is narrating something, there is a train of thoughts. There is a flow of information which is going on. And with that information is what we are going to get some symptoms on what has happened or how it has happened. And if we break that train of thought, the patient or the attendant or whoever is telling us, they might not be able to go back there. All they would have said at first does not again occur to them in precisely the same manner after that. So once that train of thought is broken down, if that narration is broken down, then there is very less chances that they can tell it in the same precise manner. So he begins a fresh line with every new circumstance mentioned by the patient or his friends, so that the symptoms shall be all ranged separately one below the other. He can thus add to anyone that may at first have been related to in too vague a manner, but subsequently more explicitly explained. So everything which we are writing, every symptom, it has to be started with a new line. It should not be jumbled up, so that when we are going through, it again, we don't miss some points because they are jumbled up. We can do many kind of new things with this process. You can put in the boxes, you can underline the important parts. But yes, many times when we are doing this thing, that highlighting some point or underlining, like I was talking about this in this time, the Thailand workshop, many times when we think about some symptoms to be characteristic, for example, I think 2 or 3 symptoms should be characteristic. From there I prescribed lycopodium, but the patient didn't got better with lycopodium. So the next time when the patient comes, I will again think from all those 3 or 4 points which I thought of characteristic. I will try some other remedy. I will give pulsatilla, I will give calcarea, I will give sulfur, which has those kind of 3 or 4 symptoms. I might go, give ignitia or something like, because then I will not think out of those 3 or 4 symptoms. I will be prejudiced with those 3 or 4 symptoms. So we can mark it down, but we have to keep in mind that this marking can also make us prejudice. Every time we see the case again, if we have to see it again, if we have to analyze it again, then we will go with all those 3 or 4 symptoms and we will keep arriving at almost similar remedies. So the best way, if you can reanalyze that, okay, I am getting prejudiced now, I am prescribing only on those 4 or 5 symptoms or 3 or 4 symptoms which I am prescribing from long time. Just throw those symptoms out of your analysis. Make it a mind that I'm not going to take these symptoms now. I will not be prejudiced. I will read the whole case again. If needed, I will ask the patient again, take some other symptoms, take some other characteristic symptoms, go through the whole case taking again and try to find out some other things from the case. And from there, I will prescribe. And this helps you to get out of that prejudice. Okay. So here in the aphorism, Dr. Henneman is saying that every symptom should be started with a fresh line, so that when we are asking about these symptoms, if we get some more information about it, some extra information about it, we can write it down. Okay, so always give some space with the symptoms. When the narrators have finished what they would say of their own accord, the physician then reverts to each particular symptom and elicits more precise information respecting it in the following manner. So when the narrators have finished, they have done, they have told whatever they have to tell on their own accord. The physician then asks about each particular symptom. He will start from the beginning. For example, the patient has told about the headache, then that I have headache, it is very severe, it is violent, the vomitings come with it, there is sometimes vertigo also, I have to take a painkiller. Then when all these things are said and everything is said, then the physician will start with, okay, tell me about something more about the headache, some aggravating factors, some ameliorating factors, what kind of pain it is, how it extends, so more precise information. He reads over the symptoms as they were related to him one by one. He will read over the symptoms as they were told to him, and about each of them he inquires for further particulars. For example, at what period did this symptom occur? So, was it previous to taking the medicine he had hitherto been using, while taking the medicine, or only some days after leaving of the medicine? So we will start asking some further particulars, some further questions, like I was telling that what time the pain starts, or the pain has been there before you started some kind of medication, or it is only during the medication or after leaving the medication, what kind of pain it is, what sensation exactly. Try to ask the patient that what kind. Many times the patients use some words in their language, whatever the language they use. In that language, they use some things, which we have to relate to what kind of expression is given in the materia medica of that language. Some may use that it is bursting, or it is pulsating, or it is very dull pain. I cannot even make that where it is, but it is there always. Where was the precise spot? Did the pain occur in fits by itself at various times? Was like the pain was in episodes, or it was a continued pain without intermission? How long did it last? At what time of the day or night? In what position of the body was it worst or ceased entirely? So some time aggravation, some time modalities, some position modalities. These are the questions which we can ask. What was the exact nature of this or that event or circumstance mentioned? So whatever basically they are mentioning, we have to elicit more information regarding it. When did this happen? How did this happen? What was the reaction? You know, how it started, how it ended, everything described in plain words. Just tell the patient to describe as you think about it. Aphorism 87. And thus the physician obtains more precise information respecting each particular detail, but without ever framing his question so as to suggest the answer to the patient. So we have to ask the question, but we have to frame a question that the question does not suggest an answer. First of all, don't give options. If you're asking what kind of pain it is it bursting or it is irritating or it is, like a piercing, don't give them the options until and unless it is required. Just first ask them in simple question that what kind of pain it is, what kind of food you like, any food causing any problems. Just the question has to be in a broad way. We have to see, mostly when patient comes to a homeopath, he is coming from the other system, coming to homeopathy for the first time, or he might be exposed to some other homeopaths, but he's coming to you for the first time. So we have to make him think about the things. Okay, we have to give him some questions so he thinks about it. We should not be giving him answers, that will be a more of misleading the way to the patient. We will be misleading them to give some kind of answer which are not truthful. For example, I asked that, do you like cold water? So this is a more of a yes or no answer. Dr. Kent has very particularly told about this thing in his philosophy on this case taking part, that if the answer to your question is yes or no, your question is wrong. It is the wrong question. The question should not have been formed in this way. Now, do you get angry easily? This is a yes or no answer. No. What kind of nature you have, like how you behave, how is your disposition? We have to ask broader questions so that he shall only have to answer yes or no. We should not frame the question in a way that it is a yes or no answer, else he will be misled to answer in the affirmative or negative, something untrue, half true, or not strictly correct, either from indolence or in order to please his interrogator. Okay, so out of the indolence means because it has to be yes or no, so he is not giving in the other facts, he's not putting in the other facts to answer that question. Do you like cold water? Yes, I like cold water. Okay. So that will be more of half true or not strictly correct. We cannot rely on that kind of information, from which a false picture of disease and an unsuitable mode of treatment must result. So we will be forming a false picture of the disease, and because the picture of the disease is false, the information which we have got is not correct, so we will not be able to give a correct medicine. So in these aphorisms, these are basically kind of do's and don'ts. So we have to remember the don'ts also. What we do, that we will remember because we are doing it, but what we don't have to do, that also we have to remember very, we have to keep that thing in the mind. For instance, the physician should not ask, was not this or that circumstance present, regarding the circumstances, whether, you know was it a hot day. This is a yes or no answer. Okay, what kind of a day it was is a more better answer question, sorry. He should never be guilty of making such suggestions, which tend to seduce the patient into giving a false answer and a false account of his symptoms. So, this is why it is an art, the case taking, because we have to, the case taking, the interrogation is an art where we have to make the patient think about everything, about his feelings, about his sensations, about his symptoms. Many times the patient have forgotten so many things about their life, about about their disease also. So we have to make them aware of all those things. We have to bring back all those memories to them. So our question should be in a way that all those things come to the patient. We have to stimulate it in a right way. If in these voluntary details nothing has been mentioned respecting several parts or functions of the body or his mental state, the physician asks what more can be told in regard to these parts and these functions or the state of his disposition or mind. Okay. So, for example, while giving the case, when the patient is narrating it, if some details are not given regarding some parts of the body, regarding some the mind or the other functions of the body, then the question will the physician will start asking questions regarding those particular things. But in doing this, he only makes use of a general expression. But again, we have to make use of general expressions. For example, patient is not told about the some gastric symptoms, so we just ask in general way that any kind of gastric disturbances. Let him think. Okay, how about the stools? How is your thirst? How is sleep? How is your memory? So we just ask in a general way, in order that his informants may be obliged to enter into special details concerning them. Okay. So even the information from the informants can come when we start asking in this way. For example, if I that how is the memory? Before the patient tell, the attendants will tell that the memory is very sharp. His memory is very sharp, or it is not very good. He forgets the things easily. We have to make him remember of about the events or about something which has happened in the past. For example, the examples for what uh, was just told, like how the we have to ask about in a general way, what is the character of his stools, how does he pass his water, mean urine, how is it with his day and night sleep, how is the sleep in the night, how is the sleep in the day, what is the state of his disposition, his humor, his memory, like I was telling, how about the thirst, what sort of taste has he in his mouth, what kinds of food and drink are most relished, what are most repugnant to him, has each its full natural taste. Like for example, whenever you are eating something, do you get it full taste or it is some kind of unusual taste? How does he feel after eating or drinking? So these are basically general questions. Has he anything to tell about the head, the limbs, or the abdomen? Okay, so don't ask that. Do you have headaches? No. Ask him about the head. Do you have pain in the limbs? No. Ask him about the limbs. If there is something important, it will come to his memory. Okay, if there is nothing there, nothing important there, nothing which bothers him much, or there is nothing, then he will just simply say that no, there is no problem with that thing. Aphorism 89. When the patient, for it is on him we have to, we, we have, yes, for it is on him we have to chiefly rely for a description of his sensations, except in the case of faint diseases. So, okay. See, the subjective symptoms, there are symptoms which are subjective, which belong to the patient, which only patient can tell. For example, the sensations. For example, what he is feeling. That cannot be told by the attendant, that cannot be observed by the physician also, because it is something which is internal. Sensations, what kind of pain is, what kind of sensation he is feeling or she is feeling. So we have to depend on patient for these informations. Behavior can be told by the attendant, some kind of talk which the patient keeps on talking, that can be told by the attendants. But for the subjective symptoms, what the patient is feeling, those sensations, those pains, that all thing, some extensions of the pain, only the patient can tell all these things. Except in the case of feigned diseases. Feigned disease, for example, there are some kind of delusion, there is some kind of symptoms which are made up. We cannot rely on those in those cases on the patient. When the patient has by these details given of his own accord in the answer to inquiries furnished the requisite information and traced a tolerably perfect picture of the disease, the physician is at liberty and obliged, if he feels he has not yet gained all the information he needs, to ask more precise, more special questions. When the patient has given all the details which he can and somewhat picture of the disease is traced, but the physician feels that no, I need something more. I need something, more regarding this thing. There has to be more information. Then at that time, the physician is at liberty and also obliged to ask more precise questions, to ask more special questions. But then again, those special questions should not be yes or no questions. That has to be kept in mind. Okay, there are a few examples in the footnote. For example, how often are his bowels moved? For example, okay, from the first question would be how are bowels, how are stools? If the patient is not giving proper, then how we can start asking more about it, that how often are his bowels moved, what is the exact character of the stools, did the whitish evacuation consist of mucus or feces? Some examples, mucus or feces or something, we are giving the examples now. Had he not pains during the evacuation? What was their exact character? Where were they seated? The pains. What did the patient vomit? Is the bad taste in the mouth putrid or bitter or sour or what? Okay. So now we are giving a little options to him, because many times the patient is not able to understand also that what kind of information we are asking. So we have to give some examples. But it is in the third phase, third phase of the case taking. At what period of the day was it worst? So we have the main thing to understand, that we do not start with these kind of questions. The first phase is where the patient is voluntarily telling us everything. The second phase is when we feel that okay, he has told everything, but we need more information about it. So general questions are asked. So this is the third phase, when we think that still the information is not given properly, and we need to give him some options or some things we have to tell him that. Then we start questions like this. So this taste of the mouth before or after eating or during the repast, at what period of the day was it worst? What is the time of the day when it is worst? Whether it is in morning, whether it is afternoon, whether it is evening, we can ask like that. What is the taste of what is rectated? Whatever is rectated or whatever is, what is the taste of it? Does the urine only become turbid on standing, or is it turbid when first discharged? The color of the urine, what is its color when first emitted, or what color is the sediment, or how does he behave during the sleep? Does he whine, moan, talk, or cry out in his sleep? So the main thing is to understand that then now we have started asking more uh, precise questions. From general we are coming to more smaller parts to more precise parts, giving options, more smaller things in a big thing. We are trying to understand that thing. Does he start during sleep? Does he startle or he snores during inspiration or during expiration? Does he lie only on his back or on which side? What is the position during the sleep? Does he cover himself well up, or can he not bear the clothes on him? Does he easily awake or does he sleep too soundly? The character of the sleep, how it is. So we have to give the options. And these options, now we have to understand one more thing, because I think when we will be done with the case taking from the organ, I would like to discuss few points of case taking apart from this thing. Apart from this thing, because I think though they are also very important. It is basically based on this thing. Whatever Dr. Hahnemann has told, it is based on this thing. What it is, more of the things coming from the practical experience, that what are the things which should be done and which should not, which should be avoided. So the main thing is that all these questions, the more deeper questions, the more precise questions, how they come into our mind is when we keep reading Materia Medica. Because when we have read about positions in Materia Medica, then only the question of asking about the position will come. That what kind of position he sleeps in, or what kind of character of the sleep. Because we have read about the character, different characters of the sleep. So Dr. Kent also describes it that the Materia Medica will become your language of case taking. So it has to flow from there. So again, coming to the first thing which we were discussing, that if somewhere we think that our case taking has become more repetitive, that also means that our study of Materia Medica has become less. Because if we are continuously going on with our study of Materia Medica, we are studying new and new remedies, we are studying new and new symptoms, those symptoms will automatically keep coming in our mind when we are taking the case. They will automatically come. How does he feel immediately after waking from sleep? So when he wakes up from the sleep, how is he feeling? Is he feeling fresh? Is he feeling sleepy? If sleepy or some symptom is there, some headache is there, how often does this or that symptom occur? What is the cause that produces it each time it occurs? If there is some symptom coming, what is the cause? How it starts? Does it come on while lying or sitting or standing or when in motion, only when fasting or in the morning? Uh, I think yesterday we had a patient, the girl around 13 years old. She told that, she feels this intolerable hunger. So the next question is that every time you're hungry or some particular time? So she said, no, when I wake up in the morning. When I wake up, the first thing which I have to do is eat something. I have to do that thing. Otherwise, there is a very bad sensation, and there is very intolerable hunger which I feel. I cannot tolerate that. But it is not during the whole day. So that becomes a characteristic of the case. That becomes, something which you can prescribe upon. So only when fasting or in the morning or only in the evening or only after a meal, or when does it usually appear? When did the rigor come on? Like for example, in the fever, when does the rigor or chill comes on? Was it merely a chilly sensation, or was he actually cold at the same time? It was only a sensation of chill, or he was also cold to touch? If so, in what parts? Or while feeling chilly, was he actually warm to touch? Or it was opposite, that he was feeling chilly, but when someone touched him, it felt more warm or more hot. Was it merely a sensation of cold without shivering? Was he hot without redness of the face? What parts of him were hot to the touch? Or did he complain of heat without being hot to the touch? Like there is this patient that whenever the fever come, only the abdomen becomes hot. How long did the chilliness last? How long the hot stage? When did the thirst come on? During the cold stage, during the heat, or previous to it, or subsequently to it? So there are so many questions, but these all questions are coming from Materia Medica. They belong to some remedies. When you have read about the thirst of different remedies, then there can be so many questions which will come, whether the thirst is quenchable or unquenchable. What kind of water do you want at that time? Does that water ameliorates the thirst or no? So many questions. How great was the thirst, and what was the beverage desired? When did the sweat come on? At the beginning or at the end of the heat, or how many hours after the heat? Because in some remedies, it is not immediately after the heat, but the heat has to go on for many hours and then the sweat comes. When asleep or when awake, how great was the sweat? Was it warm or cold, or on what parts? How did it smell? What does he complain of before or during the cold stage? What does he complain about? Like whenever he's getting chilly, whenever the cold stage is there, what are the other symptoms which are coming? Because it is very important in the intermittent fevers. When we will go to the part of intermittent fevers, we will talk about this thing. What during the hot stage? What after it? What during or after the sweating stage, etc. So there are so many questions which we can ask to get the precise character of the symptoms. So when the physician has finished writing down these particulars, he then makes a note of what he himself observes in the patient, the most important part of the case taking, and ascertains how much of that was peculiar to the patient in his healthy state. Again, the examples of that thing. For example, how the patient behaved during the visit. Whether he was morose, quarrelsome, hasty, lachrymose, anxious, despairing, or sad. We talked about this in last workshop in Thailand. The observation part. We have to observe. But before observing, we have to understand how a morose person will react, you know, how a quarrelsome person will react. Like I told you about that, the couple. So the first thing which we noticed about the lady was that she was quarrelsome, or sad, or hopeful, or calm, etc. Whether he was in a drowsy state or in any way dull of comprehension, how was the intellect? Was he able to understand the things? Like yesterday, we saw this patient of cancer from Brazil. So, whenever we were asking him some question, he would take some time before answering. There will be a pause of 4 or 5 seconds before he started answering. But then the answer will be a smooth one. So that means he has to think for some time before answering the question. So we cannot give him a remedy which have quick minds. He's not a person who is having a very quick mind. He may be somewhat confused about the answer. He may be somewhat, he want to be very sure about the answer, that whatever the answer I am going to give, it is the right answer. Whether he spoke hoarsely or in a low tone or incoherently, or how otherwise did he talk. There's a patient who comes. So when he's speaking, he's like, I have to tell him that, can you please speak loudly? So okay, he can go up to that. Okay, doctor, I can tell you. Then I have to go more, kind of across the table to hear what he wants to say. And some, they are so loud. Then there is one patient who, I am in my cabin in my clinic, and he is outside in the street, and I can hear him talking, like on the phone, or he's talking to someone, he's asking about something. He's so loud. So these are the characteristics which we have to observe. The patient or the attendants, they don't tell about these things. What was the color of his face and eyes and of his skin generally? What degree of liveliness and power was there in his expression and eyes? What was the state of his tongue? His breathing, the, the smell from his mouth, and his hearing. Were his pupils dilated or contracted? How rapidly and to what extent did they alter in the dark, in the light? So these are some things which we can examine. What was the character of the pulse? What was the condition of the abdomen? How moist or hot, how cold or dry to the touch was the skin of this or that part, or generally? Whether he lay with head thrown back, with mouth half open and wholly open, like in the acute cases, we can see for these things, or in some unconscious cases with stupor, cases with delirium. These kind of symptoms are very helpful at that time in fevers. with the arms placed above the head of his back, or in what other position? The position in which they sit. Like we were talking in the workshop also, some people they are sliding down in the chair like this, completely. Some they sit very erect. So what kind of position they are sitting, what kind of uh, you know the position they are comfortable in. What effort did he make to raise himself while he's raising himself from the chair? Like they recently we had a lady who had this pain in the knees. There is osteoarthritis of the knees, and she said it is very painful that I can. But when she got up from the chair, she was so quick and very rapidly she walked back. This does not tell us that that the patient is not having pain. No, they are having pain. If they are complaining, it means then they will be having that pain. But this tells us about the character of the patient, that the patient is a very quick person, energetic, even with this kind of disease. She was around, I think, 70 years old lady. At that age, with that kind of disease, she is an energetic person. So we have to give her that kind of remedy. And anything else in him that may strike the physician as being remarkable. So whatever we think is remarkable, we have seen hundreds of patients who have pain in the knees and the way they get up slowly. The more the pain, the more slowly they will get up. The more the swelling, they will get up more slowly. They will stand for some time. They will get into the position of walking, and then they will start walking. But this was something which was remarkable, which was characteristic, which is a very rare thing which we will see with the patients of osteoarthritis. The way she rose herself up. Okay? So the observation means, that our eyes, our ears, our nose, all our senses, they should be open to take in some information which is characteristic, which is remarkable, which is unusual. So that is the purpose of the observation of the physician, the careful observation, the attentive observation. Aphorism 91. So the symptoms and feelings of the patient during a previous course of medicine do not furnish the pure picture of the disease. So if the patient is having some symptoms and feelings which were during some course of medicine, or even when the patient is coming to us with the medicine they are taking, there are some symptoms and feelings which have started after this medication. These symptoms, they basically do not furnish, they do not give the pure picture of the disease. But on the other hand, those symptoms and ailments which he suffered from before the use of medicines or after they had been discontinued for the several days give the fundamental idea of the original form of the disease, and these especially the physician must take note of. But the symptoms which were there before they started taking the medicine, or when they have stopped the medicine, discontinued the medicine for several days, and then some symptoms come, they give us the original nature of the disease. But now today some medicines are there which cannot be stopped. We cannot stop them. So we have to ask the patient, what are the symptoms which started after the treatment started, and what were the symptoms before it. That can help us to give an idea about the original symptoms of the disease. Okay, because we cannot stop certain medicines nowadays. Like for example, if someone is having this Parkinson, they are taking Syndopa, we cannot suddenly stop Syndopa. The patient will be so much aggravated. Okay? So we have to ask that what are the symptoms which are previous to the disease, which were before the disease started. When the disease is of a chronic character and the patient has been taking medicine up to the time he is seen, the physician may, with advantage, leave him some days quiet without medicine, or in the meantime administer something of an unmedicinal nature and defer to a subsequent period the more precise scrutiny of the morbid symptom. If this can be done with some diseases, for example, thyroid or something like this, if this can be done, it should be done. The physician should tell the patient to leave some kind of medications for some days. If it can be done, again I'm saying. Okay. or give them something unmedicinal, some placebo for, okay, I'm giving you this for thyroid, so don't take that, and let the symptoms come, so that we can have a pure picture of the symptoms. But it should be done very cautiously and very uh, in a way that the patient does not have much problem. In order to be able to grasp in their purity the permanent uncontaminated symptoms of the old affection to form a faithful picture of the disease. But if it be a disease of a rapid course, now if the disease is of a very rapid course, and if its serious character admit of no delay, that it is very rapid and it is very serious disease, the physician must content himself with observing the morbid condition, altered though it may be by medicines, if he cannot ascertain what symptoms are present before the employ of medicines. So in those cases, even the other medicines are going on, there are effect of the other medicine, there are some symptoms of the other medicines. The physician has to satisfy himself, content himself, or be okay with it, that okay, whatever the medicine, whatever the symptoms are there, I will employ the medicines according to them, in order that he may at least form a just apprehension of the complete picture of the disease in its actual condition. So we have to apprehend the complete picture of the disease, that is to say, of the conjoint malady formed by the medicinal and original diseases. Okay? So we have to see the disease as a whole. All the symptoms produced by the medicines, there are some characteristics or some characteristics of the original disease. We have to take them whole in those cases, which from the use of inappropriate drugs is generally more serious and dangerous than was the original disease, and hence demands prompt and efficient aid. So the original disease was not as dangerous, but it was made dangerous by these drugs. So we have to take the whole picture in those cases, even the symptoms which started after taking the medicine, because when the disease is of rapid character, there is no time to ascertain or to ask what are the symptoms before. Even the patient might not be in that kind of condition to tell. So in those cases, we have to take whatever the characteristics, whether it belongs to the, because many times it is very difficult to understand in these cases whether this characteristic is of medicine, or whether this correct. For example, recently we saw this patient of ALS in Thailand. The lady was there, and she had this characteristic of laughing. She would laugh on every small thing and small thing. So that is a symptom of the medicine which is used for ALS. It produces that kind of effect on the patient. Many patients who have, so if you are very sure about some sign or symptom that okay, this is a characteristic in a patient. For example, if some patient comes who is not having ALS or who is not having that medicine, and he shows this kind of symptom, that laughter which is inappropriate, the laughter, very small thing laugh makes him or her laugh, then we will say that this is a very characteristic point or very characteristic symptom, something which comes involuntarily, which is cannot be controlled by the patient. But if we know, that is why we also need to know what kind of effects, like side effects, some particular medicines can show, so that while taking the case, we can understand what are the characteristics or what are the characteristics of the disease, and what are the symptoms that are produced by the drugs or the medicines. But still, in some cases, if we are not able to understand that okay, whether this symptom belong to the medicine or to the original disease, it is better to take everything which we think of to be characteristic and base our medicine on it. And by thus tracing out the complete picture of the disease, he will be enabled to combat it with a suitable homeopathic remedy, so that the patient shall not fall a sacrifice to the injurious drugs he has swallowed. So he will find a suitable homeopathic remedy, a simillimum, based upon the characteristics of the case, whether they belong to the drug, whether they belong to the original disease, if there is some confusion regarding it. And he will give the medicine so that at least the original disease, because in these kind of cases it is not that we will only see the symptoms of the drugs or the medicines. The original disease is also showing its symptoms. The characteristics of original diseases are always there. So at least when we will give a remedy according to that thing, the original disease will start decreasing and the patient will need less of these medicines, and we'll start telling them to taper down or stop with those kind of medicines. Okay, so we have to because the idea of the case taking is to individualize the case, to bring out the characteristics so that we can find a remedy according to those characteristic symptoms, which is similar to all those characteristic symptoms. So whenever we are doing the case taking, we are taking the case, we have to keep in mind that I am going to individualize the patient. I am going to understand how this patient is different. What are the different symptoms? Even we go to that preciseness of asking very small things. What kind of color or of the urine is there, what kind of sediments are there, what kind of taste is there, very small things, so that we can find characteristics of the case, and then we match those characteristics of the case with the characteristics of a remedy, and we give that remedy. So we have done till aphorism 92. We will start with aphorism 93 next time. So I will request you that you go through these aphorisms once again during this week, because they're very important. Even if you are a practicing doctor, these things basically allow, these aphorisms allow you to make you to think about what is necessary and what I have to not, what I don't have to do, what is not required of me. I think every 6 months these aphorisms should be read. They should be read so that we can keep improving our this art. What I can see in the, what I can ask, what are the things where I have to focus. For example, those 4 qualities of being unprejudiced, sound senses, attentive observation, and fidelity, loyalty, truthfulness. If we don't read it, we will forget it. But reading it again and again, it makes sense. It is more of reminding of ourselves that what is required of me. Because it is very important to remind, so that it becomes, a part of you. Because there's, as a person, we all are physician is also a person. There are so many things which are happening in the life, or which have happened in the past. Most of us are prejudiced. Most of us, I will say almost all of us, are prejudiced regarding the things, regarding people, regarding the events. We see the things in a same way every day. But that should not reflect in our case taking. When you are taking a case, you should not be you, basically. That should not be reflecting in our case. That is a requisite. So when we go through these aphorisms, we remind ourselves again and again, no, I have to be unprejudiced. I have to be unprejudiced. Okay. So please go through these aphorisms once again. If you find any difficulty in understanding something, if you find something, which needs to be explained more, let me know about it. You can send the questions on the WhatsApp, and we will discuss it in more details. Okay. So with that, I will thank you all, and a very good night. Thank you. So today we'll start with our next aphorisms from aphorism 100 onwards. But first, there is a question regarding the aphorism 8. If someone accidentally was found out from checkup without any symptoms that he is a hepatitis B carrier, according to homeopathy, does he get disease as he does not have symptoms? Similarly, someone have tumor or cysts without any symptoms. In this case, she does not get disease. Whether we can say that the patient is diseased or not. If the question is that if the symptoms are not present, but there is some accidental finding, uh, there is some accidental finding of hypothyroidism, there is some accidental finding of some kind of tumor or some kind of some viral disease. So can we say that the patient is diseased or not? Now, here are some things to understand. Sometimes the accidental findings are of a remnant disease. For example, someone had tuberculosis and he was or she was given AKT, some kind of treatment, whichever is given for it. And after that treatment, every time he goes for some kind of X-ray, there is a shadow. There is some kind of nodule which is always seen. So in that case, it is basically a remnant of old disease. So in that case, we will not say that the patient has healed well. So if there may be a state of health, he is not having any symptoms in that case. He is not having any kind of trouble, if we say in that case. But we will say that it has not healed completely. Similarly, if someone had some kind of boils or eruptions, but some kind of medicine was given, something was applied, and they have disappeared. Now there are some small spots, the remnant spots of the disease. So we will not say that the disease is gone. It might have changed its, you know, symptoms into some other kind of, or some has gone latent. So in those cases, we will say that the patient is still diseased if we get this thing with them. But now we are coming that there was nothing like this, and suddenly, accidentally, someone went for some test and they got this thing. Now we use the word accidentally. The accident was made by us, not by the body. Regarding the cells, regarding the tissues, the two type of basic functions are always going on. That is the growth of the cells and the death of the cells. It is a natural process. So these tumors and these things, they are very naturally occurring phenomena which are going on all the time. Every time you are basically suffering from a viral fever, the kind of fever we usually say that it is a viral fever. The people are suffering. Suddenly, the fever of some unknown origin has come and it is going on. After 4 or 5 days, you start feeling well. Usually, it is some kind of endodermal tumor or old mesodermal tumor which is healing at that time. So these things, these phenomena are very common. They keep on happening and they keep on resolving on themselves. The problem arises when the body or the vital force is not able to resolve itself. Hmm. Okay. So these things are basically accidentally happening. So when we say that things are happening, or these things are found accidentally and without any symptoms, these are the normal going ons in the body. Regarding the hepatitis, any viral condition which is happening, what we are doing, how we are testing them, we are basically testing the antibodies of the body. So we are basically assuming that there is a viral action on the body towards which the body has produced some antibodies. Okay, this is our theory of looking at the viral disease. No one has ever actually seen any kind of virus. There is no this thing. So there is an assumption of the virus that some things are happening which are infectious, and there is something at a very minute level, at the level of some RNA and this thing, that something is infecting everyone. And but what we are seeing is the antibodies of that reaction. So antibodies are basically our cells, the normal cells of body, which are increased in the number because of something which has happened. Let's not go into what has happened, but let's see is like that they are the normal cells of the body. The antibodies are the normal cells of the body. They are usually also present up to certain level, and then certain kind of immunoglobulin, certain kind of antibodies are basically increased at some special events, and from there we start telling that if this antibody or if this immunoglobulin is increased, or this kind of thing has come, then the patient might be suffering from hepatitis B, he might be suffering from some other viral disease. So there is this assumption. The whole viral theory is basically based, if you read it more in depth. So the whole viral theory is basically based on a normal biochemistry of the body, a normal biochemistry which has increased to certain levels. It has extended or it has exceeded certain levels, but it is the biochemistry of the body. Like in bacteria, we can see the bacteria in the tissue. In the case of fungus, in the case of some parasites, we can see them. But here there is nothing to see under the microscope or even with the naked eye. Whatever is happening in that thing, whatever we are basically giving the name to a disease, it is only the calculated number of our own biochemistry. Yes, there may be some symptoms associated, there may be something which is happening, but then it can be something else also. It can be something else also. So coming back to the question, that in these kind of findings, that hepatitis or some kind of other viral diseases, but there is no symptom at all. These are just the accidental findings. Okay, so the word is that they are accidental. We have caused the accident. The body didn't give any sign that it is diseased. So this we have to understand. The body never gave any sign of the disease. There are some signs, yes, we should give the remedy. There are no signs, then we must accept and understand that whatever is happening, you know, it might be some kind of reaction, the body will take care of it. If there is no need to show the symptom, that means the body does not need any physician. The body can take care of itself. But when we start, doing something, I've seen so many cases, the patient was completely okay, no problem, no problem at all, at least not of that part. There might be problem with some other part, but then they went through the test and they did this thing, and they found some tumor out at some distant part of the body. For example, the problem was with the abdomen, but the tumor was found in the you can say the lungs or in the pancreas or some sorry, not pancreas, but for example in the lungs. So they start with the radiotherapy and chemotherapy and all. We start with that thing, and the patient starts deteriorating, who was okay. There was no problem with that. That there was no trouble regarding that kind of the thing. So we as a physician has to listen to the body, that whenever body requires a physician, okay, those are the words which we have just gone through in the organon, that the body tells, the vital force tells through sign and symptoms that it needs a physician. It is as clear as that. Okay, so many times it comes to the mind that what should be done then in such cases. The patient comes to you with this thing accidentally. Yes, keep a check on the patient, keep a check on the patient, but listen to the body. The body has not yet required you. If in future the body requires you, we should be available. But if the body does not require us, then let the body give the time to heal itself, whatever has come up. Okay? So this is very important to understand. I think I'm clear with the answer on the question. So we'll start with the aphorism 100. So aphorism 100. In investigating the totality of the symptoms of epidemic and sporadic diseases. So, so till now, the case taking was a general. I'll just give you a simple thing about the how the organon has been written. Uh, what was the planning? So, Dr. Hahnemann starts with a common principle, a common rule which is told that it has to be done like this. Because from now on, in the practical part, we will see that kind of planning which will be going on. So he will give us a proper, common, a general principle which is always to be followed. Okay, that is a general principle regarding that thing, and it is always to be followed. Then there are sub principles according to some conditions, according to some situations, according to different types of diseases, according to different types of patients, according to different types of medicines. There will be some sub principles. So those sub principles never overpower the main principle. This is stable. These things can change according to the situations, according to the conditions, what kind of disease is there, whether it is a mental disease, whether it is a physical disease, whether it is an epidemic, whether it is some pure acute miasm, whether it is a chronic miasm. So according to that, there will be some things which will change. But this main principle, the way the case taking is to be done, that will be same. But in those sub principles, in those sub situations, Dr. Hahnemann basically gives us an insight what we can look for more extra in comparison to that thing. What we can do something more in these situations as compared to that thing. So this thing has to be kept in mind that the organon, because many times, even when I was in Thailand, we had this discussion over the same thing, over the repetition of the dose. So because many times, when we are going through the organon, we read the principle, okay, this is written, but when there is something contradictory thing to that thing, we take it that, okay, this can also be done instead of this. No, it is not like that. There are some situations where that can be done. But this principle remains like this. And even on those particular places, he has mentioned those situations. Like, for example, in investigating the totality of symptoms of the epidemic and sporadic disease. In this situation, when an epidemic is going on or some sporadic disease is going on, we have done the definition of this in aphorism, I think 72 or 73. Okay. So those definitions have to be kept in mind, that what is an epidemic, that when the causation is the same and the whole process which is going on, the whole process of the disease which is going on in each and every patient is same, that is called as the epidemic. And sporadic disease, which is because of the changing environment, changing weather, changing this thing, and the people are getting affected in different pockets of the population. It is not an epidemic that the whole population is basically diseased, but yes, there are some pockets in the population which are getting diseased. It is quite immaterial whether or not something similar has ever appeared in the world before under the same or any other name. So see how Dr. Hahnemann is starting the thing, because this is the first mistake which we do in the epidemic or sporadic diseases. For example, now in this season, or I can say 1 month back, when the rainy season was just ending, dengue is very prominent at that time. Earlier it was malaria, now it is dengue. It is a sporadic disease, dengue. So he's saying that it is of no matter, it does not mean anything whether anything of such name has ever appeared or not in the world. Don't keep the name in the mind, because when it starts, the platelets are decreasing, people are falling sick, there is some fever going on, some weakness is going on. So everyone, okay, dengue is going on, dengue, take eupatorium perforatum, okay, take that medicine, because we are keeping the name of the disease in the mind. Similarly, in the epidemics, we should not keep the name of the disease in the mind. Every time it is something new. So it is quite immaterial whether or not something similar has ever appeared in the world before under the same or any other name. It is of no matter, it is of no importance that whether something like this has ever appeared or not appeared. The novelty or peculiarity of a disease of that kind makes no difference either in the mode of examining or of treating it. What kind of peculiarity of the disease is there, what is its name, it makes no difference in how we have to examine it or how we have to treat it, as the physician must anyway regard the pure picture of every prevailing disease. The word is pure picture. Pure picture means how it is appearing without keeping any prejudice about the old epidemic, about the old sporadic disease. So it is the work of the physician, it is the duty of the physician to take the pure picture as it is appearing right now, as it is coming to us right now. Even in the same patient, if for example the patient came to you with dengue last year, and this year also is coming with some kind of fever, and the doctors have described that he is suffering from dengue, don't repeat him the medicine which you have given last year. We have to take the pure picture right now, what is going on there. If at last it ends in the same medicine, okay, no problem, but usually it does not happen. Usually it does not happen. If we have started with the same medicine, and usually it does not happen that it will fall under the same condition, then we would have wasted 3 or 4 days of the patient, 5 days, and he has started becoming more weak, and we then wonder that why the medicine has not worked. So it is better that when the patient comes, we take the pure picture at that time only of every prevailing disease as if it were something new and unknown. This thing is very important. Whenever we are investigating something, we have to investigate from a state of unknown, that we don't know anything about it. Whatever we know, we have to just you know rub it off, that this is something new and I don't know anything about it, and investigate it thoroughly for itself. If he desire to practice medicine in real and radical manner, if we want to practice medicine in a real manner, how it should be practiced in a radical manner, then this is the way. Never substituting conjecture for actual observation. We cannot substitute the conjecture, something which we have read somewhere, something which we have heard about somewhere, something which we have not actually seen happening in front of us, or something which is not happening right now, but I am imagining that okay, it might be the same thing. He might be suffering from the same thing which he was suffering from uh, in the last year. So when a real physician, when he is basically taking a case, he will never substitute the actual observation, what he is observing, with a conjecture, never taking for granted that the case of disease before him is already wholly or partially known. Okay, even we cannot say that okay, some things I know from the past and new things I will find. We don't know anything. No, partially, we don't know it partially, we don't know it completely. We are just in the state of unknown, we are just working from that state, but always carefully examining it in all its phases. And this mode of procedure is all the more requisite in such cases. If we keep on repeat, for example, if I give some patient medicine and the patient is not getting well, if I keep repeating on the same thing, just modifying some things, I will keep getting the same result. I will not get something new. For getting something new, I have to be new. I have to become new. And only way of becoming new is to forget everything which we know and start from there. So same is with the case taking. Even the patient is coming to you for the 10th time, for the 20th time. Go to that state that I don't, and I have to start from new. Everything is to be asked from the new. And this mode of procedure is all the more requisite in such cases, as a careful examination will show that every prevailing disease in many respects a phenomena of a unique character. And when we use this procedure, when we go with that thing, when we when we are carefully examining the things, we will see that every phenomena, every epidemic, every sporadic disease, every thing which is happening, it has some phenomena of unique character, differing vastly from all the previous epidemics to which certain names has been falsely applied. There are some false names which are given to those. Why false? Because every epidemic was unique. There was always something unique, but the old names are being given to it. With the exception of those epidemics resulting from a contagious principle that always remain the same, such as a smallpox or measles. Okay, but in those kind of epidemics where the contagious principle remains the same, like the smallpox or measles, then at that time, yes, okay, we call it a smallpox or measles. But again, this does not say that okay, we can give the same medicine to smallpox every time or the measles every time. No, even in smallpox or measles, when the epidemic comes or when the children have them, there are different characters. The phenomena is different. This is to be kept in mind. Now this is the thing where some people either they misunderstand the thing or they manipulate these things to sell some medicines. This is how it happens. They will take this part that okay, he has said that in smallpox and measles it is okay. He has not said that it is okay to give the same medicine in each attack. He has very clearly said this thing in the beginning, that is a sub part of it. Sub part cannot replace the main part. So he has already said that any kind of epidemic, whether it is of even of smallpox or measles, any kind of epidemic, we have to investigate thoroughly. We have to investigate it as a new and unknown thing. If there would have been this kind of thing that okay, there can be one remedy for smallpox or measles, Dr. Hanuman would have written it. He would have written it. He would have written in this aphorism only that okay, in smallpox give this medicine and measles give this medicine. That is not there. If he had the intelligence to go through to write this whole organ and go through all the pain to uh, discover homeopathy, the law of similia, and the this law of individuality and the law of the vital force and miasms, he could have written this very small thing. So this is again a sub this thing that okay, in those cases the name is okay, the smallpox or measles, because it is okay, the name is okay, because the contagious principle is the same, but not we cannot take it okay in the cases of smallpox start giving belladonna or zincum metallicum or this or that. He has already written that in any kind of epidemic we have to investigate it thoroughly, whatever its name is, does not matter. So aphorism 101, it may easily happen that in the first case of an epidemic disease that presents itself to the physician's notice, he does not at once obtain a knowledge of its complete picture, as it is only by a close observation of several cases of very such collective disease that he can become conversant with the totality of its signs and symptoms. So, what happens in an epidemic disease is, for example, one patient, the first patient which came to you, he started getting affected, like 3 days back. So we have a picture of a development of a disease of 3 days. The next patient who comes, he has a development of 5 days. The next patient who comes, he has a development of 6 days. So every patient who is coming to us, then the fourth one come, he has just started with it. Just one day has gone by or few hours have gone by. So he's saying that it may easily happen that in the first case of an epidemic disease that presents itself to the physician notice, it does not at once obtain a knowledge of its complete picture. Like in the first case, it is okay that we might not get the complete picture of the disease, as it is only by a close observation of several cases of every such collective disease that he can become conversant with the totality of its signs and symptoms. So when we have gone through many cases of different developments, then only we have a collective picture. Then we have a complete picture. What complete picture the patient is having basically. Okay, then we start getting. I'll come back to this. There is a question that what does the contagious principle resulting from a contagious principle that always remains the same. So what does the contagious principle means in this? Like when we started with the organon, this was the first thing which I shared with you, which I spoke about, that there is many places where the Dr. Hahnemann will use the word contagious, contagion, infection. Okay, don't take it in the meaning what we know from the pathological point of view. Contagious means that it is happening from one person to the other, and then the other, then the other, then the other, then the other, then the other. Okay, so the contagious principle means the way of getting contagion, that everyone is getting the contagion in the same way. It is not different. Okay, the initial few days are same, but then there can be some different you know um, developments which we can see. So those initial few days, if when we talk about the smallpox or measles, they have a way of developing. Like mostly we say that measles, there is some thrush which comes first and then it spreads on the body. So that is a contagious principle, that there is a proper way of developing of these diseases, smallpox, measles, chickenpox, these kind of diseases. They have a proper way of development, or you can say a similar way of development, but then it can go into something else with 60 or 70% similar way. There will be 30%, 20%, 10% something which is not, sorry, which is unique to this kind of epidemic, this particular epidemic, sorry. So the contagious means that it is getting infected. Okay, coming back to the 101. The carefully observing physician can, however, from the examination of even the first and second patients, often arrive so nearly at a knowledge of the true state as to have in his mind a characteristic portrait of it, and even to succeed in finding a suitable homeopathically adapted remedy for it. So, patient who is carefully observing, Dr. Henneman has never. There's one, some things which they strike you. Dr. Henneman has never written an experienced physician can, however, from the examination of even the first and second patients, because Dr. Henneman never uh, thought of experience in the terms of time. We say that we have 35 years of experience. I have 15 years of experience. I have 20 years of experience. Okay. See, he has very, in one of the aphorism I think we have done, or we will do in the future aphorism. He basically said that I don't consider that thing as an experience. 35 years of doing something wrong does not make you experienced. So you will never find that of an experienced physician can, however, do this thing. He will always say the carefully observing physician. You might be seeing the case for the first time. This might be your life's first patient. And if you're carefully observing, you're carefully applying the laws, if you're carefully applying the principles from the first or second patients, the examination of them, you can get to the medicine. Even in the first patient, you can get to the medicine if you're carefully observing. Okay, so he has told both the things that sometimes we cannot get it from the first 2 or 3 patients the complete picture, but yes, sometimes if you're carefully observing, the physician is carefully observing, he can from the first or second patient often arrive so nearly at a knowledge of the true state. What is the true state of the disease? What is the symptoms, the array of symptoms? What are the characteristics in the disease? And how I can prescribe on these characteristics? In his mind, a characteristic portrait of it. What are the characteristic portrait? And even to succeed in finding a suitable homeopathically adapted remedy for it. And he can also find when the characteristic portrait is there, the materia medica, then we can match very easily. In the course of writing down the symptoms of several cases of this kind, the sketch of the disease picture becomes ever more and more complete, not more spun out and verbose, but more significant, more characteristic, and including more of the peculiarities of this collective disease. So, in the course, like we are seeing the patients in those kind of epidemics, when we have written down the symptoms of the several cases. So, this sketch of the picture, the whole development of the picture at the different stages we have at that, it becomes more significant and more characteristic the more we keep collecting that thing. So there will be many peculiarities of this disease which are collective. So all this thing, this array of the symptom, it becomes a collective picture of the complete disease. On one hand, the general symptoms, for example loss of appetite, sleeplessness, etc., become precisely defined as to their peculiarities. Almost all the acute diseases or the diseases, when they are gradually increasing, the appetite is disturbed, that sleep is disturbed, the thirst is disturbed, you know sometimes stool and urine, the general symptom, they are disturbed. But the more we will look into these kind of cases, the more patients we see at that time, these will start showing some peculiarities. For example, the appetite is not good in the afternoon, or there is an easy satiety, or there is some nausea with when they look at the food. So some kind of peculiarities, they will start becoming more precise. And on the other hand, the more marked and special symptoms, which are peculiar to but few diseases and of rare occurrence, at least in the same combination, become prominent and constitute what is characteristic of this malady. And the symptoms which usually do not come with these kind of diseases. For example, the smallpox is there or some chicken pox is going on. But then there are some symptoms which commonly come, but then there are some symptoms which usually don't come. For example, there is a smallpox going on, but there is that after few days of chicken pox or measles, there is this jerking which starts in the leg, the jerking of the extremities. This will make it more prominent. This will give us a more prominent picture of the disease and constitute what is characteristic of this malady. So this will give us a characteristic of that thing. All those affected with the disease prevailing at a given time have certainly contracted it from one and the same source, and hence are suffering from the same disease. Okay, again going back to the definition of the epidemic is that causation is same and the suffering is same. That is why one medicine is to be found which can cure everyone, because the disease phenomena is same. So this will tell us that they have got it from the same source and hence are suffering from the same disease. But the whole extent of such an epidemic disease and the totality of its symptoms, the knowledge whereof, which is essential for enabling us to choose the most suitable homeopathic remedy for this area of symptom, is obtained by a complete survey of the morbid picture. So the main thing is that we cannot just decide on few patients what is the genus epidemicus, which people did in the COVID time. Many doctors during the COVID time, they didn't even saw the patient. I know some doctors, who did this because of the fear of getting infection. They didn't saw any patient, but they reached at a genus epidemicus. They found a remedy for the epidemic because they didn't knew the definition of the epidemic. They didn't knew it, that the disease picture is same. That is why I think during that time I had taken a, I think, online class during that time, and that is the first thing which I told the doctors and gave some instructions during that time, that how it should be done. It is a sporadic disease, and we have to see these things. Don't take it as an epidemic and keep giving arsenic or camphor or something like this. They just listened online what kind of symptoms are coming, and they started making a genus that is completely against what is written, completely against. It is not a true picture of the disease. We have to find the true picture of the disease, and it cannot be found until we see patient in those conditions. If we are, if we ourselves are so afraid of getting the infection, then it is better, okay, to be at home, not see patient, and not give any instructions how to cure them. So cannot be learned from one single patient. The main thing to understand is that the complete picture cannot be learned from one single patient. Even if you find the right remedy on one single, and it started working on the first patient, the second, and the third, but still we need to keep on increasing our knowledge of those symptoms which are going on, because maybe at some stage we need to change the remedy, or at least we can become more assured that the remedy is right, but is only to be perfectly deduced and ascertained from the sufferings of several patients of different constitutions. So we have to ascertain it from the several kind of the sufferings which are going on in the patients, according to the development, the hourly development, the development in the days, the development in the weeks, and then we start understanding the whole picture of whole array of symptoms. So there's a footnote: the physician who has already in the first cases been able to choose a remedy approximating to the homeopathic specific will, from the subsequent cases, be enabled either to verify the suitableness of the medicine chosen, or to discover a more appropriate, the most appropriate homeopathic remedy. Like I said just before, that even if in the first case or the second case we were able to choose a remedy which is making the patients better, so we can by collecting the symptoms in the developed stages or the different developments, we can verify the suitableness of our medicine, that okay, this is the right remedy, everything is falling in, all the new symptoms are falling in, all the new characteristics are falling in, or we can discover a more appropriate remedy. Okay, these things are not falling in, let me find a remedy which can cover all those things, and start giving that remedy out. In the same manner as has here been taught relative to the epidemic diseases, which are generally of an acute character, the miasmatic chronic maladies, which, as I have shown, always remain the same in their essential nature, especially the sora, must be investigated as to the whole sphere of their symptoms. So he's saying that the same manner, like I have told you about the epidemic diseases, when it comes to the chronic diseases, the chronic situations, in that case also, because as we have understood that all the symptoms, all the things which we call by different names, the tuberculosis, the um, hypothyroidism, the diabetes, the hypertension, this urethritis, the renal stone, whatever it is, they're just the different symptoms of sora. That is the greater developments of the sora. So he's saying that in the same manner, because in the chronic maladies, they are suffering from the fundamental cause, the fundamental miasmatic cause, which is sora. So we have to investigate in the same manner as to the picture of the sora, that how the sora is existing, because the first thing is that it makes us understand the different developments of sura. Because when we'll be looking at the medicines, the similumum, then we have to match that development, how the sura has developed. The remedy which matches the whole development will cure the sura. The remedy which matches just one part of the development, some secondary symptoms or tertiary symptoms, it will just treat those symptoms, but the sura will remain as such. That is why the discovery of the miasm, Dr. Hahnemann said that it is the very, very, very important discovery after homeopathy. This is the most important discovery. And homeopathy can never be complete, or the cures can never be given in the causes in the chronic diseases if we don't understand this theory. As we move forward deep, although I have talked many times about the sura, but as we go more deeper in the aphorisms, and then the aphorisms on the miasm will come, then we will discuss it in more detail. But right now, what Dr. Hanuman is saying in aphorism 103 is that in the similar way, whenever the chronic patients, the patients with chronic diseases they come, we have to understand that this is all the development of sura, and we have to investigate it, and we have to understand it. How many symptoms the sura can show as to the whole sphere of their symptoms. So the investigation is to be done in the whole sphere, every symptom, where the symptoms are coming in a much more minute manner. Epidemic is of recent origin. Chronic diseases are going from so long. So we have to go into minute of the details which we can come up with. Minute manner than has ever been done before. For in them only one patient, for in them also one patient only exhibits a portion of their symptoms. So a patient is only showing the portion of the one development of the sura. A second and third and so on present some other symptoms, which also are but a disturbed, as it were, portion of the totality of the symptoms, which constitute the entire extent of this malady. So all the patients, when we are looking at them, their symptoms, this will show us the entire extent of the sura, that how many development the sura can take, the different kind of developments, so that the whole area of the symptoms belonging to such a miasmatic chronic disease, and especially to the sura, can only be ascertained from the observation of very many single patients affected with such a chronic disease, and without a complete survey and collective picture of these symptoms, the medicines capable of curing the whole malady homeopathically, to wit the antisorics, cannot be discovered, and these medicines are at the same time the true remedies of the several patients suffering from such chronic affection. So Dr. Hahnemann is trying to say that if we don't do it like this, we will not be able to find the antisorics, the simillimums of the patients. Why he's used the word antisoric? Because simillimum is also in the acute case, simillimum is also in the epidemic cases or any other cases. Simillimum means similar to the symptoms. Antisoric means a remedy which can cure sora. So he has used a different word for that thing, an antisoric. So he's saying that until and unless we, without a complete survey and collective picture, we will not be able to discover that antisoric. And because that antisoric is very important to find that antisoric, because that is a true remedy of many patients suffering from such chronic affections. These are the true remedies, these antisorics. So I will just clear one or two things right here, right now. Antisorics are not something different. It is not that the bryonia is the acute remedy and it cannot be an antisoric remedy. Any remedy can be an antisoric remedy if it shows that particular development of a disease. So there are not some remedies which are antisorics and some which are antipsychotics. No. Any remedy can be antisoric. Any remedy. But it should be similar to those developments of the sura. Second thing, why this aphorism, or what is the meaning behind this aphorism? There is a superficial understanding of the aphorism, then there is a deep understanding of whatever is written. When we are seeing the patients, but our mind is focused on, in the back of the mind, we are focused uh, on the disease. The patient is having Alzheimer, the patient is Parkinson, the patient is having some cancer, or the patient is having some kind of epileptic. So we are, looking at the disease. I will just tell you right now, the patient is going good. Maybe whatever, I'm very sure about the remedy which we have given to the patient, but I'll just tell you how the whole thing basically starts affecting our thinking. So we had a patient. He's from Thailand, a boy of Tourette syndrome. And Dr. Jonkul, Dr. Sobis, and Dr. Fujira, they know about the case. So we gave some remedies. In the initially, there were some characteristics about the disease. Like for example, there is a symptom that there was this convulsion and rage which were alternating when the episode is coming. The convulsion is coming, then the patient will go into rage, and then the convulsion will increase, and then the rage will increase. So this alteration was going on. So it's a very characteristic thing. You don't see this kind of thing usually in convulsions. So when you see the remedy for that, the only remedy is stramonium. So we gave him the stramonium. For a few days he was better. Then he came back to the wherever he was, he came back to that state. The next time again we look at that, that he would had this arrested breathing, and then some other factors also. Then we took that thing and the rage part also, we combined that and we gave him Nux vomica. No, sorry, I think Cupromet. So he again was better for 1 day, 2 day, and then again the disease started. So then you stop that, okay, my approach is not working. Whatever I'm doing, I'm taking the characteristics, but those are not working. So what is the mistake which I'm doing? I'm just sharing an experience. So in the third meeting when we talked about it, because the parents are also, they are also afraid and everything is going on. So sometimes it puts, or the physician takes an immense pressure from the state that he is not able to cure, and it usually comes to everyone, whoever is doing his or her work sincerely. We will have that state by that, why I'm not able to give relief to the patient, why the medicine is not working, why something. But then again, that is a state where we can learn also, and we can look at what mistake we were doing. So there was something that I was very sure that I'm making a mistake because the result is not coming. So first of all, the stage is to accept the mistake that, the approach which I'm going through is not right. Let's start again. So what was the mistake? Then I started, studying about the patient, that he is basically, whenever this state happens from the bad mood, or the patient is not feeling well, he's irritable, he's angry, he's very oversensitive to the cold weather. Even if she switches on the fan, he will start sneezing or some other symptom will start coming. Very neat, very perfectionist. He will keep everything organized. He does not want anything out of the way. Bad temperament, irritable, gets angry easily. Anger can go into rage also. So then we gave him Nux vomica. And after one, because I don't have a longer follow up, I will maybe have follow up tomorrow or maybe next week. But uh, if Dr. Fujira is present and she has talked, she can tell us more about it. Because the first 1 week follow up was good after Nux vomica. And it was for the first time, I think, that the medicine has acted for that long. Again, I'm telling, maybe we have to change, maybe we don't have to change. But I have learned one thing, that what was the mistake there? That I was taking the characteristic of the disease, ignoring the patient, because those characteristics seem to be very important, but those are of the disease, of the convulsions. But when we took the characteristics of the patient, We came back, forget the disease. Okay. There is just forget that the conversions are there. Forget about it and focus on the patient. What are the characteristics of the patient? So that is when you switch from the particular characteristics to the general characteristics. And this tells you which are more important. The general characteristics are more important or the particular characteristics are more important. This is the difference between what Dr. Hahnemann is trying to tell us here, and he will keep doing it throughout the organon. That some things are to be kept in the mind always. They have to be kept in the mind till they get absorbed in your subconscious and you start behaving that way. We start behaving that way that whatever you are seeing, the symptoms, they're just of one disease, that is Sura. You have to trace the picture of that. Don't compartmentalize the brain into, different diseases. Then we will have, we will be more focused on the disease. So on that day, when I was talking with the mother, the doctors were there, and I was sitting, and this thing came to the mind that okay, forget about Tourette syndrome and forget about the conversion. There is nothing like this. Just focus on the information regarding the patient. So that is the only way how we can tap into the Sora and find an anti-soric, a remedy, a homeopathic remedy which can cure the Sora. And until and unless we don't find such a remedy, these kind of diseases we will not be able to cure. We cannot cure it. You can just give relief, or even the relief will not be there. So that is why this aphorism is there, that when we are going through the different patients, different chronic diseases, patients suffering from different kind of chronic disease, just keep a look on how extensive is Sora, so that we can know about it, so that we can know about that one disease. We can understand that there is only one disease, and it has an innumerable kind of symptoms are there which are present. So when the totality of the symptoms that specially mark and distinguish the case of disease, or in other words, when the picture of the disease, whatever be its kind, we don't have to worry about the kind, is once accurately sketched, the most difficult part of the task is accomplished. So when we have taken the totality of the symptoms, we have marked and distinguished the case of the disease, and the picture of disease is taken, the accurate sketch is taken, the task is accomplished. The physician has done the picture of the disease, especially if it be of a chronic one, always before him to guide him in his treatment. So the main thing is to do that hard work on the first day, on the first time, so that we don't have to do it again. We have the whole picture of the disease. Now we will go further. We can investigate it in all its parts and pick out the characteristic symptoms. So he has given a small indication of what we have to pick out. From the whole totality of the symptoms, we don't need to put the whole totality in our laptops or in our repertories. We can pick out the characteristic symptoms. In order to oppose to these, that is to say, to the whole malady itself, a very similar artificial morphic force in the shape of a homeopathically chosen medicinal substance selected from the list of symptoms of all the medicines whose pure effects has been ascertained, so that we can find a homeopathic remedy which is similar to these characteristic symptoms from all the medicines. And when during the treatment he wishes to ascertain what has been the effect of the medicine and what change has taken in the patient's state, at this fresh examination of the patient, he only needs to strike out of the list of the symptoms noted down at the first visit those that have been enumerated, to mark what still remains and add any new symptoms that may have supervened. So when the next follow-up comes, when we say that the medicine's effect has taken place, so in the fresh examination, in the next follow-up is also fresh examination, we start asking what is better, what is still remaining there, and any other new symptom which has come forward. So he will strike out. So he's saying that okay, cross out the symptoms which are gone, mark the symptoms which are still there, and any new symptoms we write them down. Footnote to aphorism 104. The old school physician gave himself very little trouble in this matter, in this mode of treatment. He's saying that the old school physicians, they don't do it like this. He would not listen to any minute detail of all the circumstances of his case by the patient. Usually the doctor, okay, what is happening? Fever is there. Okay, BP is this. Any other trouble? Okay, gastric trouble. Okay, this is the medicine. So he's saying that they don't go into the minutest details of the circumstances. Indeed, he frequently cut him short in his relation of his sufferings in order that he might not be delayed in the rapid writing of his prescription. Even if the patient is trying to explain that these are okay, okay, no problem, no problem. Let me write the prescription for you. So he will cut him in his relation to his suffering so that he can write the prescription rapidly, and it should not be delayed, composed of a variety of ingredients unknown to him in their true effects. And the variety of ingredients which are written, they are unknown. The action on the human body is unknown. What kind of action it will produce? No allopathic physician, as has been said, sought to learn all the minute circumstances of the patient's case, and still less did he make a note in writing of them. They don't want to know about in what circumstances the causations, how it has happened, what circumstances were there, any kind of worries, any kind of stress, any kind of you know physical exertion or something like this has happened. On seeing the patient again several days after, he recollected nothing, because he says that because he has not written anything, so he does not recollect what has happened. He recollected nothing concerning the few details he had heard at the first visit, having in the meantime seen so many other patients laboring under different affections. So partly because he has seen so many patients, and partly he has not written it, so he does not remember what had happened to him in the first time. He had allowed everything to go in at one ear and out at the other. So he has allowed something which has gone from in from one ear and out at the other. At subsequent visits, he only asked a few general questions, went through the ceremony of feeling the pulse at the wrist, looked at the tongue, and at the same moment wrote another prescription on equally irrational principles, or ordered the first one to be continued in considerable quantities several times a day. So he said that on every visit he is just going through the ritual of checking the chest, checking the pulse, checking the tongue, and rewriting some another prescription in the same meaning without ever knowing what is has happened, or ordering the first one to be continued. He will ask that, okay, are you getting better? Yes. Okay, then continue it. If you're not getting better, then add something. And with a graceful bow, he hurried off to the 50th or 60th patient he had to visit. Because at that time, the physicians would visit the patients. The patients are coming to the clinics or hospitals. But at that time, the physicians would go to the bedside of many patients, because there were no means to bring the patients at that time. The people usually do not have the means. He had to visit in this thoughtless way in the course of that forenoon. The profession, which of all others requires actually the most reflection, a conscientious, careful examination of the state of each individual patient, and a special treatment founded thereon, was conducted in this manner by persons who called themselves physicians, rational practitioners. So he's saying that the profession which requires a lot of reflection, you need to think about what is happening, a very conscientious, very diligent, very careful examination, that how the disease is going on, and what is happening, and a special treatment has to be founded which covers all those symptoms, which can cure all those symptoms, that kind of treatment. And nothing, this should be done, but it was conducted in a very different manner by the physicians which called themselves rational practitioners. Because at that time, The physicians who used to practice like this, they were called rational practitioners. Allopathy was the word coined by Dr. Hahnemann. If some of you don't know, then this is a thing that the allopathy was given the word was given by Dr. Hahnemann. So if we are today using the word allopathic or allopathic medicines or allopathy, it is a word which was given by Dr. Hahnemann. It didn't existed before. The result, as might naturally be expected, was almost invariably bad. So when the practice was done in that way, we can just expect that it will be a bad result. And yet patients had to go to them for advice because there was no other option. Partly because there were none better, no other better option was there to be had. Partly for fashion's sake. Fashion means that it is a trend going on. So because of those two things, the physician had to do that. Sorry, patients had to do that thing. So this is a state which was happening at that time. Some things might have changed, but many things are like that. There might, yes, there are some practitioners who are very good. I've seen some of the doctors who are not homeopath, who are practicing some allopathic medicines or some other medicines also. They care about patient. They know, they will ask about the circumstances, from how long it is happening, what kind of other thing. Although that will not help in the prescription, but at least they have this sympathy and care for them. They will console them, they will give them good advice, they will do something like this. There are some physicians who are like that, but yes, many, the way he has described, many are like that also. But okay, but that thing does not, but that is a scenario, sometimes the contrast is needed to understand some things. Some things good has to be told in contrast to something bad. You would keep telling him something good, 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 then, and the contrast is not there, then the good becomes kind of okay. We start taking that thing as granted. When there is light, the value of light cannot be known until we know the darkness. So that is something which sometimes, Dr. Hahnemann gives a pinch of salt to have, so that we can understand the other part. So from the next aphorism or onwards, we will start with the provings, how the medicine is to be proved and all those things. So that will start from aphorism 105. So we'll start it on next Wednesday. We will stop today's class on organon right here. Again, there are, if any questions, there was this question on contagious principle, which I think I have answered well. If still there is some question, still there is something which was some problem to understand it, you can again message me or message Dr. Jonkol or Dr. Rishabh or anyone. And next class and next we will start with a discussion of that. So thank you very much, and have a very good night. A very good evening to all of you. So today we will continue with the organon part. We have done till aphorism 110. Right now we are going through the aphorisms which are related to the provings. So in these aphorisms, Dr. Hahnemann basically gives some guidelines about how the provings are to be done regarding certain kind of medicines, that what is to be seen when we are proving with these kind of medicines, and how it is to be analyzed, how it is to be perceived, the proving, what is the purpose of the proving. So all these things we will discuss in these aphorisms. So we'll start with the aphorism 111. So aphorism 111, the agreement of my observations on the pure effects of medicines with these older ones. So, like in the last aphorism 110, Dr. Hahnemann tells about certain records where some medicines were either given in large doses, or they were given accidentally, or they were taken accidentally, and they produced kind of symptoms, kind of effects on the health of the patient, on the health of the subject. So he is basically referring to those things that his own observations and as are given in the old records, although they were recorded without reference to any therapeutic object. Those recordings, those poisonings, the effects of the poisonings with certain substances like arsenic or some kind of plant, they were recorded as what happened after the ingestion or after the influence of that thing on the health of the human body. But they were not recorded from any kind of therapeutic object. They might be recorded just to give a warning that these kind of symptoms might come if you come in contact with these kind of things. But there was no therapeutic value given to that. It was not understood that this power to affect the health of a human being in a certain, a particular way can also be used in curing the diseases. This was a very big discovery. This was a very big factor which came to Dr. Hahnemann, and it basically revolutionized the whole science, whole medical science. Because whenever the anything was told about some tarantula venom or some snake venom or some arsenic or some any kind of poisoning substance or any kind of other substances which would affect the health of the human being, they were always in a way of warnings that don't use this thing or don't be careful of these things. They were not from the therapeutic point of view. And the very concordance of these accounts with others of the same kind by different authors must easily convince us that the medicinal substances act in the morbid changes they produce in the healthy human body according to fixed eternal laws of the nature. So all these substances, all these medicinal substances, they basically act, and they show that they act by dearranging the health of the man. That dearrangement which they produce in the health of the man is the same power, the power of the substance that can help to basically cure the same man. And by virtue of these are enabled to produce certain reliable disease symptoms, each according to its own peculiar character. And every substance produces its own peculiar kind of disease symptoms. So that is again a very um, beautiful thing about this provings and everything, that you get to know, we get to know different kind of symptoms which can come up in a human being. When we go through the materia medica, we are learning about new symptoms, new aggravations, new ameliorations, all these things. And there is so much of things which we can know from this, from the provings, by reading the provings, that okay, this kind of phenomena can appear in the body. And these kind of medicinal substances, they have the power to bring this kind of phenomenon in a healthy body and to cure when it is has occurred as a natural disease. So this was a beautiful correlation which come to Dr. Hahnemann, which came to him, and it basically led to the discovery of the homeopathy and the provings and everything. In those older prescriptions of the often dangerous effects of medicines ingested in excessively large doses, we notice certain states that were produced, not at the commencement, but towards the termination of these sad events. So, when some old prescriptions, which were some kind of medicines were given, like for example, sulfur was given, and it was given in large doses. So, at that time, he said that there were some symptoms which were not seen during the commencement. Means when the sulfur was started giving to a patient, because of some kind of symptoms or disease which he was suffering from. At that time, no new symptoms were seen. But when they would stop the sulfur, and after the sulfur's action is going to end, towards that time they will see some kind of symptoms which are coming up, which were of an exactly opposite nature to those that first appeared. And these symptoms are exactly opposite. We have talked about this also in the when we were discussing about the isopathy. These symptoms, the very reverse of the primary action or proper action of the medicines on the vital force, are the reaction of the vital force of the organism, its secondary action, of which, however, there is seldom or hardly ever the least trace from experiments with moderate dose on healthy bodies. So, Dr. Henneman in this aphorism is trying to say that when we are giving large doses of some medicines, because when you have to do a proving, you have to give a medicinal substance. So now the question is how much, what should be the dose, what should be the quantity of the medicinal substance. So he's saying that whenever as a medicinal as a medicine, these medicinal things are given in large doses, there will be an equally opposite secondary action from the vital force, as we have discussed when we took the case of opium, that when the opium was given for sleeplessness, okay, it would produce sleep, but in the secondary action it would produce more stronger sleeplessness. So he's trying to say that this kind of reaction from the vital force is seen when the dose is very large. But when we are doing the experiments, like on a healthy human being, we are giving the medicine in healthy bodies in moderate doses or small doses. With moderate doses, very seldom these kind of symptoms or this kind of reaction comes. And if the dose is very small, then this secondary action is not present there. The primary action will come. The medicine will produce its action on the body. But the secondary reaction, because the dose is very small, the secondary reaction, the opposite reaction will not come. So basically, what he's trying to say is that we will not be confused what symptoms are produced by the medicine and what is produced by the vital force if we are going for the small doses in our experiments, because in large doses some kind of phenomena is produced by the medicine, and in secondary actions the opposite phenomena is basically produced by the vital force. So there might get some confusion that which is the medicinal action. So he's trying to say that when we go with the small doses, this confusion will not be there, because whatever the phenomena will come up, it will be of the medicinal action. So in the homeopathic curative operation, the living organism reacts from these only so much as is requisite to raise the health again to the normal healthy state. So if the dose is low, only that much of stimulus is given from where the vital force can react back to a normal healthy state, not go to the exactly opposite state. So this is basically his way of telling that we should use small doses even in the provings. He will come to the dosage in the later chapter aphorisms of the organ. He will come to the amount of dose which is to be given in a diseased state. Right now, even in the proving, Dr. Hahnemann has always advocated that give small doses. Don't give very large doses. Don't even give moderate doses, but go with the small doses. Even one of the aphorisms, it will come in the around 260, 267, around those part, where he says that the homeopathic medicine or the dose cannot be made that small that it cannot produce any reaction. So even if you are diluting it, even if you're thinking of giving it in a smallest of the um, dose, smallest of the part, even then it will rouse some kind of activity. It will stimulate the vital force the way it is supposed to stimulate. So aphorism 113, the only exceptions to this are the narcotics medicines. Okay? So now to this thing, that if you give a small dose, it will only produce a primary action, but the opposite action will not come. This is the common rule. Like I told you that this will be the common rule, and then there are sub rules, examples or some things which he will always tell that there is an exception to this thing, that when we are trying to prove with the narcotic medicines, like we are trying to prove opium or cannabis indica or hyoscyamus or belladonna or stramonium, these kind of narcotics, when we are using to see what kind of changes in the health they produce, as they in their primary action take away sometimes the sensibility and sensation, sometimes the irritability, because these medicines they produce the symptoms, yes, but they also take away some part of the sensibility always. So many times in the primary action it is not very clear that what the patient is feeling. For example, okay, someone has taken opium, he is feeling some kind of dullness in the primary action. So there is an action of the sensibility. We can note down that okay, dullness is one of the symptoms of opium. But with that dullness, the patient also becomes unable or sometimes loses his kind of sharpness to observe what other symptoms he is having. And sensation, sometimes the irritability, it frequently happens that in their secondary action, even from moderate experimental doses on healthy bodies, an increased sensibility is observed. So when the secondary action comes, the sensibility or the irritability, it increases. So in these kind of medicines, it is all most of the time seen that there is a secondary action even with the smallest of the doses or even with the moderate of the doses. So with the exception of these narcotic substances in experiments with moderate doses of medicines in healthy bodies, we observe only their primary action. So if we leave out the narcotic substances, in all the other medicines, from the plants, from the animal kingdom, from the minerals, from the metals, from wherever they are coming, except these things, we will always see that primary action of the medicine is there which produces the symptoms. That is those symptoms where the medicine deranges the health of the human being and develops in him a morbid state of longer or shorter duration. So when the medicine is given, the symptoms start developing in the primary action in a healthy human being. So they may remain for a shorter interval or they may remain for a longer interval. So only the narcotics are exception to that. So in narcotics cases, there will come some special observation which we have to see. Other than that, the rule or the principle which is laid down how to see the provings that we have to see them in their primary action, it is same for all the things. Among these symptoms, they occur in the case of some medicines, not a few, which are partially or under certain conditions directly opposite to the other symptoms that have previously or subsequently appeared. So in certain medicines, when it is given to one prover, it produces certain kind of symptom. For example, it produces this emulsion from open air in one patient. Then it is given to the second patient, it produces the same symptom. Then to a third, then it produces a symptom where the open air aggravates the patient. So he's telling about those cases, that what how we have to analyze those things directly opposite to the other symptoms that have previously or subsequently appeared, but which are not therefore to be regarded as actual secondary action or the mere reaction of the vital force. So he's saying that these are not the secondary actions or the mere reactions of the vital force, but they basically represent which only represent the alternating state of the various paroxysms of the primary action. So these remedies, they have the alternating states in their paroxysms. Different paroxysms, they have the alternating states. So this particular medicine can basically produce this state also or an alternating state also, which can vary from a paroxysm to paroxysm, from a state to state. So they are all to be taken as the alternating actions. So this is very important to understand when, because many times even when we are reading materia medica, when going through a materia medica, at one page it is written that heat aggravates, then at some other page it is written heat ameliorates. So we sometimes get confused that these are basically either the alternating states, or some particular is getting ameliorated but generally the patient is getting aggravated, or some particular part is getting aggravated and generally the patient is getting ameliorated by the same thing. So even while going through the provings or the materia medica, because these aphorisms, they help us to understand the provings also. Doing proving, yes, we should do it, and it should be done and it can be done. But even if we are not able to do the provings, these aphorisms help us to understand the provings in materia medica also, that how it has to be understood. Some symptoms are produced by the medicines more frequently, that is to say, in many individuals. Others more rarely, or in few persons, some only in very few healthy bodies. So, all the symptoms are not produced in all the individuals during the provings. Some are more frequently observed, some are very rarely observed, some symptoms are only observed on very few people. To the later category belong the so called idiosyncrasies. Idiosyncrasy is basically a person with good or strong susceptibility towards the things. See, susceptibility, although we have talked about it, but I will just add some points to it. What is susceptibility? Because a few days back we had a discussion in my clinic regarding the susceptibility. So we were talking about, I was asking that whether a person should be having this susceptibility or not, whether he should be free of susceptibility or he should have susceptibility. So for that we have to understand what is susceptibility. Susceptibility, you can understand it that it is basically an innate power of an organism to get affected. An innate power of an organism to get affected. That is susceptibility. Now, what we are getting affected by will constitute whether we are getting diseased or we are remaining healthy. So, for example, you go to a very beautiful place, you see the sunrise, you see the mountains, you see the forest, you listen to the birds chirping, you know, there is a river flowing, there is a waterfall there, you listen to the sound. So you're getting affected by that thing, but in a more good way, in a more positive way, in a more healthy way. So if you do not have the susceptibility at all, even getting affected from these things, it will not be possible. If you see a child, he's smiling, he's laughing, he's playing, and you are affected by that thing, in a positive way, it inspires you, it creates happiness in you. That is because of the susceptibility, because of the power to get affected. So then there are few individuals who have this power very strong in them, the power to get affected by good things, by bad things. They both can happen depending upon the state of health. But these people, they have more susceptibility, strong susceptibilities, the idiosyncrasies, by which are meant peculiar corporeal constitutions which, although otherwise healthy, possess a disposition to be brought into a more or less morbid state by certain things which seem to produce no impression and no change in many other individuals. So these people, the idiosyncratic people, they have been very helpful for homeopathic provings. Because of their strong susceptibilities, they could bring out even those symptoms which were not brought in the other provers because of their not so strong susceptibilities. Even those substances which are not producing a good large area of symptoms on the other individuals, these individuals, they show much better area of symptom, much better variability or variety of symptom from the same substances. But this inability to make an impression on everyone is only apparent. So this inability of some medicinal substance to make impression or to produce symptoms on everyone, it is because of the two things. For as two things are required for the production of these as well as all other morbid alterations. So there are basically two things required for these symptoms to be produced. And they are the inherent power of the influencing substance, how strong is the medicinal substance, the influencing substance, and the capability of the vital force that animates the organism to be influenced by it. That is susceptibility. So if inherent power of influencing substance is small, it is not very powerful substance. Okay, it is a mild substance, then it will not produce the symptoms in everyone. For example, let's take an example of onion. When you eat the onion, if it is not of a very strong character, the smell, the odor is not, then the lacrimation or the pungentness or the bitterness does not affect us in a very this way. Okay, but if it is very strong, it has a very strong smell, it is a very pungent smell, even peeling it, that can make us cry. The eyes may swell up, the lacrimation may start, the coryza may start. So even it depends upon the inherent power of the influencing substance, that how strong is the power of the substance which is influencing the body, and then the susceptibility of the organism also. So if they both are strong, then a strong array of symptoms can be produced by the provers. The obvious derangements of health and the so-called idiosyncrasies cannot be laid to the account of these peculiar constitutions alone, but they must also be ascribed to these things that produce them, in which must lie the power of making the same impressions on all human bodies. So we cannot say because the patient was more susceptible, that is why the substance acted. No, the substance also had the power. So if it has the power to act on this person, then it can produce the same impression on all human bodies. Yet in such a manner that by a small number of healthy constitutions have a tendency to allow themselves to be brought into such an obvious morbid condition by them, that these agents do actually make this impression on every healthy body. So Dr. Haliman is trying to clear this thing, that if your prover is an idiosyncratic prover, then don't take it in a way that this substance has not given good symptoms on the two or three other provers or 10 other provers as strongly as it has given on this patient. So it may be because of the sensitivity of the patient, susceptibility of the patient. So he's saying that, okay, the susceptibility is there, the strong susceptibility of the patient is there, but even with a strong susceptibility, the medicinal agent can only act if it has the power. Only because of the susceptibility will not affect the patient. The power has to be there also. So if it has the power of producing these kind of symptom or affecting the health of the person, this prover, then it means basically it has the power that when given a homeopathic way to a sick patient, it can also cure the same symptoms which it has produced. So the power is there, because two things are required for this to happen: the power of the medicinal agent and the susceptibility of the prover. So these agents do actually make this impression on every healthy body, is shown by this, that when employed as remedies, okay, when we are giving them as remedies, as medicines to the patient, to the sick person, they render effectual homeopathic service to all sick persons for morbid symptoms similar to those they seem to be only capable of producing in so-called idiosyncratic individuals. So he's saying that when these medicines are given to the sick persons, there it is seen that these medicines, they cure the sick patients which produce these symptoms which only the idiosyncratic individuals are capable of producing. So footnote to aphorism 117, there are two footnotes. Some few persons are apt to faint from the smell of roses. For example, this is a basically in relation to the idiosyncrasy, that there are some persons, even the smell of rose, when they whiff it, when they sniff it, they just go into fainting. Usually the smell of rose does not affect everyone. It is a good odor, we like that odor, we like that smell. But with some patients, you will find that they go into the state of fainting. So that means that rose, or the smell of rose, or the rose has something in it that can produce fainting, although it does not produce fainting commonly in the people, but in few people it can cause fainting because it has that power. And to fall into many other morbid and sometimes dangerous states from partaking of mussels, crabs, or the rose of barbel, or from touching the leaves of some kind of sumac. So these patients, or these kind of individuals, not patient, but these kind of individuals, they, because of their susceptibility of getting affected, they can get into these kind of dangerous states from taking some mussels or crabs or touching the leaves of some kind of plants. So all those plants or the leaves, they do not affect the other people, but because of the power of the rose or the plants plus the strong susceptibility of the person, they affect him. So from there, we can understand this second aphorism. Thus the Princess Maria restored her brother, the Emperor Alexius, who suffered from faintings, by sprinkling him with rose water. So the Emperor Alexius, he was suffering from faintings, and he was cured by rose water. So that means rose have the power to produce the fainting, and by that power, it can also cure the fainting in certain individuals. In the presence of his aunt Eudoxia, and Horsius saw great benefit from rose vinegar in cases of syncope. Again, the faintings. Another author, another this physician, he saw that the rose vinegar gives very good results in the cases of syncope. So this is what we have to understand, that even if some substances, we might think that rose is basically a non-medicinal substance, but rose water is used in many kind, it has a very beneficial effect, and it has been used from ages. The people has known the effect of rose water from ages. So every medicine exhibits peculiar actions on the human frame, which are not produced in exactly the same manner by any other medicinal substance of a different kind. And this is again a very beautiful thing, that anything which has a medicinal property in it, it produces its peculiar actions, individual symptoms in the human frame. And those, or the set of those symptoms, are not seen in the other remedies. So this is what the study of materia medica is all about, to understand the individuality of each and every medicine, how it produces the symptoms in the human frame, and what are the phenomena or processes that we have to match when we are giving them as remedies. So again, footnote to aphorism 118. This fact was also perceived by the estimable A.V. Holler, who says, this is in Greek. So the translation is, let there be an immense diversity of the powers in those very plants. So he was basically a person who was working on the plants, and he said that there is an immense diversity in the powers of these plants, not in the biology, or not in the structure or this thing, but the powers of these plants, the powers which they have, whose external features we have long known. Although we have long known the external features of these plants, what kind of leaves they have, what kind of stem they have, what kind of roots they have, but the power, it is immensely diversified. As certainly as every species of plant differs in its external form, mode of life and growth, in its taste and smell from every other species and genus of plant, as certainly as every mineral and salt differs from all others in its external as well as its internal physical and chemical properties, which alone should have sufficed to prevent any confounding of one with another. So certainly do they all differ and diverge among themselves in their pathogenetic. So he's saying that all the plants that differ in their mode of life, how they are growing, what are the requirements of their growth, what kind of form they take, what kind of flower comes, what kind of fruit it bears, in the taste, in the smell. Okay, every genus and every species, they differ from each another. And similarly with the minerals and the salts, the metals, they basically differ in their external and internal physical and chemical properties. Although just by understanding this, one should have come to this conclusion that we cannot mix them while giving. We should not mix them. The way they are naturally produced, their individual properties should be known before mixing them up or combining them up. We should know what kind of medicinal effect they have on the body. So he's saying that in the same way, they also differ and diverge in their pathogenesis, the power of producing diseases or the power of affecting him health of the individual. Consequently, also in their therapeutic effects, because the same pathogenic effect power is the therapeutic power. So similarly, in their therapeutic power also, that what kind of symptoms they can cure in a sick individual. Each of these substances produces alterations in the health of human beings in a peculiar, different yet determinate way, so as to preclude the possibility of confounding one with the another. So he's saying that there is no confusion should be in the understanding with a reasonable mind. The person who has a reasoning mind, he can very easily understand that every plant, every mineral, every salt is basically a different this thing, and they are producing different kind of symptoms. They have the power to cure different kind of symptoms. They all are individual in their selves. So there should not be any confounding. There should be any confusion with one and the another. This is basically law of individuality. Law of individuality does not only work while we are taking the case, while we are trying to understand the patient. The law of individuality is in the nature. Everything is different. Every day is different. Every second is different. Every thing around you is different every day. They are not same. So until and unless we understand this law of the nature, it will be very difficult to differentiate or to understand the peculiarities, because without differentiating we cannot understand the characteristic, we cannot understand the peculiarity of anything. Everyone's understanding is different, everyone's growth is different, everyone's individuality or the way they have learned is different, and we have to understand this thing. We have to understand the development of the individual human being and the development of the remedies, how they develop when they were proved individually, what kind of peculiar characteristics symptoms they produced, and yet in determinate manner. Determinate manner means it is determined that this kind of things will come with this particular mineral, with this particular plant, with this particular kind of medicinal substance. They are in a very determinate manner. So first footnote to the aphorism 119. Anyone who has thorough knowledge of and can appreciate the remarkable difference of effects on the health of man of every single substance from those of every other will readily perceive that among them there can be, in a medical point of view, no equivalent remedies whatsoever, no surrogates. So if one kind of medicine is needed in a patient, we cannot use some kind. There are no surrogates. There is that okay. If I don't have this or it is not available, or this, we can use some medicine instead of this. Only those who do not know the pure positive effects of the different medicines can be so foolish as to try to persuade us that one can serve in the stead of the other. So only the people who don't know the pure effects, the symptoms which these kind of medicines produce, then they can see that okay, if this salt is not working, then give this salt, or if this salt is not available, then give this salt, and can in the same disease prove just as serviceable as the other, or the same thing which belongs to certain set of symptoms, it can be serviceable or it can affect the other set of symptoms. He's saying that this cannot happen. Every disease has its own individuality, every medicine has its own individuality. So we have to understand that those individualities. Thus do ignorant children confound the most essentially different things because they scarcely know their external appearances. He said that it is just like the children who is confused, what is what, because they don't understand or they don't know the external appearances, far less their real value, their true importance, and their very dissimilar inherent properties. That all these things, all these medicines, they have dissimilar inherent properties which make them unique. Even cannabis indica and cannabis sativa, very closely uh, in their genus, they are very close plants, but they produce different kind of symptoms. Their sphere of actions are completely different. Second footnote to the aphorism 119. If this be pure truth, as it undoubtedly is, then no physician who would not be regarded as devoid of reason and would not act contrary to the dictates of his conscience, the sole arbiter of real worth, can employ in the treatment of diseases any medicinal substance, but one with whose real significance he is thoroughly and perfectly conversant. He says that if we understand this thing, that every medicinal substance has its own properties, so that there any only the physician who is devoid of complete reason will use some medicine whose properties he does not know. Means what kind of action it produces on a healthy human being, he does not know about that thing. Only a physician devoid of reason will use this thing. Otherwise the physician who has conscience in him, who is good in his reasoning capability, he will always give the medicine whose actions or the properties he know, that is whose positive action on the health of healthy individual he has so accurately tested that he knows for certain that it is capable of producing a very similar morbid state, more similar than any other medicine with which he is perfectly acquainted, to that presented by the case of disease he intends to cure by means of it. So he said that he will only use those medicines with the morbid phenomena of which medicine he is basically acquainted with, which he knows. And when the case is presented before him, and he sees that all the phenomena, all the symptoms, or more the most characteristic symptoms are basically belonging to that medicine, then he will give that medicine. For as has been shown above, neither man nor mighty nature herself can effect a perfect, rapid, and permanent cure otherwise than with a homeopathic remedy. So he's saying that we have done and discussed with this thing that neither man nor the nature herself can affect a permanent rapid cure if the remedy is not given in a homeopathic way. Henceforth, no true physician can abstain from making such experiment in order to obtain this most necessary and only knowledge of the medicines that are essential to cure, this knowledge which has hitherto been neglected by the physicians in all ages. So, see what the true physician can abstain from making such experiment. If a physician is truthful, if a physician is, you know, conscientious, he only listens to his conscience, that is the only highest authority for him, that kind of physician cannot stop himself from making such experiments, from making these provings, so that he can know the whole knowledge of that power, the pathogenetic effects of that medicine. So he goes to that extent that a physician has to prove the medicines himself and know the whole phenomena. And then there are few physicians who don't even encourage the study of materia medica. They just give some small things, keynotes, or this thing, and tell that okay, this is what you need to know. They never, because when we are new to the homeopathy, this whoever is coming newly to the homeopathy, they don't know what it requires, what homeopathic knowledge has to come to you. You cannot come to the homeopathic knowledge. That is a fact. Homeopathy has to come to you. So we are just told that this okay, this materia medica is homeopathy, this repertory is homeopathy. You have to match the symptoms and give the no. There's a different thing which has to be produced in an individual so that the homeopathy has to can come to him. There is a soil which has to be prepared. There is a topology which has to be ingrained or made inside an individual so that the homeopathy can come to him. And when it starts coming, then there is no way that that it comes wholly. It does not come in parts. It does not come partially, or it does not come in small things. Then it comes wholly to you. So everywhere when he uses the true physician and conscientious physician, he's using the words truth. So the first thing for a individual to become a homeopath is that he has to be the seeker of truth. He will not go for anything which is else than truth. So the way to understand the medicines, okay, like I have told that okay, if we cannot go for the proving, at least to do the proving, at least we can study the provings in the detailed manner how they have been given. Because this culture in homeopathy of going directly to the rubrics is what basically uh, is harming. Rubrics, okay, they are very good. We need to go there. But after we have understood the provings or the materia medica, then we have to go to the rubrics so that we can see how the medicines are given in our repertory. So this understanding of how the phenomena is happening, because in repertory there are, in the rubrics there are the parts of phenomena, not the phenomena itself. It is not given there. Only some parts of phenomena are given. But when you go to the materia medica or the provings, it's a completely different picture which is written there. So in order to obtain this most necessary and only knowledge of the medicines that are essential to cure, this knowledge, which has hitherto been neglected by the physicians in all ages, in all former ages, posterity will scarcely believe it. Physicians have hitherto contented themselves with blindly prescribing for diseases medicines whose value was unknown and which had never been tested relative to their highly important, very various, pure dynamic action on the health of the man. So he was saying that in the past, the medicines have always been given blindly without even knowing what kind of action they will produce in a healthy human being. And moreover, they mingled several of these unknown medicines that differed so vastly among each other in one formula, and left it to chance to determine what effect should there be produced on the patient. What kind of effect they will produce, it was left to the chance, that we will see what happens, like that. That is the way the medicine was practiced at that time. This is just as if a madman should force his way into a workshop of an artisan, seize upon handfuls of very different tools, with the uses of all of which he is quite unacquainted in order, as he imagines to work at the object of art he sees around him. He's saying that he's just relating it to some, that it was a madness, that you have a very beautiful thing, the medical science, which needs good artists. And then there is this madness which is going on, where the person is not knowing about the tools, not knowing about the medicines, not knowing, and he's going on with a fancy, with an imagination that he can cure the patient. I need hardly remark that these would be destroyed, I may say utterly ruined, by his senseless operation. That this is a senseless operation, and they will destroy the patient, they will ruin the patient's health more further. Therefore, medicines on which depends man's life and death, disease and health, must be thoroughly and most carefully distinguished from one another, and for this purpose tested by careful pure experiments on healthy body, for the purpose of ascertaining their powers and real effects, in order to obtain an accurate knowledge of them, and to enable us to avoid any mistake in their employment in diseases, for it is only by the correct selection of them that the greatest of all earthly blessings, the health of the body and of the mind, can rapidly and permanently restore. So now we have come to the first and second aphorism. The first aphorism, where we start that the highest mission of the physician is to cure the sick and restore the health. So for restoring that health and curing the sick, what is required is that these medicines which we are going to give to the patients, we must have the accurate knowledge of them, the real power which they have, every individual medicinal substance and the precise characteristic things which they can produce and cure. We have to have that knowledge, and the knowledge which is based on the pure experiments which have been done carefully. We are blessed to have materia medica. Dr. Hahnemann didn't had that kind of luxury. He didn't had that kind of luxury. Before him, no materia medica existed. He made materia medica. He paved a path for the other, so that they can go and do those provings, and many have helped. Dr. TFL and Dr. Herring and many other physicians, they have helped in the provings, and by their dedication and by their untiring zeal which they had, now we have a very vast knowledge of materia medica, and it is upon us, upon our conscience, that how accurately we can understand that knowledge which is passed to us. They had to make that knowledge, we have to just understand that knowledge. It is very easy for us, the circumstances have been made very easy for us. So now it comes up to us that can we show the same kind of zeal, or can we, go into the same, these gaining of the knowledge with the same kind of mentality, to the mentality to seek the truth, what is right. That is why Dr. Hahnemann many times say that this is a job which requires loyalty. You know, that a person, the physician, has to be loyal towards his patient, towards his job. That I am a seeker of truth, and I will not depend upon whatever is false. I will not. Aphorism 6, that an unprejudiced observer, well aware of the futility of these speculations, he will not speculate. When we stop speculating, we start becoming an unprejudiced observer. We start becoming a very good observer. The only thing is that we have to be aware that my speculation may take me to something which is not true. So the theories which are based on speculations, which do not confirm with the organon, whether they are widely accepted, whether they are not widely accepted, they all has to be thrown out from a homeopathic physician's mind. Organon is like a glass, the glasses through which we can clearly see what is useful and what is not useful, what is true and what is false, what we have to do and what we don't have to do. So we'll stop today at aphorism 120. We have done 10 aphorisms today, and we'll start with the aphorism 121 next time. Any questions regarding this or regarding anything else? Again, uh, everyone is always welcome to ask any kind of questions. So if there are any questions, please send it to us, and we will start with the questions next time, and then from there go on with the aphorisms. Thank you. Thank you very much. Have a very good evening to all of you. So today we will start with the aphorisms belonging to the provings. So before going into the part of the provings, some things about the provings which we need to understand first. Although the more we will start with the part when we will go through the aphorisms, we will talk about it. But there are few things which we need to understand for the before we start with the proving. There is just an outline about something. Our whole knowledge of materia medica, it comes from the process of proving the medicines. When the medicines they are given on the healthy individuals to know what kind of medicinal properties these medicines contain. So along with the discovery of similia similibus currenter, along with the discovery of um, the homeopathy itself, the discovery of the provings, it was a very big thing. Why it was, we will, when we will go through the aphorisms, we will talk more in more detail. But it was a very big thing for the science. Before this method, the proving of the medicine on the healthy human beings, the medicines or the action of the medicines were seen on the sick people. If even now, if there is some drug, some new drug, uh, first we label that drug as an experimental drug, that we are making experiments with this drug. So some volunteer patients are chosen, 100 patients or 200 patients who voluntarily want to test this experimental drug. They are chosen. So those patients, they are already sick. So then the medicine is given, and then we see whether their symptoms are reducing or not. Even now, this thing is going on. Whenever some new drug is coming, whenever some new medicine, some cancer medicine, some immunosuppressant, when they are launching, before launching there is a study, but the whole study is done on the sick people. So in these aphorisms, Dr. Hahnemann will tell about this thing, that why we cannot get a clear picture of any medicine when we are basically testing it on a sick person. Why we cannot have that thing. The study of the homeopathy, the other part about the proving, the study of the homeopathy, it started with the proving. When Dr. Hahnemann, he took that China, he proved that medicine. So the whole discovery of the homeopathy, anything, the similia similibus current, anything which came afterwards, that all basically began with the proving. When the proving was done by Dr. Hahnemann on himself, and he saw that after taking China, he's getting all the symptoms of malaria. So from there it all started. So proving is basically a base of everything the homeopathy is basically standing on. Nowadays we don't do much of provings. We have materia medica, but when Dr. Hahnemann started proving, there was no materia medica. There was no pro forma for case taking, nothing. When he started proving, he started getting symptoms. He came to this knowledge that I can ask about these symptoms when I'm taking the case. So even the case taking has come out of the provings, because he started understanding that these kind of symptoms arise in the patients. So I can ask about the stomach pains, or I can ask about the this kind of headache. I can differentiate between the headaches of 5 or 7 medicines after he started proving the medicines. So the materia medica, there was no materia medica for Dr. Hahnemann. Materia medica came afterwards, case taking came afterwards. The first he started with the provings of the medicines. So with that we will start with the aphorisms on provings. Because nowadays I was going to tell that nowadays we don't do much provings. We should do, because by proving we can know for certainly how the symptoms come. But still, if we are not doing the provings, we need to understand the materia medica has all come from the provings. The repertory has all come from the provings. Many times we just stick to the repertory, we just stick to the rubrics which are there in the repertory. Many times when I'm talking with the doctors, when I'm giving some lecture, when I'm in a workshop, I always tell that rubrics are very small part of the symptom. Even if we are taking a rubric, if there are some medicine, we must go back to the proving or the materia medica to see how this symptom was displayed by the patient. Then only we can understand. If there is fastidiousness in arsenic album, in proving it was more of sensitivity to disorder. That was the expression, that he was too sensitive, he cannot, it was painful sensation when he would see disorder outside him. In his surroundings, when a patient is seeing disorder, that the things are not kept properly, they are not in a good shape, or in a, he it was intolerable for him. So that language of proving what the patient expressed tells us more about the medicine, more about the symptom, because repertory is a very, very, very small part of the provings. Materia medica, okay, there are many kind of materia medicas. There are the materia medicas of proving, there are the clinical materia medicas, then there are comparative materia medicas, and there are some materia medicas which are just on the mental part of some remedy. But again, the main source is the provings part. That is the main source. We cannot understand the hypnotic state of Crotellus cascavella if we don't look at the provings. There is a rubric, magnetic states. Rubric is of magnetic states. But when you go in the proving and you read about the Crotellus cascavella, it's a completely different thing. That magnetic state basically comes down to the hypnotic state, as if the person is under the hypnosis of someone and he is doing as he is asked to do it. So completely change of meaning happens. So we'll start with the proving, the aphorisms on provings. Aphorism 105. The second point of the business of a true physician relates to acquiring a knowledge of the instruments intended for the cure of natural diseases. So the second point of the business, after the case taking, or after understanding the basic mechanism of finding the symptoms or knowing about the symptoms, the second point of the business is to know about the instruments which are going to cure, means the knowledge of how the medicines work, how the medicines act, what kind of powers the medicines have. Investigating the pathogenetic power of the medicines. Many times in the organon, the word is used as the pathogenetic power. Patho means disease, genetic means producing. Dr. Hahnemann has always told in the sense that the medicines, the power which the medicines have, it is the disease producing power, which we use to cure the disease. So the medicines, they don't they don't contain the power to eradicate the disease. This is a very important point to understand. For example, arsenic, if it is given to a person, it will cause some symptoms of the arsenic poisoning. Merxol, mercury, if it is given to some person, it will basically cause some symptoms of the poisoning. There will be an aphorism, I think 110 is the aphorism, where he tells about this thing in more clarity, that the doctors have been observing this thing, that the medicines or these substances, they basically contain the pathogenetic power. They wrote down that a person, he took the arsenic and these were the symptoms. He started vomiting, he became weak, he became very, the palpitation was there, the anguish was there, the anxiety was there. So he says that all these power of the medicines were the same power which is the curative power. If any patient comes with all these symptoms, although he is not poisoned, but he has this symptom, and you give him a dose of arsenic, he will start becoming better. How he becomes better, it has already been discussed in the previous aphorisms with the primary action and the secondary action and the therapeutic law of nature. All those things we have done already. I just wanted to say that everywhere, whenever the power of the medicine is basically dictated or told about, or some adjective is used to tell about that thing, it is always pathogenetic power of the medicines. In order, when called on to cure, to be able to select from among them, from the list of whose symptoms and artificial disease may be constructed as similar as possible to the totality of the principal symptoms of the natural disease sought to be cured. So we have to investigate into this power. If, for example, if we take something, for example, water does not have any kind of pathogenetic power in it. It is a very neutral substance. So it also does not have any power to heal anything. Onion, the raw onion, if you eat it or even if you peel it, it has the power, it affects the human being and we start lacrimating. Slight coryza and lacrimation starts from the raw onion, from the pungent smell of the onion. So that is a pathogenetic power of the onion. When you eat chilies, some green chili, it basically starts, burning in the mouth, and some erosion or some this thing may happen in the mouth, some inflammatory process. That is the pathogenetic power of that substance. It produces some symptoms. It produces unease in the body, dis-ease in the body. So that is the power of the medicine, power of the substances when they are acting on us. And we use the same power of those substances to cure similar symptoms. That is why we have to find among the list of the medicines which has the same kind of pathogenetic power. There are the symptoms which we have taken in the case taking. From the materia medica, we take out the medicine which have the tendency to produce such kind of symptoms, and then we give that medicine to us. That is similia similibus currenter. So aphorism 106, the whole pathogenetic effects of the several medicine must be known. The pathogenetic effects, they should be known wholly, not in some parts, not in the part of head, not in the part of arm, but on the whole body. What kind of effects they produce. That is to say, all the morbid symptoms and alterations in the health that each of them is especially capable of producing in the healthy individuals must first have been observed as far as possible. So any kind of symptoms, any kind of alterations that they can produce in a healthy individual, not in a diseased person, but in the healthy individual, because a healthy individual does not has any symptoms yet. So all the symptoms which we will get when we start proving that medicine, when we will start giving that medicine to that person, all those symptoms will be of the medicine, not of the individual. They will be all of the medicine. So we can have a very clear picture of the symptoms which are there, which are coming to the patient. If it is a sick person, then the sickness, the symptoms of the sickness plus the symptoms of the medicine, they will get confused. We will not be knowing that whether the patient is basically giving the symptoms of his sickness or they basically belong to the medicine. So it will be a very confusing thing. So that is why the best thing to do is to do it on the healthy individuals. The first reason. The second reason is person when he is already sick, if you are giving him some medicine which will aggravate him, his condition will deteriorate. His original disease might deteriorate. He might not be able to go through that experiment. So the purpose will not be solved. Before we can hope to be able to find among them and to select suitable homeopathic remedies for most of the natural diseases. So first the proving has to be done. We have to know about the medicinal properties. We have to know what kind of pathogenetic power they have before we can use them on diseased people, on sick people. But other experiments on the drugs are completely opposite. The experiments are done on sick people and the medicine is given to sick people without knowing the whole pathogenetic effects. The purpose is to find the whole pathogenetic effect. So if we are giving some medicine for the find a medicine and giving to a sick person who is suffering from some heart disease, and after taking the medicine there are some symptoms in the kidney, we don't know whether the disease has shifted or these are the symptoms of the are the pathogenetic powers of that medicines. We don't know clearly about it. So usually a subsection is written about the side effects, but we don't know about the side effect, whether some symptoms are coming because of the medicine, the drug, or because of the kind of metastasis of the disease. So aphorism 107, if in order to ascertain this, medicines be given to sick persons, now the same thing only, even though they be administered singly, even if we are administering the medicine singly and alone, then little or nothing precise is seen of their true effects. The whole thing, like we have talked about it earlier also, that truth is very important. That is why again and again in many aphorisms you will see this word again and again. So anything which can alter the state of truth, that is never allowed in homeopathy. Even in case taking, if there is something which will alter the picture of the true picture, it is not allowed. In proving, if there is something which can alter the true picture, it is not allowed. As those peculiar alterations of the health to be expected from the medicine are mixed up with the symptoms of the disease and can seldom be distinctly observed. So those symptoms they will mix up, the symptom of the medicines and the symptom of the disease. For example, this medicine, whichever we are proving, it has uh, the power to increase the symptom which is already there in the patient. So if that symptom will increase, for example, the patient you had a headache or had fever or some kind of fever or the thirst, he had thirst in the fever. So this medicine also have the power to increase thirst during the fevers. So after giving the medicine, if that symptom is getting aggravated, we don't know whether it is the disease symptom which is getting aggravated or it is aggravating due to the effect of the medicine. The picture will not become clear. So we will not get the true pathogenetic effect of the medicine. There is therefore no other possible way in which the peculiar effects of medicines on the health of individuals can be accurately ascertained. So there is no other way to understand the effect of the medicine. There is no sure, no more natural way of accomplishing this object than to administer the several medicines experimentally in moderate doses. The thing is that the medicine should be given in very moderate doses when we are experimenting with them. Two healthy persons in order to ascertain what changes, symptoms, and signs of their influence each individually produces on the health of the body and of the mind. What kind of symptoms are produced on the body and the mind of each individual? Now, this process, like there are sometimes these things that the homeopathic medicine does not have medicine in it. Sometimes these come type of things comes that the whole cure is done, although we have shown cases so many times, or we have seen those cases where where it is not possible, that only the placebo can get this kind of effect. But still, when these kind of, so there is this thing that when in the provings, when the medicine is given to, like for example, 10 people, without those people, they don't know about what medicine is being given. Those people don't know what kind of symptoms are being produced by this medicine. They're just being given the medicine. After the medicine is given, they are told to tell what kind of symptoms they have. And when the 10 of the patients, they have similar kind of symptoms, they all are having several similar kind of symptoms, without knowing the medicines, without knowing the materia medica of that medicine. They don't know about it. They are not even doctors. So they don't know about it, what kind of symptoms will come. So when again and again the same medicine is producing same kind of symptoms, so that tells us something about the medicine. That yes, this medicine or these medicines, the homeopathic medicines, they have the power to change the state of health. So they have some power in them. They can influence the health of the human being. So if they have the power to influence the health of the human being, then the same power is used basically to cure the diseases. So it is a very clear and clean example, a clear and clean experiment by which it can be ascertained that these medicines can or do have this kind of power. There is no need to go in the laboratory and search whether there are nanoparticles, whether there is something in this or not. Just give the medicine. Tell the person, take the medicine and let us know how you feel after taking the medicine. So when these changes are coming, administer the several medicines experimentally in moderate doses to healthy person in order to ascertain what changes, symptoms, and signs of their influence each individually produces on the health of the body and of the mind. So in the proving also, we are not only talking about the symptoms of the body, but also the mind. What kind of changes in the mental health, in the mental state? Because any medicine which is given, it changes the state of the mind also. There is always a change. Because the medicinal, anything which has medicinal property in it, anything which has pathogenetic property in it, it cannot produce the change in the body without producing the change in the mind. Those aphorisms will also come later on. That is to say, what disease elements they are able and tend to produce, since, as has been demonstrated, all the curative power of medicine lies in this power they possesses of changing the state of man's health and is revealed by observation of the later. So the same thing which we have talked about, that the curative power of the medicine, it basically, we have already discussed in aphorism 24 to 27 about this thing, So that curative power of the medicine is the same power that is the pathogenetic power. How it basically changes the state of the health. Footnote to aphorism 108. Not one single physician, as far as I know, during the previous 2500 years, thought of this so natural, so absolutely necessary, and only genuine mode of testing medicines for their pure and peculiar effects in deranging the health of the man. So, Dr. Henman is saying that for past 2500 years, there was no one except it will be coming forward that who basically can think of this thing, that it is so natural and so common thing that if you want to check the medicine, the effect of the medicine, check it on the healthy human being and see how it is deranging the health of the man. How you will use it, either allopathically, either isopathically or homeopathically, that is a different debate. But for checking the power, for checking what kind of changes the medicine can bring, the sulfur, what kind of changes it can bring, it will be better to test it on a healthy human being in moderate doses, small doses, so that it does not disturb the vital force of the process. And as soon as you will stop the medicine, the vital force will basically is capable of pushing the symptoms out, curing the symptoms whichever were there. So he's saying that this simple and genuine mode of testing the medicine for the pure and peculiar effects in order to learn what morbid state each medicine is capable of curing, except the great and immortal Albrecht von Hellen. He says that besides Dr. Hahnemann, only Albrecht von Heller, he basically thought about this thing. He alone, besides myself, says the necessity of this. Why the preface to Pharmacopoeia Helvet? So there was a Pharmacopoeia at that time. So it was written in Latin. I have changed it to the translated into English. Certainly, medicine must first be tried in a healthy body. So this was a preface of that pharmacopoeia without any foreign mix. So first, the medicine should be tried in the pure form and should be tried on the healthy body. Having examined its smell and taste, a very small dose of it. So it should be given in a very small dose of it is to be poured in, and it is to be noted that all the things that happen therefrom, the affections, what pulse, what heat, what respiration, what excretions, should be noted. So any changes which are coming afterwards, giving a small dose, they should be noted. From there, to guided phenomena in a healthy way pass on to the experiments in the patient's body. So from there, we will pass on the same, we will be guided by the phenomena which we have seen in the proving, and then we will experiment it on the patient's body where we'll see the similar phenomena, or it may be used in the other way. But no one, not a single physician, attended to or followed up this invaluable hint. So he's saying that no one basically followed up this hint. It was a hint given in the preface, but no one followed it up. I was the first that opened up this path, which I have pursued with perseverance that could only arise and be kept up by a perfect conviction of the great truth, fraught with such blessings to humanity, that it is only by the homeopathic employment of medicines that the certain cure of human maladies is possible. So he's saying that I am the first person who has opened this path, and I have pursued with perseverance. I have done everything with genuinity, with hard work. I have gone through this path, and why I have gone to get to the great truth, because he was very much had confidence in this thing, that that I am very close to that path, I am very close to that system which can basically come as a blessing to humanity, to cure the humanity, that there is so much bad going on with the medical system. So I'm very close to finding a system which can give hope to the humanity. So he had this conviction, he had this confidence, and that is why he was always had this thing in the mind that there has to be something which can give answer to this, sickness and everything which is going on. And he says that I am very much convinced, and I am, because he had done so many things. The conviction was not coming out of some kind of gratefulness or some kind of bloated mind. No, because he had already done so many things. If we look at the history of Dr. Hanuman, he has done so many things. So after doing something, when you are getting something which is completely opposite to what you have been seeing, which gives you a insight into the truth, insight into the system, which have the answers to all the questions which have been put out by the nature in the form of diseases. So that is why he said that it is the only by the homeopathic employment of medicines. If you will employ the medicines, sulfur was given in an allopathic way also, and sulfur can be given in a homeopathic way also. Medicine is same. Medicine is same. It can be used to suppress skin diseases. It can be used to cure skin diseases. The way of giving is homeopathic. Like I have talked earlier also, that medicine is not homeopathic. The way of giving is homeopathic. A medicine can only become a homeopathic medicine when it is given in a right way. So that is what he is saying, that only by the homeopathic employment of medicines that a certain cure of human maladies is possible. It is impossible that there can be another true best method of curing dynamic diseases. That is, all diseases not strictly surgical. So except from the surgical diseases, he is saying that there is no other method which is best at curing dynamic diseases. Diseases which are coming from the dynamic origin besides homeopathy. Just as it is impossible to draw more than one straight line between two given points. Like between the two given points, we cannot draw more than one line. Similarly, it is impossible to find some system which is best at curing these chronic diseases, these dynamic diseases, except homeopathy. He who imagines that there are other modes of curing, he had done isopathy, he had done allopathy, he has done heteropathy, he had done everything before discovering homeopathy. So he's saying that I have already gone through this path. And I'm telling you that if you are imagining that there are other modes of curing diseases besides it, could not have appreciated homeopathy fundamentally, nor practiced it with sufficient care. So even after telling all these things which I have told, I have given the whole philosophy, I have given the whole principles, how to practice it. If someone is not able to appreciate the working of homeopathy, he's saying that then basically the thing is that he has not practiced it with sufficient care. The thing is that, homeopathy can only come. I was talking about this thing with some of my students today, that to grow a plant, if you want to grow a plant, for example, if you want to grow a plant of apple, yes, the condition has to be there, the water has to be there, the sunlight, the temperature has to be there. But even if all the things are in perfect thing, but the soil is not perfect, the plant cannot grow, the seed will not erupt, because the eruption of the seed is basical, is what happens in the soil. So even for the homeopathic seed to erupt, we need that kind of soil so that it can erupt. If we can, if the mind is already the soil is already in a state where it cannot see beyond the things which are possible. If the mind is already closed to something new, if we are already opinionated, the homeopathy will not bloom in that kind of soil. There are certain things which have to be done. If there is no interest in knowing the truth, if someone is okay with the false perception that okay, symptoms are not there, disease is being managed, so the patient is well. If we are into that perception that basic work of a medical science is to manage the disease, is not cure it, then we will never think about curing it. That is the difference between homeopathy and the, because in homeopathy the first thing starts from the cure. The first aphorism starts from the cure, curing the sick to health. The intention or the seed which we are putting in the mind of a new homeopath is that we have to cure the disease, not find the cause of the disease, not find the diagnosis of the disease, not find the uh, some medicine to manage the disease. The first seed is of cure. See how many teams curing, cures in one aphorism, curing again here. 3 4 times Dr. Hahnemann has used the word cure, 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 so that a homeopath, a physician, can have this thing in the mind that the cure is a possibility. Because till now, even the patients, I am so many times surprised. The patient comes, doctor, can this be cured? Can allergy be cured? They are surprised because they are always told that this cannot be cured. When the child will be 12 years old, 13 years old, this will go away. That does not go away. That basically changes into some other disease at that time. There are few lucky people where the allergy they last even after 13 or 14 years. They're lucky that it has not gone further into some kind of dangerous symptoms. So until and unless we have that thing in the mind that we can cure, we will not think about curing. So that is why Dr. Hahnemann has written it so many times that I have discovered a way of curing the diseases, not managing them. Because I have seen all the methods, I have done all the methods, I have practiced all the methods. And at the best, I was able to manage the disease. I was able to kill the pain for certain time. I was able to manage the constipation. I was able to manage the diarrhea, but they will come back again and again. That is what was the problem. So now I have found a way of curing the disease. And he was surprised why the people are not, getting this point. So that is why he has written that if someone could not have appreciated homeopathy fundamentally or nor practiced it with sufficient care, nor could he ever have seen or read cases of properly performed homeopathic cures. Because once with an open mind, if someone see a homeopathic cure being performed, hears about some case of homeopathic cure, it will take him to a different level. This can happen. He will question, he will have this thing in his mind that okay, I want to see it happening. He will be curious. Only a person outrightly rejecting that kind of thing will be a person who is not open and is very much opinionated. Nor, on the other hand, could he have discerned the baselessness of all allopathic modes of treating diseases and their bad or even dreadful effects. If, with such lax indifference, he places the only true healing art on an equality with those hurtful methods of treatment or alleges the latter to be auxiliaries to homeopathy, which it could not do without. So there were some physicians who were saying at that time that homeopathy, okay, it can work, but it cannot work without allopathic medicines. Like you have to go side by side. So he's saying that this is not what the homeopathy is. So my true conscientious followers, the pure homeopathists, with their successful, almost never failing treatment, might teach these persons better. So he had this hope that in future, so true conscientious followers, the people who will work in homeopathy with whole of conscience and pure heart, they will show that how this treatment, how homeopathic medicines they work in these cases. So I saw moreover that the morbid lesions which previous authors had observed to result from the medicinal substances when taken into the stomach of healthy persons, either in large doses given by mistake or in order to produce death in themselves or others. So he's saying that there are some previous authors who had written about the medicinal substances, that what kind of lesions or what kind of effects it produces in the stomach of a healthy person, whether they were taken accidentally in large doses or someone basically tried to commit a suicide by taking some kind of poison, or others, or under other circumstances accorded very much with their own observations when experimenting with the same substances on the myself and other healthy individuals. Okay. So he's saying that I also saw the same lesions when I was experimenting with those substances on myself and other healthy individuals, and they whatever they have written is right. Either the medicine or those substances were given accidentally in large doses by mistake, or someone tried to commit a suicide and then they saw these kind of lesions after taking some kind of poisons. These authors give details of what occurred as histories of poisoning and as proofs of pernicious effects of these powerful substances. What are the pernicious effects, what are the harmful effects of these powerful substances, chiefly in order to warn others from their use. So he's saying that they have written all these symptoms, that arsenic was taken and this kind of symptoms were coming, and they have written it to warn the others, so that do not ingest it, do not take it. It can produce this kind of ulcerations, this kind of lesions in the stomach, in the esophagus, in the mouth, partly also for the sake of exalting their own skill when, under the use of the remedies they employed to combat these dangerous accidents, health gradually returned. And partly to exalt their skill, to make their skill better, that they used some remedies to um, kind of antidote the effects of these things, and the health gradually returned. But partly also when the person so affected died under their treatment in order to seek their own justification in the dangerous character of these substances, which they then termed poisons. But also when someone died under their treatment with the same medicines, same poisonous substances, they said, okay, they are basically pernicious substances. Some they get better, some they don't get better. To have a loophole, kind of loophole. None of these observers ever dreamed that the symptoms they recorded merely as proofs of the noxious and poisonous character of these substances were sure revelations of the power of these drugs to extinguish curatively similar symptoms occurring in natural diseases. So the same thing which we are describing about the pathogenetic power, he's saying that none of these observers, they understood this thing, that this disease producing power of these poisons is the same power by which they can cure the similar symptoms when they are occurring naturally. If someone is having that kind of lesion in the stomach, in the esophagus, in the mouth, coming naturally, some kind of cancer, some kind of necrosis, if the symptoms are similar, then these poisons, when given in small doses, can cure those symptoms, can cure those diseases. That these their pathogenetic phenomena were imitations of their homeopathic curative action. That this whole pathogenetic phenomena, the pathology which they are producing, are the intimations of their homeopathic curative action. That when they will be given homeopathically, in a similibus currenter way, they will act as curative on the patients. And that the only possible way to ascertain their medicinal powers is to observe those changes of health medicines are capable of producing in the healthy organism. And the only way to see this power is to understand, to learn all these symptoms which are being produced in the healthy organisms by these medicines. For the pure peculiar powers of medicines available for the cure of diseases are to be learned neither by any ingenious a priori speculation nor by the smell, taste, or appearance of the drugs. We cannot understand about the medicine how it smells, how it tastes, or by the appearance, or by some kind of speculation, nor by their chemical analysis, nor yet by their employment of several of them at one time in a mixture. If we are mixing the medicines and giving it to someone in the disease state, we cannot understand from that state. By doing the chemical analysis of sodium chloride, we cannot understand the symptoms which natramure can produce. By smelling or tasting the calcium, we cannot understand the symptoms or the kind of diseases the calcarea carb can cure. It was never suspected that these histories of medicinal diseases would one day furnish the first rudiments of true pure materia medica. So the histories of medicinal diseases, the diseases which the medicines produced. Mercury was being given for gonorrhea. There were some other symptoms which the mercury was producing on the patients. Sulfur was being given for the rashes or some skin diseases, and it was producing some symptoms internally in the patients. So Dr. Hahnemann is saying that this history of medicinal diseases caused by the medicines, that no one suspected, no one even thought about it, that it will one day become a rudiment, the stepping stone for the true pure materia medica, which from the earliest times until now has consisted solely of false conjectures and fictions of the imaginations. All the materia medica is saying that which he had at that time, all the materia medicas, he's saying that it is basically full of fictions and conjectures, theories which were imagined, speculations which were imagined, that is to say, did not exist at all. So he's saying that till now, no pure true materia medica has ever existed. Again, many times, like I have, when we started with the organon, I said that try to understand the emotion behind the organon. If we read these 3 or 4 aphorisms casually, someone uses, without understanding what is behind it, if we just read it casually, superficially, it might appear that Dr. Hahnemann was a very haughty person, very self person, pompous person who had self importance, and he thought that I am the only one who knows, no one else knows. That kind of person. Some might even think that he might be platina or veratrum album. But when you go behind this thing, that is what Dr. Kent writes about. Okay, when Dr. Hahnemann's children were sick, it produced humility in him. He became humility, not humiliated, but there was a humility that I don't know anything how to cure this, how to cure my children, how to cure my patients. I don't know it. So that state of not knowing, like we always talk about that when you want to understand something new, when you want to understand some patient, we have to go to that state of not knowing, that I don't know anything, what to do. Then the real knowing starts. So whenever his children were sick, whenever his patients were sick, his relatives were sick, he was so tired of using every method, everything. And he came to that conclusion that I don't know what to do. I don't have anything to do. I have become a doctor. I have a good practice, but I don't know what to do. I cannot cure. I cannot give relief to the patient. Let alone the patient, I cannot give relief to my children. They are getting sick. So from that tiredness, from that humility, from that state of humility, he has gone to a state, from where he didn't knew anything to that state of knowing everything. So that journey gave him the boldness to speak the truth. His courage came from the truth. All that this thing which he's saying, that no true materia medica has come till now, there is no true pure materia, that was the boldness to speak truth, that there is none. Understand this thing. People took it in the wrong way. They took it in a way that he is basically a critical person. He was just simply telling the truth, that no one has ever thought of this thing earlier. No one has ever done this thing earlier. Where someone has thought about it, he has given the proper reference of that person, that except me, he is the person who gave this thing in the preface to this. He has given proper reference of all the doctors wherever the observations before him were seen, in chronic disease also, in the organon also. But what was not there was not there. It was not there. So his boldness, his courageousness comes from the state, because he has gone through that journey. He has gone through that journey, and when he found it, he was happy to share it with the whole world. He was happy that when now we all the physicians, if we can understand this thing, we can cure the patients, not only manage. The true cure can come, where a patient can be healthy. But still, when there was something, people would say him to be a critical person, to be some many things were said about him. So that would hurt him again and again. That I am why you have closed your minds, why you have become so much opinionated. What difference will it make? For example, if you will try homeopathy, the worst thing can happen is that medicine will not work. That is the worst thing which can happen. Nothing more can happen. But think about the best thing which can happen, that the patient can get cured. So this was his thinking process, from where all these things were coming up. So we have done today till aphorism 110. Next time we will continue from 111. So any questions, if there are, please do send that to Dr. Jonkol or to Dr. Rishabh, or in the group also, and we can talk about it next time. So thank you, and have a very good night and a good day. But we'll start from where we have left. We have left at aphorism 92. So we'll start from aphorism 93. I think we will do up till aphorism 100 today. We'll complete 100 aphorisms today, because after that, it will be about this. Just a minute. Okay. Because after 100, the case taking or the understanding of epidemic fevers or epidemics will start. So we will do it next time. We will not do it today, but today we will do about what are the more points which we can ask in the case taking in the chronic diseases. What are the fine things which we have to look for, like the accessory symptoms. So those things which we will discuss today. So let's start with aphorism 93. ऋषभ स्क्रीन हो रही है शेयर?
Yes, sir.
Okay. So if the disease has been brought on a short time, or in the case of a chronic affection, a considerable time previously by some obvious cause, then the patient or his friends, when questioned privately, will mention it either spontaneously or when carefully interrogated. So this thing is about some kind of cause. There has been some obvious cause. When you're taking the case, you're getting some symptoms. Like recently, I had uh, a male patient who was having some problems, some joint pain and some backache and something like this. His wife was already taking medicine from me from past 1 year. She had this cellulitis in the eye, because of which the eye had to be operated, the eye had to be removed, and then it has started on the other side of the eye. So she came to me at that time when the inflammatory process started on the other side of the eye. So this gave me some, because I was asking her that any kind of infections or any kind of some things which you had. So she said she denied it completely. So but I had this thing in my mind that there is some syphilitic process, and that she has been contracted with the that miasm. So because of those symptoms, because of those that understanding, I was giving her an anti-syphilitic treatment which was doing good on her. She was getting better by it. So recently, 2 months back, his husband came to me for the medication and everything, and there were some few symptoms which pointed into that direction. Some that kind of eruptions, the tendency of that kind of eruptions. So in those cases, when there is something going in your mind when you're taking the case, when you're looking at the case, you know that there is some obvious cause for this thing. So we have to ask those questions. The patients or the attendants, they will be more comfortable answering those things in private, when there is no one else in the room. So even in private, when you are asking them, either they will spontaneously tell you about it, or you have to very carefully interrogate it. Like the earlier patient, the first one, the husband of that lady, when I asked him privately that, did you had any kind of extramarital affair, or you have gone to places, did you had any kind of this relationship, or so he denied it first. But then I kept on asking and asking, and he said that, okay, I had a friend, there was this girl, but I never got physically uh, related to her, but I was not ready to accept it. So recently he was uh, because you can see that that there is this embarrassment in the eyes and embarrassment on the face when you are asking that question, so you get that you get your answer. So recently what happened, that he was applying for visa to some country, and there was this mandatory medical checkup which he had to go through. So when he did, he tested positively for syphilis. So there are many things, the kind of questions which the patients are embarrassed about. We have to very carefully interrogate it. We have to very carefully ask about it. But then there many times the patients, they will not, because in some countries, like the countries which are open, like in the Western countries, they tell you very frankly about these things. But in India, especially in India, the people, they don't come out with these kind of answers very easily. So you have to tactfully see through those kind of things. So footnote to aphorism 93: any causes of a disgraceful character which the patient or his friends do not like to confess, at least not voluntarily, the physician must endeavor to elicit by skillfully framing his questions or by private information. So there are many things which the patient might feel, or the attendants might feel, that these things are very disgraceful to tell. So out of that kind of humiliation or embarrassment, they do not give voluntary information to those things. So it is, again, it falls on the physician to how to skillfully frame the questions or tell them about the importance of this information, or from their body language try to understand whether it is a yes or a no thing. you know to these belong poisoning or attempted suicides, like the people who has attempted suicides or who has tried to poison themselves. They or their even attendants, they will not tell about this thing very openly. Onanism, masturbation, indulgence in ordinary or unnatural debauchery, some kind of sexual practices, or excesses in wine or cordials or punch. These are the drinks. And some people, they have this habit or they are taking it a lot, and other ardent beverages or coffee. Any kind of overindulgence in eating. Many times people who eat a lot, or they are also humiliated if they feel embarrassed, they feel bad about telling these kind of things, or in some particular food of a hurtful character, or they are taking some, like some tobacco or something like this. Any kind of overindulgence on smoking. In the past, if they had some venereal diseases, some sexually transmitted diseases, or itch, some kind of unfortunate love, the people, they don't openly confess to these things. Jealousy, domestic infelicity, unhappiness, some kind of unhappiness in the home, from the wife, from the husband, some kind of worry, grief on the account of some family misfortune. There was some misfortune in the family, there was some unfortunate thing which happened in the family. Ill usage, bad usage of something, balked revenge. Okay, there was this desire to take revenge which was not taken, some injured pride, some embarrassment of a pecuniary nature. Pecuniary means related to money. There was some financial embarrassment, like someone had to pay off a loan, he could not pay that off. That kind of embarrassments. Some superstitious fears, some kind of hunger or an imperfection in the private parts. This is again something which most of the people, they don't divulge. Many times in the females also, like they are not happy with their body structure. So but because these kind of causes, they're always there. The thing with your body, whatever you are feeling, when you are looking at the body, if someone is obese, someone is slim, someone is lean, does not have proper we are always, the body is always with us. So any kind of imperfection we feel in ourselves, this is always going to be there. That causation is always going to be there. So all these questions can be asked in private, to the patient privately, or to the attendants, that do they think like this, or do you feel like this. So after that voluntary information, when the voluntary information is given by the patient, by the attendant, and we have taken, asked the question, and the voluntary information is given, now is the time for those answers which the patient does not give voluntarily. A rupture, a prolapse, or so forth. So while inquiring into the state of chronic diseases, the particular circumstances of the patient with regard to his ordinary occupations. Now, next part is that when we are inquiring into the chronic disease, like I always say, that we have to understand the patient in his surroundings, how the patient reacts, how the patient is behaving. It might be something odd for us because we have a different kind of circumstance. But in his surroundings, in his circumstances, how he is doing. So we have to understand the patient in his circumstances. So to know his circumstances, we have to ask about his occupation, his usual mode of living, how is his domestic situations, how is his domestic relations, how does he function socially, how he is around his family, his friends. So all, because all these things, they, for example, there is this patient, one patient. I always ask about his job. How is the job going? He's a very honest person, very decent, very honest person. But he is in a department which is most dishonest, which is most dishonest. There is so much of corruption, there is so much of bribes going on. So now this person is basically in these kind of circumstances. He has a strong will, he has not bent to the demands of the job, but it is taking toll on him. And because it is a government job, he does not want to lose the job or go away from the job. So this job is taking a toll on him. So when we understand the patient in his circumstances, in his surroundings, then we get a more clear picture. Like, if I can understand that, okay, the whole department is like this and this person is like this, I can understand that he is a man of principle and strong will. So he's not a man who will be yielding easily, who will be afraid, or so he's a courageous person who's dealing with these kind of circumstances in his own way. So I get a behavior, I get an understanding of the disposition of the patient, his usual mode of living, how he lives, what he eats, what he prefers, his domestic situations, how are the situations at the family, his job situations, and so forth, must be well considered and scrutinized to ascertain what there is in them that may tend to produce or to maintain disease. Because, like we have done in aphorism 7, that once you have cured the patient, it is also, it falls on us to tell him that what was the thing which were making you diseased, and to remain away from them. Or if there is a disease, the medicine is right, still there are symptoms coming again and again, so you have to tell them that don't do these things, because they will maintain the disease or produce the disease. So that in order that by their removal the complete recovery may be promoted. So we have to tell them that don't do these things. These are the things which are making you sick. In chronic disease of females, it is especially necessary to pay attention to pregnancy, sterility, sexual desires, accouchments mean delivery when they are delivering the child, miscarriages, suckling, and the state of the menstrual discharge. So in females, we have to ask about the pregnancies, any kind of difficulties in the pregnancy, or sterility, if some female she's not able to bear a child, or miscarriages, or sucklings, or their sexual desires, and how is the state of menstrual discharge. With respect to the last named, more particularly regarding the menstrual discharge, we should not neglect to ascertain if it reoccurs as to short intervals or is delayed beyond the proper time. Whether the menses they're coming in short intervals, the time is short, or it is um, prolonged, how many days it lasts, whether it flows, whether its flow is continuous or interrupted flow, coming and going, that kind of flow. What is its general quantity? How dark is its color? Whether there is leukorrhea whites before its appearance or after its termination? Because in many females, leukorrhea is an accompaniment with the menstrual complaints, even in between also, but it is an accompaniment which comes. But especially what bodily or mental ailments, what sensations and pains it is preceded, accompanied, or followed. How she is generally affected by menstrual discharges, how she is generally affected. That is what we need to understand, what we need to know. If there is leukorrhea, what is its nature? What sensations attend its flow? In what quantity it is, and what are the conditions and occasions under which it occurs? So, first about the menstrual discharge, and then about the leukorrhea. Menses and leukorrhea, they basically belong to the genitals of the females, because when these things happen, it is not only one part, only genitals which are affected, the whole female is affected by it. the mind, the body, everything is affected by it. So these are considered as the journals. So these are the physical journals which can tell us about the patient. There is something to, because menses and licoria is something which the once the menarche starts, all those things, whatever is happening, it is happening from so long time. Why Dr. Hahnemann has specifically told about this thing, to ask about this thing, is because the females, they become accustomed to some symptoms, some kind of pain, some kind of mental state during the this thing. For example, I'll give you an example. There was this lady who came to me for around 2 years, and I was giving her medicines again and again for something. She was suffering from rheumatoid arthritis, and I was giving her medicines which were partially acting on her again and again. And I was very much, sometimes there are some patients whom you really want to give comfort, and you can, and the patient also believes in you that you can, but somehow there is always something missing, and the medicine is, you're not getting to that medicine. So that was the case with her. She was so much, she had so much belief in me, and I was also doing my best with whatever I can. And somewhere, you start thinking that why is she not going why she keeps on coming, she's not getting better, she's, some medicine makes her partially better, and then, so obviously, because you there is this time when you think that she should go to some other doctor. You cannot say it, but because she's having so much faith in you, the patient is a, but you feel inside for her that she's not getting better, she should. So that was a state when this thing. So I finally, like I told this time, that when you are not get, this state comes, because I learned from these cases that what you need to do. So I, whatever symptoms I was prescribing on the whole case taking, I just kept it aside, that I'm not, the first thing was that I am not going to prescribe on any of these symptoms which I know. I need to find out something new. I'm not going to prescribe on this. So uh, I started asking about her this menstrual cycle and leukorrhea and everything this. So she started telling me that whenever the periods are going to start, 3 or 4 days earlier, she started forgetting a lot. So this was a very, I said, you never mentioned this thing. She said that I think this is a common character with me. My mother also had this thing. So because of that, she thought that it was a common thing, the people might forget. So these kind of symptoms, for us, it is a very characteristic thing, this forgetfulness before menses. But for her, because she said that my mother also had this thing, so she believed it to be something which is natural, which is okay. Then I'm having this thing from past 20 years, so she was okay with it. So these kind of symptoms, they sometimes remain hidden. So for that, we have to ask so many things sometimes, especially in these things, because the next aphorism 95 is on this thing only, the accessory symptoms. So in chronic diseases, the investigation of the signs of disease above mentioned and all the others must be pursued as carefully and circumstantially as possible. So all these symptoms have to be investigated very, very carefully. And the most minute peculiarities, this red color is done by me. Okay? This is not in the organ, but this has been done by me so that we can understand the part. The most minute peculiarities, the peculiarities which are very minute, so minute that the patient does not feel that to be some kind of symptom, must be attended to. Why? Partly because in these diseases, they are the most characteristic and least resemble those of the acute diseases. And these peculiarities are not that kind of peculiarities which come, minute peculiarities which come in acute diseases, which we can ignore away. And if a cure is to be effected, they cannot be too accurately noted. partly because the patients become so used to their long sufferings that they pay little or no heed to the lesser accessory symptoms. The patient has been suffering, or that has been a part of the body of the patient for, from so long that they don't care about that symptom. No heed to the lesser accessory symptom. They don't pay any attention to the symptoms, which are often very pregnant with meaning, very characteristic symptoms, often very useful in determining the choice of remedy. So because these symptoms have always been the part of the patient, they have always been, right from the beginning, right from the childhood, right from the menarche, right from the teenage. They have always been the part of patient system. They have always been the part of that surah, very characteristic part. But because they have been suffering from that from so long, so somewhere the patient starts feeling that it is me. But okay, it is, like someone who is, having diarrhea in the morning from childhood, and now he's 35, 40 years old. He will not tell that the first motion which comes in the morning is a very loose motion. It's like a diarrhea. They will not mention it. When we ask about the characteristic of the stool, if we ask them that, okay, do you pass the stool? You'll say yes. Okay. If we stop there, that information is gone. We have to ask that what kind of stool it is. Is it a formed stool? It is a diarrhea, or it is a hard stool. What kind of stool it is? Then he will mention that it is like a loose stool every day. But if we get that information that every day, we can think about remedies which have that morning diarrheas. We can think about sulfur. We can think about some other remedies. And regard them almost as a necessary part of their condition. They have always noted that this is a part of my condition. It is part of me, almost as health. They don't take it as a diseased symptom. They don't take it as a diseased phenomena. The real feeling of which they have well nigh forgotten in their sometimes 15 or 20 years of suffering. They have forgotten that thing in the so long suffering. And they can scarcely bring themselves to believe that these accessory symptoms, these greater or less deviations from the healthy state, can have any connection with their principal malady. And they will not believe that these symptoms are important. I don't feel that this is an important thing. They don't, because they are looking at those symptoms as health. My mother had this, I am having this. So this is not something which is, uh, a disease thing. Many times the people whose father had some kind of itching on the leg, or their grandfather had, they will not even tell about that itching. One of my patients, he had dermatitis on the legs. He was taking medicine from me for 8 to 9 months, and he mentioned that itching after 8 to 9 months, because at that uh, in that weather it got aggravated. So they don't think of these things as an unhealthy state. They have been part of them. But these are very important because they are very characteristic. They have always been part of them. They have always been the part of disease. They have that characteristic thing which can tell us about the surah. But we can only get them when we are going into that minutest of the details of everything. Then only we can get those things. If we are just taking the case superficially, then we will always miss those things. So always look for these accessory symptoms if you find them. One of the patients, again the same with that, as it was with that lady. He was taking the medicine. He had this kidney disease, some uh, autoimmune kidney disease, and he was taking medicine from so long, and you would get better, get worse, get better, get worse, like this. Then one fine day, I started again like this. I started asking about the perspiration and this, and then he said that usually I don't get perspiration. He said I have this perspiration which is very profuse. It does not smell, it does not stain, it is on the head, and it is profuse whenever it is, like. So I said that, okay, when do you perspire more? He said, when I am eating food. I said, again, it is a very characteristic thing. Eating food, yes. He said, I only perspire this much when I'm eating food. I said, when the food is chilly, like it has more spices or something like this. He said, no, even normal food, even without spices, without this thing, like, he said that when there is uh, some religious celebration in the house, we make this food without spices. So even if I eat that food, I start perspiring. So again, a very characteristic symptom, but because it has been always the part of the patient, he never mentioned it. He never described it. So beside this, patients themselves differ so much in their dispositions that some, especially the so-called hypochondriacs and the other persons of great sensitiveness and impatient of suffering, portray their symptoms in too vivid colors, and in order to induce the physician to give them relief, describe their ailments in exaggerated expressions. So then there is this class of patients who are hypochondriacs, who are who are very sensitive to the sufferings. They're very impatient to get better. So sometimes they describe their expression in an exaggerated sense. I always give this example that, this pain is something which cannot be measured. There is no scale for the pain. It is always a subjective feeling. Like we ask the pain, okay, someone got a prick here in the hand. If you ask one person, okay, out of 1 of 10, how much pain you are feeling, he will say 2 or 3 at the max. To the other person, you give this prick, you will ask someone like Chamomilla or Naxwamika that how much pain is there. He said, oh, 9, 9, 10, 11, 11. It's the same prick. So the pain is basically noted or described because of the sensitivity of the patient. So the people who have more sensitivity, they will exaggerate the expression so that the physician becomes serious about it, to give them relief. So what needs to be done in these kind of patients? Footnote, a pure fabrication of symptoms and sufferings will never be met within hypochondriacs. The thing with hypochondriacs is that they are not feigners. They don't feign the disease. They don't fabricate. They don't make the symptoms. There are symptoms which they feel to be very much painful. The way they tell those symptoms, that way is exaggerated, that expression is exaggerated, but they are suffering. There are symptoms. A comparison of the sufferings. Now, how we can see is, even in the most impatient of them, even the most impatient hypochondriacs, they will not fabricate the symptoms, which can be seen. How we can see this? A comparison of the sufferings they complain of at various times, when the physician gives them nothing at all or something quite unmedicinal, proves this plainly. When you give them placebo, when you give them SL, their symptoms remain like this. Same. The people who are feigning, or the people who are into that, state, some kind, they will start getting better because they wanted the attention of the physician. They wanted him to change the remedy. They wanted him to give some remedy. So as soon as you give them the SL or placebo, they will start getting better. So this proves this plainly. But in hypochondriacs, the symptoms are there. Yes, they are exaggerated. The patient himself is very sensitive. Their expression is, you know very violent kind of, but the symptoms are there. Proves this plainly, but we must deduct something from their exaggeration. What we can understand from their exaggeration is that at all events ascribe the strong character of their expressions to their excessive sensibility, in which case this very exaggeration of their expressions when talking of their ailments become of itself an important symptom in the list of feature of which the portrait of the disease is composed. So this feature being hypochondriac, the way they are expressing this excessive sensibility, this excessive sensitivity towards the pain, towards the suffering, this in itself become a very important symptom. We cannot give them the remedy which are not expressive, or which are more controlling of themselves, which are, we cannot give all those remedies. We cannot give those remedies which are indifferent to the pain, which are more bearing, more strong willed. We cannot give them. So this itself becomes an important symptom. The case is different with insane persons and rascally feigner, dishonest feigners of the disease, who are just feigning the disease to get an attention. So in those cases, if you give the SL, if you give the placebo, they will start getting better. The symptoms will start getting better. So from there we can see that this is not a hypochondriac patient, but more of a feigner or more of a attention seeking person. Other individuals of an opposite character. Now there are hypochondriacs, and then there are completely other people, you know, other individuals of an opposite character. However, partly from indolence, either they are indolent to tell the things, that he's asking so much. If I answer, he will ask more. So they are indolent. Partly from false modesty. They don't want to disappoint the doctor. They don't want to, you know, how are you? Yes, yes, everything is good. Good, good, doctor. We have come to you now, so there is no problem. Everything is good. So they don't want to upset the physician. So from that false modesty, from that false kind of humility, humbleness, they will not tell the problems properly. Partly from kind of mildness of the disposition. Sometimes the people are mild, sometimes the doctor, if asks in a tone like this, how are you? So, because of the mildness or some timidity, they will, become afraid. Yes, I'm good. I'm good. Yes, everything is good. Or from weakness of mind, they are not able to understand. They don't understand that these symptoms are important. Many times, when you ask the patient, okay, how is your appetite? It is good, it is good. I just have these problems. My appetite is okay. So they don't understand that the kind of appetite is, the symptoms we need. That we are not asking about his appetite as a problem. We just want to know how his journals are. So from that kind of weakness of the mind, they will not mention, they cannot describe the aggravations or ameliorations. So they don't give you much history. These kind of individuals, they are quite opposite to the hypochondriac patient. Refrain from mentioning a number of their symptoms, or describe them in vague terms, not in very clearly description of the symptom is not given, or allege some of them to be of no consequence. Like I told you that it is of no consequence, it has nothing to do with my disease. But they need to understand that these symptoms are important for us to find a remedy. So many times we have to work on the patients before even starting the case, that whatever this we are asking you so that we can find a remedy out of thousands of remedies, which is basically similar to your behavior and to your, because this is the causation of the disease. So until unless we go for the causation of the disease, we don't cure that thing, the disease will keep coming. So we have to spend some time, 10-15 minutes, to make them understand the importance of this thing, case taking. Now, as certainly as we should listen particularly to the patient's description of his sufferings and sensations, and attach credence especially to his own expressions, wherewith he endeavors to make us understand his ailments. So, Dr. Hanaman is saying that we have to certainly give this, like I was talking on the when we started this thing, case taking, that the subjective symptoms are important, because the subjective symptoms only the feeling of the patient, the suffering and the sensations which he's feeling, that can be only told by the patient. It cannot be told by the friends, it cannot be told by the attendants. So we have to also keep a note. If some attendant is saying that his headache is like bursting headache, he cannot say that thing. He does not know about that thing, whether it is bursting, whether it is pulsating, you know So we have to be very careful. We have to be very uh, aware that from where we are getting the information. Subjective symptoms cannot be taken from the attendants. They don't know about it. They can tell their experience with the patient. They can tell about what they feel, what they see, but they cannot tell what the patient sees or feels. So subjective information has to come from the subject. That is the only way. Even as a physician, I cannot understand the feeling or I cannot guess it. So that will be a guesswork. There are some doctors who do this thing, and I always tell some the students or wherever I go that don't fall for those things. They look amazing, but they are not at all of practice. Like many doctors, they nowadays there are some schools who are telling the students or the doctors to prescribe on the delusions, that the delusion is a state of mind, a feeling of a mind. I came to know about their one of such case, that there was this lady who had this uh, cerebral palsy child, and then she had two child before that cerebral palsy child who were normal. So she belonged to uh, she was not very good financially. The family was not very good financially. They are laborers, and they do work at with a daily wage. So with that, she's upbringing the children. She's going to her job and doing that hard work and taking care of the child. So this doctor who was going to prescribe, he said that her feeling, uh, I cannot remember, sorry, that she's feeling uh, wretched. That her delusion is that. So he took the rubric delusion, wretched she is, because she's suffering so much. In her class, that class of that economic class, everyone is suffering. Everyone is suffering. But taking this kind of delusion and then prescribing on that thing, okay, everyone who is standing around that doctor, the student, they go into a state of awe. Wow. But what she's feeling, she can only tell. How can I say how she's feeling? Even right now, what I am feeling, no one can tell that thing. That is a subjective thing. If I say that I feel wretched, so even then I have to understand the patient in that circumstances, like in the organ is told. Understand the circumstances of the patient. That yes, in that economic class, with that thing, everyone is feeling that thing. So everyone is the same remedy. No, how it can be? Delusion has to come from a state of delusion when it is not a reality. That is the reality of that economic class. Delusion is something that I am doing very good, but still I have that state, like Bryony or Suriname. That state of poverty, although having so much of money. But so delusion is something unreal. Her reality is that she is suffering. That is the reality of the patient, of the person. So making these kind of assumptions have taken, this is basically a very dishonest representation of the case, and it only demoralizes the doctors and the students because they are not going to get results by this way. Obviously not going to get results. But that demoralizes that, oh, I'm maybe there is some problem with me. No, there is no problem with the student. I always tell that you don't have any problem. Even your teachers, if they are not able to tell you the right thing, it is not their problem. The problem was the guidance which was given to them. That was the problem. The problem was what was told, the knowledge which was shared. So never, even there are some students who are here along with the doctors. So I always tell you that never, don't take it that there is some problem with you. No, you just have to go and try to understand the things in a right way. They're very clearly written that the suffering and the sensations of the patient can only be told by the patient. So that is the only source of subjective information. Because in the mouths of his friend and attendants, they are usually altered and erroneously stated. Friends and attendants are the second source which can tell, but the subjective symptoms, the sensation, the sufferings of the patient, they will be altered, they will be erroneously, mm, wrongly stated. Physician is the third source, even after the attendants. So if the second source is erroneous, how can the third source be right about this thing? So any subjective symptoms, when you are writing it down, don't write it from yourself. Don't, you know, guess it. Let it come. If it comes, good. If it does not come, even then it is good. Something else will come. So certainly, on the other hand, in all diseases, but especially in the chronic ones, the investigation of the true complete picture and its peculiarities. So whenever we are investigating the true picture, that is why there are false pictures of the chronic diseases. The case taking, which will be done, like I told you, in an erroneous way, in an altered way, in a wrong way, that will not be a true picture of the disease. So when we have to investigate the true picture, we have this desire to go and know the truth of the disease or the picture of the disease. Then there are some peculiarities and there are some demands from the physician. To get a true picture, there are some things which are required of the physician that physician has to remember whenever he or she is taking the case. What are those demands? Complete picture and peculiarities demands special circumspection. The first thing is circumspection. What is circumspection? It is carefulness. Being very careful what I am taking, whether I am taking it right or in a wrong way. And unwilling to take risks. Unwilling to guess. Unwilling to speculate that this is the thinking of the patient. So we have, for the first point for that true investigation is to be circumspect, very careful that whatever I am taking is as it is told by the patient. Then tact, skill, you know, try, the same question should be, you have to have ways of asking the same question in different ways. The same question has to be repeated again and again in different ways, but not in the same language, not in the same way, but different ways. Knowledge of human nature. What is the human nature usually? How the ego behaves. Like we have talked about this thing in the recent uh, workshop on observation, when we have talked about that, the shadow theory and about this pain and pleasure theory principles. So we have to understand how the human nature basically works. We are human nature. We, when we look at ourselves, how our nature is working, how we are, throwing our bad, what we think to be the bad qualities into a shadow, and trying to project something. So we must know about the human nature. We can understand human nature more better on us, how we are reacting. That is why I always say, because it is a requisite, it is what is demanded. We have started with the organon recently, but I have been telling this thing from so many, whenever I have gone anywhere, I have always told that try to understand yourself, because the more you understand yourself, the more you will understand about the human nature. You are human nature, and understanding that thing is basically a requisite. That will make you more observant about the things. You can understand why the patient is reacting in this way. Why the patient is behaving in this way, why he is not telling me something, why he is telling me something, or what he is telling through certain signs of his body. And even Dr. Henman says that it is a very, very important to know about the human nature. Caution in conducting the inquiry. What kind of questions I have to ask, what I should not ask, or the way I should not ask. Like the direct question should never be asked, where the answer is yes or no. Those kind of things should not be asked. Some questions should be asked privately. Some questions the patient will be more easy or more willing to tell when there are two or three people there. So that kind of caution, that kind of tact we have to develop, and patience in an eminent degree. Impatience is a bad thing in a physician. It has to be very, physician has to be very patient while taking the case, in prescribing, in an eminent degree, in the highest degree. The patience should be there. Although we call the patient a patient, because he has to be patient, with the suffering. But on the other hand, the physician has to be very patient. Because if you are in hurry, then you will miss all the information. You will take the patient where you want to take him. If you have lycopodium in your mind, you will take the patient to the lycopodium. Okay, you like hot food? Yes, everyone likes hot food. Okay, so we will take the patient towards that kind of thing. If there are patients sitting outside and you're in a pressure, okay, I have to see very fast, that will impact the result. That will, if you think that today you are in a hurry, tell the patient to come, give some other time, tell them to come in the evening, tell them to come tomorrow. Because when an inquiry is to be done, the inquiry is being done to find out the true picture of the disease. That we have to keep in mind. If we can find the true picture of the disease, we can find the right remedy. So all these things, they have to be there for a good physician to find out the true picture of the disease. Aphorism 99. On the whole, the investigation of acute diseases, or of such as have existed but a short time, is much the easiest for the physician, because all the phenomena and deviations from the health that has been but recently lost are still fresh in the memory of the patient and his friends. So the investigation of acute disease is more easy. Why? Because the phenomena has started recently. Whatever deviations, whatever the symptoms in the health have come, they are very much fresh in the patient's memory and in the memory of his attendants. Still continue to be novel and striking. Now, I have seen many. I just want to add something which I have noticed. I have met many physicians, many students who have become physicians also now, many physicians otherwise also. Some physicians, they're very good, or they're better in prescribing in chronic diseases. And there are some physicians who are better in prescribing in acute diseases. Like one of my colleague, he is good in prescribing in chronic diseases. But he always say that, whenever there is something acute, I cannot find the remedy. I cannot find the right remedy. Many times he will call me, or many times he will, send the patient to me that, okay, you have a look at him. So I started thinking about then these aphorisms. The thing is that we have to switch gears between a chronic case and between, if a patient, if a person, when for example an acute case has come, from 2 3 days something has started. So like what I find in that one of my colleagues, that he will start taking the case from the whole point of view and will start searching for the symptoms, or even in the acute part he will keep asking for what symptoms, this thing and this thing and that thing and that thing. That is not to be done in the acute cases. That is the mistake. Then you will get confused. Recent phenomena, whenever it has started, just take the case from that point onwards. Whatever you find, 2 symptoms, 3 symptoms characteristic, just prescribe on those symptoms. Then there are many people who are like this, they have this, they don't have many, one of my students, he does not have much patience, he prescribes very quickly. So he does thing very good in acute, but not in chronic ones, because chronic case taking or investigation, it requires time. It requires the patient, because you have to have a mind which can go through that maze which has been created from so many years and then find out something. So the people who are impatient, or the physician who is impatient or does not have, is not laborious, he does not have this thing about, that I cannot put so much effort in that thing, they basically don't do good in prescribing in chronic diseases. So we have to be both way, we have to be, malleable according to the circumstances. If there is an emergency case, the patient is not going to have much time, we cannot sit for 1 hour 2 hour taking his case. We have to change the gears, we have to adapt accordingly. Aphorism 3, we have to adapt according to the situations, we have to adapt our knowledge according to the patient. So this adaptation is very much required in a physician. The physician who can adapt easily can see all kind of cases and have very good results in all kind of cases. You just have to adapt, that is more important. So the physician certainly requires to know everything in such cases also, but he has much less to inquire into. Don't inquire more into the acute cases, inquire in a less manner. Less manner means just about this phenomena, don't go beyond it. They are for the most part spontaneously detailed to him. And this acute cases, they don't require long case takings, because the memory is fresh, phenomena is happening, the patient can tell you about the striking features, how it started, how it is going, about the thermals, about the thirst, about the behavior which has changed in himself. That can be very spontaneously detailed. So don't go past it. But when you have to go past it in a chronic disease, then don't go small, then go in detail. Take your time, ask about everything until and unless you are very much satisfied that yes, we have got symptoms on which we can prescribe. So we will finish at 99, because I think from 100 onwards it will be about the epidemic diseases. So we will talk about it on next Wednesday. Again, please go through these aphorisms. Any questions you feel regarding the case taking, I have told you that we will discuss about Dr. Kant's case taking also. Maybe we'll do it in some later sessions. I will take some points out of, because he has 3 chapters on the examination of the patient. You can also go through it. Please go through it. I will uh, request you that you go through it. There will be more clarity, and we can talk about some points from that part also. Because there are every author, every philosopher has written on the case taking. There are their own experiences which they have introduced into the case taking, which is given by these aphorisms which are given by Dr. Hahnemann. Like Dr. Kent introduces one thing into the this part, that never take history from the attendants, out of the attendant, never take the history from an emotional attendant, because they will give you a perception of theirs. For example, if you are taking the husband's history from the wife, the wife has a perception of husband, that he is this kind of person, he never listens to me, he does not take me out, he's a very selfish person. So that is a common perception. So if you take that thing and prescribe accordingly, then we will be at a very wrong end of the medicine. So these kind of experiences, they are added. I told you mine, what I have noted. So all these, then you will have your own experiences also when you are taking the case. They are also added. So it is an unending knowledge. All these experiences they are adding and adding and adding, and they are making so beautiful pictures. So the more we go into it, the more we learn, the more we practice it. After you have taken 50 cases, 100 cases, you start think, getting a grip on it. You start getting a grip on the changes in the case, the way you are taking the case in all those cases, the way you have to mold yourself, the things which you learn on those cases. Because homeopathy is a very practical science, so the learning has to be very practical. It cannot be theoretical thing. It has to be a practical thing. For example, there is I'll just show you a recent we had a camp. So there was this boy. I'll just show you and how small things basically uh, can lead to the remedy. Very small thing, but it is a characteristic thing. Just look at his eyes, and we will discuss that about the eyes. Just look at his eyes. इधर देखो. What can you say about his eyes? He's a case of autism. You can write in the chat also whatever you feel about him. Yellow. See the eyes. I think he was around 2.5, 4 years old boy. So what can you feel? What can you see in the eyes? There is one message. Shining smart eyes. Very, very nice. Yes. Can't focus. Yeah, because he's basically the children, they don't have that kind of focuses, and he's basically an autistic child. So the focus is always a problem. Dr. Jonkol has written shining smart eyes. Very good. One thing is that very shining eyes. Very shining eyes. Any characteristic of shining basically shows a strong intellect. But then there is much more to the shining part. Yes, I can say that the when we saw it, I was having some of the doctors and students with me. Dr. Rishabh was there, and there were many students also. When I told about this characteristic, I think the video is not doing that much. Uh, you know, uh, the video does not show that thing very strongly, but if you can, still it shows it. The color of the eye, they are black eyes, but they were so dark black. I have never seen such dark black eyes. Even it was very difficult to see the iris in those eyes. And it is not because of any kind of opacity, any kind of this thing. He can see well. But the color of the eye was so dark black that even you cannot see the iris through it. So dark black and shiny eyes. These are the eyes of snake remedies. The snake remedies usually have these kind of eyes. Very shining and very dark. Dark discoloration, the darkest of the discoloration, they belong to the not discoloration, even the colors, they belong to the snakes, but not in the communities who are usually dark. Don't take there. But where it is not expected to be. Even the mother had very light eyes. The father does not have that kind of eyes. He had that kind of eyes. We forget we should have taken the eye this of the mother also for the comparison. So when we were in the camp, I told all of them that okay, have a look at all the black eyes, even the children, even the adults, and then compare this blackness to those. Usually, the children who are suffering from some kind of behavioral disorders, or they have that blackness, but a dull blackness. The blackness is dull and not that dark blackness. So even smallest of the things in the case can tell you about the patient. So this comes when you keep practicing on the case taking, when you know what you have to look for. That is the most important thing. You must know what you are looking for. You're looking for something which is characteristic, which is something different, which is something unique, uncommon, striking thing. And when you get those striking things, those uncommon things, those characteristic things, you are ready for giving a remedy. There is one more message. Doll's eyes. Okay. Yes. Mm, many dolls have those kind of eyes. They are very dark. So with that, I will take your leave. Thank you so much. And if you have any questions, we can talk about them. Just send the questions to either directly to me, to Dr. John Cole, to Dr. Rishabh, anywhere, wherever you feel comfortable. You can send your questions and we can discuss them. Thank you. Thank you so much and have a very good night. A very good evening to all of you, and good morning to the people who are in the other time zones. So today we have come here to start our this classroom series on the subject of the organon. So first of all, I would like to address something that why we had this need to start this organon class. I have been going to different countries from past, I think 11 or 12 years, and meeting many doctors. And when I talk with them, there are so many questions which the doctors they basically ask me about different kind of things, about the prescriptions, about how we have to see what is important in a case, or why we should give a single dose, or why there should be one single medicine, or then there are very other kinds of questions like regarding many things, many other concepts of homeopathy. And I realized that there has been one thing, you know, because all the doctors who I have met in the other countries, there was very common thing that most of them have been practicing some other science, some allopathy or some other natural sciences or something else at one point of their life, and they decided to turn to homeopathy, to start practicing homeopathy or start searching for some answers in homeopathy. And I have seen in almost all the doctors this thing. There are two basic reasons why most of them turn to homeopathy, which I have found. The first reason, which was almost there in all of them, was that the same reason why Dr. Hahnemann basically changed from his allopathic practice to the homeopathic practice, why he discovered homeopathy, Dr. Hahnemann. That was the same reason which I have found in most of the doctors whom I have met, that they were not satisfied with the results which they were getting in their practice. There was this doctor in Brazil, a lady doctor. She used even the word that when I used to go to the clinic, I even feel embarrassed, meeting my patients because I don't have any cure or answer for them. She was, I think, a skin specialist. And she said that I stopped practicing medicine until I was introduced to homeopathy. And then I started practicing again. So it was the same reason, that which pushed Dr. Henneman to discover homeopathy. And the second reason, which I have found in the doctors who wanted to practice homeopathy, was that they wanted to go into something which could have solution, which could have answer to the existing state of medicine. So when I will see these people who were full of that passion to do something in their life and still have very these queries which were hindering them from achieving what they wanted to do. So this idea of starting this organon class was going on from past 1.5, 2 years. But then there is a time for everything, because what organon basically helps us with is, we will go through in the coming slides one by one. We will go through the things. I'm just giving you an overview of why we have started these series, or what was the need for this thing. Because organon basically gives us direction on how to practice homeopathy. We have known how to practice homeopathy from the mouths of different doctors. Organon is basically a mouthpiece of Dr. Hahnemann himself. The aphorisms, the words which are written in the organon, they are basically the mouthpiece of Dr. Hahnemann himself on instructing a physician, a homeopath, that what they should do in order to practice homeopathy. Okay. So, with that said, with that small introduction, we'll directly start with our presentation. Okay, so we'll start with our today's presentation. So we'll start with a quote of Nikola Tesla, a very well-known scientist who was very famous for his beyond time research and beyond time experiments, which are very futuristic in his time. So he gave a very good view of how to find the solutions, of how to see the things. If you want to find the secrets of the universe, think in the terms of energy, frequency, and vibrations. Why I want to start with these words is because these are the things which we will be going through the organon. That if you want to find the secrets of the universe, secrets mean the truth, because truth is always hidden in plain sight. Okay? It is just hidden in our sight. We just cannot see because our mind is basically thinking in different terms. So, if you want to know the secrets or the truth of the universe, you need to think in the terms of energy, frequency, and vibrations instead of in the terms of matter. So, this is a very huge difference in mentality which we have to bring when we are going through the organ. And we will go through, the more we'll go through it, the more you will realize the need for that change. So, we'll start with the organon of medicine. So, organon of medicine, the art of healing. So, first we will start with this word, the art of healing. Why? many authors, even Dr. Kent, even the other commentators who have commented on the organon of medicine, all of them has differentiated between the science of homeopathy and the art behind it. So first we will need to understand why it was called, or why it is called, the art of healing. Science, what is science basically? First of all, science is basically a methodology developed on the base of experimenting and observing. So whenever you experiment on something, whenever you observe something, then we form a methodology. We form a method how to do a thing. Like, for example, I have taken an example about the food items which I have seen in Thailand or in Brazil or India. Like when someone made tam kha gaye or chicken parmesan or some cheese tomato for the first time in the history of cooking, that person basically experimented with the dish. Okay. So he experimented with those ingredients of the dish, that coconut, that uh, lemongrass, that tomato, that cheese, the mushrooms. They experimented it. They experimented with the dish. Then they observed the taste of the dish, the smell of the dish, how it was, and altered the ingredients again and again to make a perfect recipe. So this was the science which they have done. They have experimented on it. They have observed it for the first time, and they prepared a perfect recipe. And then this recipe was passed on to thousands of people. But then the question comes, can everyone make the dish in the same way as the inventor? You go to a restaurant, you see how a chef, how a cook has made a dish. You eat it, you enjoy it, you enjoy the taste, you enjoy the smell, and you ask for the recipe. If the cook or the chef gives you the exact recipe how to make, even then it is not possible to make the same thing, same dish, same cuisine in the same way, because that is the art. So art is basically the application of science. The science is given, the cuisine, all the ingredients, in what measurement they should be put, how much heat should be applied, how for how long it should be kept in the heat. That all is given. The science behind that thing is given. But still we are not able to make it exactly in the same way because that requires art. Okay. So art is basically the application of the science which is given. So science is already given in the organon by Dr. Henneman. So we have already been given the science of homeopathy by Dr. Henneman in the organon. We just have to apply it by practice and make ourselves an artist in homeopathy. The more we practice, the more we become good in this thing. For example, if you give uh, a paintbrush to a child or to even to an adult, he will not be able to make a very good portrait on the first day. But the more they practice, the more they keep doing it, he makes that portrait 50 times, 100 times, 150 times. He starts getting better at it because he knows the science. He just have to practice on that science. So, but an artist has to understand the basic fundamental concepts of what she should do and what not to. So before the application of that science, we have to understand the basic fundamental concepts. We have to understand, if we are a cook or a chef, that the heat should be this much, the flame should be this much, this should be the utensil which should be used, this kind of spices, salt, or other things we have to use. So the basic fundamental concepts we have to know. And then once we know the concepts, once we know the science behind that thing, and we start practicing it, that becomes an art. So now next question is, who is a homeopath? Many times, many patients ask this question. Many times when we go out, these basic questions are at that who, because many times we are questioned like Dr. Jose, Dr. Mara in Brazil and Dr. Jonkol and other doctors in the Thailand, that why do you call your organization Right Homeopathy? Many times this question comes up, that why you call this Right Homeopathy? Do you want to mean that all the others are doing the wrong homeopathy except you? That is not the purpose behind it, and people take it in the wrong way. The word right homeopathy is basically used to tell people that there is something wrong also going on. Everywhere, when they listen that it is homeopathy or he is or she is a homeopath, that does not usually mean that it is basically, or that person is basically prescribing or doing homeopathy on the principles laid down in the organon. Okay. So who is a homeopath? We are not talking about right, but who is a homeopath basically? So a homeopath is not the one who gives homeopathic medicines. Just because a person is giving homeopathic medicine, we cannot say that he's a homeopath. A homeopath is not the one who has a degree or diploma or license to practice homeopathy. Even the person who has a degree or a diploma or he has been given a license to practice homeopathy, he's also not a homeopath. A homeopath is not the one who talks and teaches about homeopathy. Even that person who likes homeopathy, he talks about homeopathy, or he or she even teaches about homeopathy, does not make the person homeopath. What is a homeopath? Who is a homeopath? Only that person can be said to be a homeopath who chooses to cure the patient according to the principles laid in the organon. The principles which we have been given in the organon, which are all easily comprehensible. We can very easy. The main thing about organon is, many times I have when we are discussing some things about the organon with, I'm discussing with some other homeopaths or with some students, you know, um, the first thing which comes is that it is very difficult to understand organon. I will come to that part, why it becomes difficult to understand organon for us. But when we will go through organon now after, we will be doing it every Wednesday. So around in 1 month, we will be going through around 20 or 25 aphorisms.